Good afternoon, Honorable MECs on the platform. Can you please open your videos so we can be able to see if you are correctly framed? Mr. Fora?
Hi, Dumisani. Okay, MEC Masheho is fine. I'm happy the light, though the light is behind, but I think we can go with that. We don't have time. MEC Zondi as well. Should be, yeah, you are okay, sir. If you keep it like that when you are debating, that will be appreciated. I do not see any MEC Kapa. I just see the picture. MEC Makume, just make sure that you don't cut off your head. For now, you are fine. Just be careful that when you speak, you don't cut off your head. Thank you. And then, okay, MEC Zondi, MEC Makume, fine.
Councillor Mahlangu as well.
Is the video on? I don't see Councillor Matlangu's video on.
The video is not on.
Yeah. And then the MEC Kapa as well.
I don't know why I can't show my face. I'm still trying to fix that. But MEC Kappa is 10K.
Okay, Councillor Matlangu, the light is definitely behind you. It makes you look so dark. So you need to turn around and face the light. If you are sitting behind if the window is behind you, just turn around and face the window so that you can be properly lit on the face. That is much, much better, ma'am. It's still not perfect, but it's better. You're not that dark. You're just a little bit washed out, but you're fine. I can do with that. Thanks. Dumisan, I think we are good. It's 2 o'clock now.
MEC Mahlati just logged in now.
MEC Matlati, can you please switch on your video? I do not see MEC Matlati switching on the video.
Good afternoon. I'm still sorting out the background issue. I'll switch on once that is sorted.
Okay. Dumisan, I think I'm done for today. It's 2 o'clock. Bye-bye.
Okay, ma'am. Thank you very much for your assistance.
Recording in progress.
We'll allow a moment of silent prayer or meditation. Thank you very much. You may be seated. Honorable delegates, I would like to remind delegates that rules, in particular sub-rules 21, 22, and 23 of Rule 103 would apply. Today, there'll be no motions or motions without notice. Honorable delegates, before we proceed, I would like to welcome the Honorable Minister of Health, the Honorable Motsoaledi, and the Deputy Minister of Health, and later the Honorable Minister of Tourism, and permanent delegates, all MECs, special delegates, and SALGA representatives that might be in the House, as well as those that are joining us on the virtual platform. Honorable delegates, we shall now proceed to the first order of the day, and that is the policy debate on Budget Vote 18 on Health Appropriation Bill B16 of 2025. I have the pleasure now to call upon the Honorable Minister of Health, the Honorable Motsoaledi, to address us. Honorable Motsoaledi, you have 20 minutes to open the debate. Thank you.
Thank you. Honorable Chairperson, my colleague, Deputy Minister of Health, Dr. Joe Pata, Chairperson of the Select Committee on Health and Social Services, Ms. Desiree Fennis, and members of your committee, honorable members, distinguished guests, MECs in the House and on the platform, ladies and gentlemen, greetings. Thank you for this opportunity, Honorable Chairperson. At a very challenging time in the history of our country, including complex geopolitical events of recent days, I believe this House is eager to hear how we plan to navigate through these complexities. Basically, we have got three main objectives in this budget. Objective number one is to lay a strong foundation in preparation of improvement of public health system of our country, to lay the ground for the national health insurance. And there are people, of course, who believe that we have no plans at all, or we have got no inclination to try and see if we can improve, especially the infrastructure in public health services. We want them to listen very attentively today. Secondly, our objective is to lay a strong foundation and to embark on the journey towards elimination of certain diseases, especially communicable diseases, but not leaving behind non-communicable diseases. Honorable Chair, one of the mistakes we do in healthcare, and I hear a lot about it even from leaders, is to believe that healthcare is only inside the hospital and that certain diseases are here forever and they are here to stay. And we want to differ strongly with that. Our third objective is to try and implement serious reforms in the private health sector. Please ignore those who want us to believe that there is nothing to fix there. We only have to deal with the mess in public health, as they always tell us. Let me come to this issue of health infrastructure. One of the biggest problems that public health system encountered and was severely criticized for is the health infrastructure. The broadside the sector received is exemplified by the encounter at Helen Joseph Hospital in Gauteng. The complainant lodged to the health ombudsman 7 complaints. 5 of them were dismissed because they said there's no problem there. The 2 that were upheld by the health ombudsman is infrastructure and human resources. The 5 that were dismissed as unfounded is clinical protocols, meaning we have got people who have got enough skill, who have got enough knowledge, who are doing the correct things, and they are just being let down by lack of infrastructure. So we need to fix these two that were upheld. For the record, the following new facilities were completed during the financial year 24-25. Number one, Sipeti Hospital in Eastern Cape, Lady Smith Clinic, KwaZulu-Natal, Henning Flate Clinic in Northern Cape, Buchebuch Clinic in Northern Cape, and Bangara or Budulon Clinic in Northern Cape. Additionally, during the reporting period of 2024-25 financial year, 47 existing clinics and community health centers, as well as 45 hospitals, were substantially revitalized, while 403 public health facilities were maintained, repaired, or refurbished. The following new and replacement hospitals are already under construction, representing a significant step in strengthening the public health system and improving service delivery in provinces. In Limpopo, we are constructing a central hospital. As you will know, throughout our whole democracy, we had only 10 central, or what you call academic hospitals. One is in the Eastern Cape, one in Free State, 2 in KwaZulu-Natal, 2 in Western Cape, and 4 in Gauteng. And there is none in 3 provinces. There was none in 4 provinces rather. Limpopo, Limpopo, Northern Cape, Northwest, and Mpumalanga. Now the Limpopo one has started and is at 26% construction. This is going to be a flagship hospital for the whole province and for the Faculty of Health Sciences, which has just recently established a medical school at the University of Limpopo. Now, the other hospitals that are under construction is Sulum District Hospital in Vembe, which is 90% completion. The Tlhabeng Regional Hospital in the Free State, which is at 30%. Bambisana District Hospital in the East Cape, which is at 82%. Zitulele District Hospital in the Eastern Cape, which is at 50%. And Bophelong Psychiatric Hospital rather, under construction in Northwest. In addition to the hospitals currently under construction, the National Department of Health has prioritized several key projects placed strategically to strengthen South Africa's public health hospital network, particularly in high demand areas like Gauteng, but also in underserved areas which are mostly rural. This includes 17 major hospital projects which have been identified for development, and they are at various stages of design and development. The biggest of these huge projects are a total replacement of 3 major central academic hospitals. Number one is Dr. George Mukhari Academic Hospital under Sefako Makhatu Health Sciences University in Gauteng. It started long ago, but it was never built. They were using a district hospital. The second is Nelson Mandela Academic Hospital under Walter Sisulu University in Mthatha. Also started many years ago, but was never built. The last is Victoria Mxenge Hospital, formerly known as King Edward VIII Hospital, under University of KwaZulu-Natal in KZN. It also was never built, and we want to do so now. We wish to add 3 new central hospitals or academic hospitals that exist, that do not exist and have never been there before. Number one is Mpumalanga Academic Hospital. You know, they've just acquired the university, but we're planning that in future, they must get a medical school also. And the second is Northwest Academic Hospital. They've already started the medical school, by the way, in Northwest, but there's no academic hospital there. We'll need to build it. And the last one is in the Northern Cape. These 3, in the 3 provinces where there was none, are still in the very early stages of planning. Their entry into the health sector network will wrap up our academic hospital from 10 to 14. The extreme overcrowding in our public health facilities is caused by rapid population growth and rapid urbanization. Please remember that the public health system is utilized by 86% of South Africa's population, and none of them are in this house today, except myself. You throw in a mix of our neighboring countries. And honorable members, if we do nothing about this situation, I can assure you the scenes you see on TV of pregnant women sleeping on floors and on chairs will be the order of the day, unfortunately. We have got clear evidence of this in Doranginza Hospital, which is always on TV for wrong reasons. Even the public protector went there on her own and agreed with us and said that problem, which people believe is just a problem of management, is a problem of overcrowding. And even the public protector instructed, we need to build new district hospitals in that area. And we are planning to do so. When Bheki Mulangeni Hospital in Gauteng was built, the aim was to relieve Chris Hani Baragwanath Hospital, which is also very overcrowded. I can assure you today that is woefully inadequate. Bheki Mulangeni is already overcrowded. So we need to urgently add many more if we are to make impact. So we are planning a new hospital in Diepsloot District Hospital, new hospital in El Dorado Park, new hospital in Soshanguve, new hospital in Dobsonville or Meadowlands, and a hospital in what is called the Holomisa settlement. We are also on the verge of total replacement of old missionary hospital. Like Elim Hospital, those who know it in Limpopo, was built by the Presbyterian Mission, is completely dilapidated. There is just no way of refurbishing it. And we have got plans together with Chilihini's hospital. It's not a mission hospital, but it was built in the early days of the Venda government. They are totally dilapidated. Fortunately, these two, we have completed everything. We shovel ready. We're just waiting for Treasury to say, here is money, go ahead. And we start immediately. 5 new community health centers are also muted. The Gauteng Community Health Center in Eastern Cape, Kraaifontein in Western Cape, Kwamakuta in KwaZulu-Natal, Katomayana in KwaZulu-Natal, Mitlokong Community Health Center in the Free State. We will include in our program a building of totally new psychiatric hospital in Mpumalanga. This embarrasses us. Mpumalanga is the only province that have never had a psychiatric hospital throughout its own existence. And we believe that must come to an end. Needless to say, honorable members, this project, as you can hear, are very substantial and will take several years to plan, to decide, to construct, and even to commission. We do not necessarily have all the money for this massive infrastructure, but we are speaking with international financial institutions. We've been discussing with Treasury from time immemorial, and we are speaking with all the other financiers. The reason that we are doing so, honorable members, is that if we don't do so, we are going to end in the situation which ESCOM found itself in today. When they were told some years back to build more power stations and they were nowhere put out, our hospital infrastructure is leading to that. This places where we are going to put the hospital is not Samsag. We're not just guessing. We are using a digital system called which utilizes geographic information systems. The system that we are using is called HIPS, or Health Infrastructure Portfolio System. With HIPS, you take geographic information system, you take district information system, you go to Stats SA, you put in the total population in that area, activities, and the system it tells you where to put up the hospitals. So when I'm mentioning all these hospitals, it's not Samsag, it has been informed scientifically by that system. Other measures to strengthen healthcare system. I want honorable members to understand the huge difference between private hospitals and public hospital is infrastructure, as I've said, but also equipment and other facilities. Now, you are aware that health suffered tremendously over a decade, where there were budget cuts, austerity measures. Treasury told us they want to move away from austerity measures in this budget, and that was the beginning. Hence, we've been given 6.7 billion rand this year, and we'll get another next year and the third year, so that we try and get out of this austerity. What have we decided to do with this money? We met with all our 4 provinces and agreed that with this 6.7 billion, we need to hire 1,200 doctors, 200 nurses, and 250 other healthcare professionals. This will cost us 1.7 billion. We also need to acquire 1.4 million articles to make public hospitals hospitable, because that's where our weakness is. We're not hospitable. We will buy new beds, mattresses, pressure mattresses, bassinet for babies, and new hospital linen and towels. Bassinet for babies, members may remember what we once saw on TV, which was heartbreaking. Children being put in cardboard boxes in Northwest because they had no bassinet. We are ordering 76,000 of them for the whole country. This will cost 1.3 billion overall. We also want to employ permanently community health workers who have been in the system for close to 2 decades, some of them for even more than that, and we want to employ 27,000 of them. Lastly, we want to start a journey to pay our accruals. All our 9 provinces owe suppliers a lot of money simply because of budget cuts. And so we want to start a system of paying. We'll start with 3.75 billion rand for this financial year and keep on paying for the next 3 years as part of this budget that the Treasury has promised us. The elimination of certain diseases. Number 1 on our radar screen is HIV and AIDS. You know that there is a plan internationally to bring this disease to an end. It has been designed by the UN AIDS. It's called 95-95-95, whereby if in your country or in a particular setting, 95% of the people who are known to be HIV positive know their status. If thereafter, 95% of those who test positive are put on ARVs and 95% of those who are on ARVs are virally suppressed, when you reach that stage, then you can announce that you have eliminated, not totally eradicated, but eliminated HIV/AIDS as a public health threat. Now, where are we in South Africa? On the 95-95-95 scale, we are on 96-79-94. As you can see, our weakness is in the middle, people on ARVs. We now know there are 1.1 million people in the country, and we know them province by province and district by district, even facility by facility. Those people are not on ARVs. On the 25th of February, we launch a project to start looking for them so that we put them on ARVs. If we find all 1.1 million and put them on ARVs, the 79% will have moved to 95 and will be on the way there. We are working around the clock to do that. In this instance, people thought everything has collapsed when the Americans took out their money through PEPFAR, and we started pointing fingers at each other. Fortunately, we worked with Treasury, which asked us to develop 9 different plans, 1 for each and every province, and 1 for the national, and the last one for researchers. And I'm happy today to announce that out of those plans, Treasury has decided to release 753,528,000 rand, which is going to be divided as follows. 590,407,000 will go to provinces as delivery, different province delivery for HIV/AIDS. 32,121,000 will go to the National Department to strengthen central chronic medication and distribution program, and 132 million will be a first tranche to give to researchers, because 2 international organizations, the Bill and Melinda Gates Foundation, as well as the Wellcome Trust, gave us an offer. They said if they offer us 100 million rand each, and Treasury matches it with 200 million, then they will give that money, and Treasury has agreed. But Treasury said their 400 million to match this will come in tranches over 3 years, and that's why the 132 million rand. Now, because you come from province, you need to understand, out of this 590 million going to provinces, Eastern Cape will get 94 million, Free State 20, Gauteng 94, KwaZulu-Natal 95, Limpopo 69, Mpumalanga 118 million. It just shows how heavily affected they are. Northwest will be allocated 7 million. Northern Cape is not getting anything, unfortunately, not because we are short of money, but because we are financing provinces where PEPFAR was. PEPFAR was never in the Northern Cape because no district in the Northern Cape qualifies to be a high burden district. And Western Cape will be allocated 90 million. As I said, honorable members, we are very eager to bring HIV/AIDS to an end. Hence, we are very excited about the new prospect. There is a new drug in the field, which is likely to reach our continent in December this year. We're working towards that. It's called lenacapavir. It is given 2 times a year per injection. And through research, it prevents HIV/AIDS 100% in young girls and very substantially in their male counterparts. And we believe if all the young girls, all the adolescent young girls of that age, if they are given lenacapavir, then we'll know that HIV/AIDS will be prevented, not treated. And we've been told by Global Fund to give an offer to be the first country to roll out the drug we've agreed. We are putting on plans to roll them out. Finally, honorable members, please accept our allocation of 270,835,442,000. Please accept it, honorable members, and I thank you for your attention.
Thank you very much, Honorable Minister, for your budget presentation. We now move on to the chairperson of the Select Committee on Social Services, Honorable Finis, who has 15 minutes.
Thank you, Honorable Chairperson. In his address at the launch of the first public-private HIV/AIDS treatment site at J.F. Jooste Hospital on World AIDS Day, former President Nelson Mandela expressed that health cannot be a question of income. It is a fundamental human right. These sentiments are the cornerstones of the ANC's orientated towards health, underpinned by the vision of the Freedom Charter, which demands health as a social good intended to improve the conditions not merely of individuals, but of the whole of society. Over the past 31 years since the democratic transition, the ANC remains committed to the vision articulated in the 30 May 1994 policy document on a national health plan for South Africa, where the ANC undertook to transform the health sector with a focus of ensuring that the emphasis is on health and not only on medical care, redressing the harmful effects of apartheid healthcare services, encouraging and developing comprehensive healthcare practices that are in line with the international norms, ethics, and standards, emphasizing that all health workers have an equally vital role to play in the health system and ensuring that teamwork is a central component of the health system. Recognizing that the most critical component of the health system is the community and ensuring that the mechanisms are created for effective community participation, involvement, and control. Introducing management practices that are aimed to efficient and compassionate health care delivery. Ensuring respect for human rights and accountability to the users of health facilities and the public at large. reducing the burden and risk of disease affecting the health of all South Africans. These ANC interventions are imperative because we recognize the correlation between quality healthcare and improved health outcomes and livelihoods. To this end, this budget has prioritized investment in the construction of health facilities, such as the Limpopo Central Academic Hospital, which has been approved for 488 beds. This hospital will be equipped with advanced medical technology and offer cutting-edge diagnostic procedures and innovative treatments. Through this hospital, it is envisioned that specialized services will be improved in the province and its surrounding regions, leading to improved health services, quality of care, and health outcomes. Accelerating the utilization of the electronic health record remains a top priority for preparing for the NHI. Through investing in health technologies, we are enabling integrated and faster services. These interventions will go a long way in reducing errors in patients' records and enabling better tracking of chronic conditions. Through an efficient and highly impactful health system, we will ensure continuity of care for patients, even if they migrate or visit other health care facilities. Their records will follow them. Honorable Chairperson, a crucial area we must address is improving the quality of care provided to patients in medico-legal claims. Medico-legal claims create a ripple effect that undermines the financial investment and quality of care offered to patients. We therefore welcome the government's efforts to address this matter through a panel of experts comprising retired judges, senior medical and nursing staff, lawyers, social workers, and other relevant professionals to assess all medical legal claims and determine fair compensation for those who have suffered medical injuries. On the same breath, we must condemn in the strongest terms legal practitioners, patients, and doctors who collude to defraud the system. Such acts are unpatriotic, and we call on the full might of the law to fall upon them as these groups seek to take away public funds intended for treating the sick. Honorable Deputy Chairperson, strengthening primary health and expanding the number of health facilities that achieve ideal status in the foundation of our health system. Primary health is the first point of care that people access when they are sick or need medical care. It offers critical services, including vaccinations for children, reproductive health services for women, and antenatal care. It is at our primary health facilities where people are screened and enrolled on treatment for hypertension, diabetes, HIV, and TB. It is at these primary health facilities that minor illnesses are treated before they escalate and become life-threatening. As such, as our first point of defense, we commend the targets of this budget to have 2,800 primary healthcare facilities qualify as ideal clinics by March 2026. This budget will improve the quality and safety of care by assessing all provinces for compliance with regulations for emergency medical services each year over the medium term, supporting the strengthening of our environmental health services by assessing 18 metropolitan and district municipalities for compliance with national ecological health norms and standards per year by 2027, as well as ensure continuity of care by ensuring that community health workers conduct 20 million household visits per year by March 2028. Honorable Deputy Chairperson, This budget also makes a critical investment in the Central Chronic Medicine Dispensing and Distribution Program. The CCMDD plays a crucial role in enhancing access to chronic medications and promoting health system efficiency in preparing for the NHI. The CCMDD has dramatically improved the efficiency of our system, reduced long queues in hospitals, and improved patient experience through provisions that allow stable patients to collect their prescriptions from alternative pickup points, such as private pharmacies and other outlets. This is particularly critical as an estimated 40% of the department's clients on antiretroviral treatment use this service. As such, the increased allocation to the CCMDD program set to grow by 4.8% per year from 400.2 million in 2024-25 to 460.3 million rand in 2027-28. Funded through the National Health Insurance Indirect Grant, serves to play a critical role in strengthening the health system. Honorable Deputy Chair, health is not merely determined by clinics, hospitals, or the programs and interventions led by the Department of Health. Social determinants of health are found in various sectors, including the provision of essential services such as quality education, clean drinking water, and decent housing. As such, this implies that someone's socioeconomic status has a direct impact on the quality of care they receive and their prospects for improved health outcomes. People from poor and disadvantaged communities are more likely to experience a high burden of diseases. Unfortunately, one's socioeconomic status matters because some people struggle to afford private health and receive preferential treatment, eat nutritious food, and often they in overcrowded homes where diseases such as COVID-19 and TB spread easily. For these people, their ability to prevent, detect, and treat is compromised due to their material conditions. As such, addressing these social determinants of health requires collaboration with other departments. These include school health programs with the Department of Basic Education, addressing GBVF, and providing mental health support with the Department of Social Development, as well as ensuring integrated human settlements to reducing overcrowding and address waterborne diseases and sanitation issues. This mandates that we not only provide health services, but also drive transformation that will transform the entire society, improve the quality of life and living conditions of our people. Honorable Deputy Chair, health is not a neutral space. It is a contested terrain where beneficiaries of the apartheid regime seek to maintain the status quo and preserve their privilege. They strive to keep the reproduction of a commodified and fragmented society that excludes the majority. As the ANC, our mandate is rooted in the vision of the Freedom Charter, guided by the principles of social justice, equity, and human dignity. For the ANC, the battle for health is a quest for liberation. It is a pursuit to advance pro-poor policies that seeks to dismantle the structural inequities in our society through critical legislation such as the NHI Biala Act and the Employment Equity Act. We are the inheritors of the revolutionary legacy of Charlotte Maxeke, Oliver Tambo, and Winnie Mandela, who declared that people of the nation shall enjoy equal rights and share in the country's wealth. Through this vote, we are carrying the baton towards the realization of the vision of the Freedom Charter. we remain unshaken and vigilant of revolutionary forces that oppose this transformation. Ours is to build a united, non-racial, non-sexist, and democratic country through utilizing the budget as an instrument to advance redress. Through this budget, we aim to address the disease which also healing our nation. And as the African National Congress, we really support this budget. I thank you.
Thank you very much, Honorable Finis. We now move on to the next participant in this debate, and that is Honorable Adriansa. Honorable Adriansa. Honorable Adriansa, you have 8 minutes.
Honourable Chairperson, Honourable Minister, Honourable Deputy Minister, fellow South Africans, good day. I think we are all buzzing after hearing the budget. But I need to remind you the words of the Hippocratic Oath. I will apply for the benefit of the sick all measures which are required. These are words that's profound to every doctor, an oath that every doctor takes. Our healthcare workers live by it. Yet, government doesn't always do that. We are facing a national health governance crisis driven by corruption, denialism, and collapsing accountability. Not only because of lack of infrastructure. Nowhere is this clearer than in our recent response to HIV and AIDS and the withdrawal of the funding of PrEPFAR. This was not just a budgetary loss. It was a collapse of trust. For approximately 20 years, PrEPFAR was one of the most successful initiatives in the history of health. But it saved 25 million lives and injected 7 billion annually into South Africa. It funded clinics, research, and community outreaches. We didn't lose it because we were underdeserving. According to Ground Up, we were witnessing slow motion denialism, a failure of leadership to confront a collapsing health system. Here are the facts of what the PrEPFAR funding did. 8.5 million South Africans live with HIV. This is approximately 12.8% of our population. New infections have dropped from over 500,000 to 178,000 per year. 6.2 million people are on treatment. Life expectancy has increased by 10 years. Mother-to-child transmission is now rare. But these are our concerns if we don't stick to the regime and the regimen that's currently being used and that we heard will continue now. If the progress remains at risk, 220,000 people, including 7,445 children, face treatment disruption. Some treatment has already been disrupted. Patients in vulnerable groups have already been abandoned. If this trend continues, 500,000 avoidable deaths could occur over the next 10 years. And what are we going to do about this? We heard about the money. But will this be used as it should be used? Let's look at the systems up to now. And I want to just remind you of an article that was posted yesterday in Netwerk 24 in die rapport. And what it said is, across the ocean, in the United States Congress, both the Democrats and the Republicans, almost like a GNU, blocked President Trump's attempt to gut PEPFAR in total, securing $400 billion for global HIV efforts. This shows us we don't know yet what we're going to get from it, but at least they stood together. AP News also reported on this, and they called it a victory as a rare agreement in defense of lives. Now, this is the difference between governments that fight for public health and ones that abandon it for political convenience and possible corrupt contracts. Back home, the AG's report of 2023 and 2024 report exposes the health system bleeding from every province. KwaZulu-Natal, 1.15 billion in unauthorized expenditure. Mpumalanga, 1.47 billion flagged as suspected fraud. Gauteng, 2.7 billion in impaired revenue. 589 million in unspent tertiary service grants. Northern Cape, 537 million in undisclosed accruals. Eastern Cape, 22 billion in medico-legal claims. Limpopo, 1.39 billion in irregular spending. Free State, 858 million in unauthorized expenditure, with asset values unverifiable. Still, no one is held accountable. And yet, this is the same government pushing for national health insurance. A system meant to centralize care when it can't even manage its own provincial spending, track procurement, or discipline wrongdoing. This is a moral crisis, because behind every irregular rand, there's a child without ARV. There's a nurse without gloves. There's a lab without funding. There's a pregnant woman lying on a floor. Blacklisting, we are calling for blacklisting and prosecution of corrupt officials and their suppliers. Quarterly consequence management reports tabled to the Select Committee by every province. We have a mandate to the people. We will fight for accountability, dignity of every patient, and the right of every South African to access life-saving treatment without delay, without excuse, and without corruption. I thank you.
Thank you very much, Honorable Adriansa. We now move on to the next contributor to the debate, and that is the Honorable Mthethwa, representing the MKP. I don't know whether the Honorable Mthethwa is on the virtual platform. You are. Okay,
I'm on
go
the
ahead.
virtual platform. Am I audible?
Yes, you are audible. You have 9 minutes.
All right. Thank you, Deputy Chair. Greetings to yourself, greetings to the honorable members in the House, greetings to the Minister. President greetings to all South Africans at home. As said, I'm Dr. Mpigeli Mthethwa. I come from the beautiful province of KwaZulu-Natal. I'm very proud of the people of my province because on the 29th of May, they showed South African the true meaning of unity when they united against the corrupt GNU parties, ANC, IFP, DA, and the National Party in KZN, and voted for a new political party, Umkhonto Party. This action scared ANC so bad that it ignored its own core values and went to seek refuge in the worst place it can go to. It went to the DA and the Freedom Front Plus, and that was the start of our new problems. Today, South Africa is a movie, and watch and see. With that said, let me start my speech by offering the House one definition and ask you to keep this definition at the back of your mind as I continue talking. The definition of opportunity cost. Here it is. It is the potential benefit that is lost when one alternative is chosen over another. It represents the value of the next best alternative that is forgone when a decision is made. In essence, it's what you give up to get something else. Now, Honorable Deputy Chair Gobese has been fired from her work. Amongst other reasons, it is alleged that the Missy Noma Kokosumelane is involved, but she has since distanced herself from these allegations. Ukoshwake comes after she has been raising some very important facts. Honorable Deputy Chair, it is a fact no amount of budgeting can keep up with the effects of illegal immigrants in our country, and this issue deserves some serious attention, not victimization of individuals who dare to raise it. Our government must protect its own first. Gisho in CPR, you don't start mouth to mouth before your own safety. You must be safe, and the next person to you safe, and then you can start CPR. So if our government doesn't take care of the safety of its own citizens, this will be a catastrophic event. There is some serious misinterpretation of our so-called perfect constitution. There is a lot of misalignment of policies between the constitution of the country, the Health Act, the Immigrant Act. Home Affairs and SAPS needs to link up with the Department of Health. We can't have an illegal immigrant being discharged from a health facility and they just walk outside the gate. Magate discharge Venin to Lindela and back home or wherever our policy dictates Melba. Melebas going to the health facilities means they will be in jail. The National Department of Health must be clear on the issue of illegal immigrants. Are we saying a 7-month pregnant woman can just cross the border to give birth in South Africa and be able to sue the department millions of rands, and if the outcome of that pregnancy is not favorable? We have seen cases of big payouts ordered by our courts to illegal immigrants. Perfect constitution. We are sleepwalking into a serious health crisis if we do not tackle head on the issue of illegal immigrants, because we are budgeting for this. South Africans, we are not counting the illegal immigrants, and there are more than 2 million in the country. The NHI, I have never seen such an irresponsible government playing with people's lives, giving false hope. In a bid to retain voters, President announced the NHI is now signed into law. How are you going to subfinance the NHI? And how are you going to sustain it? What model are you going to use? Fee for service, fixed rate, patient to GP, GP to facility? We don't know. That's why we will never be able to agree with each other, the GP, the GNU. The DA is taking you to court because you can't clearly classify this thing. You've not been able to cost the NHI system. What if it's going to wipe out the whole GDP of the country? But it is possible to use the constitution of this country and fund the NHI. But we can't fund the NHI without some serious legislature changes. But we will show we need to have a system that will be able to sustain itself. We have a lot of people who are unemployed in South Africa. And until we have a system that will make sure that everyone above the age of 18 participate in the economy of the country, we will not be able to have funds to sustain initiatives like the NHI. We do have the minerals, we do have the land, we only don't have the will to do it. EMS is the worst we have in South Africa. In the song, Eminem sang, I quote, "The opportunity comes once in a lifetime. You better lose yourself in the music. The moment you own it, you better never let it go. You only get one shot. Do not miss your chance." I close quote. During COVID, we had an opportunity to improve our infrastructure. We had an opportunity to buy equipment. but Eastern Cape Boti Ikuta as an ambulance was Ihlazo. Today, EMS in KZN operates with 138 ambulances against 1,234 ambulances. We close that gap in the near future without injection. Now, we've seen how we will not be able to deal with that, because if you can inject cash into the health budget, it goes to corruption. We've seen how the scandals in Tembisa hospitals tender system was handled by the GNU. We still have more people who are not arrested. We still have more people who are actively corrupt, and we are still using them. One of my professors in TP taught us that if you continue doing the same thing, you will keep getting the results. That is why we are unable to eradicate TP, yet it is curable. Now the question is, what changes have we done so that we can then achieve what Minister Mtsoaledi is announcing? He has just announced some serious infrastructure developments. The question is, we will ask yourself, where will you get the money for that? Even if you do get the money, what will you do with the corruption that you have in the country? We just seen over the last few days, corruption is left, right, and center, and we are not doing anything about it. Until we handle corruption, we are not going to be able to achieve what the minister has just announced. Minister is optimistic when he says we want to eradicate HIV. To eradicate HIV, you need to have people who have faith in the primary healthcare system. We have seen that the primary healthcare system is slowly decaying and going backwards, then moving forward. We have seen cases of people going into the primary healthcare facilities and returning without getting medication. It's for the first time we are seeing pregnancy tests running out, glucose strips running out. How are we then going to eradicate diseases like diabetic or managed diabetics to be low when a patient actually walks into the facility and goes out without even having his glucose being tested because the clinic ran out of glucose strips? And it's not because we don't have enough money, but we have too much corruption which cannot keep up with the amount of money being budgeted to us. So until the government decisively deal with corruption, decisively deal with illegal immigrants, or at least budget for them so that you know that you have budgeted for more than what you have as South Africans, you are not going to be able to be self-sustaining if the legislatures can change to allow that the government, instead of spending more money outside, they can spend more money generating income. We need to allow hospitals we need to change the tender system so that not everything in the hospital must go into a tender. We can increase the value of the amount that the hospital can spend without even going to tender, because this thing of tendering everything was designed by people who had one idea to loot the Department of Health. Now, until we change legislature and prevent that, we will continue running a healthcare system that does not ensure that we are safe. One of my last things as I close, the Spotlight article on the 4th of July 2024 read that out of all the 9 MECs in South Africa, none of them is a healthcare professionals. Maybe that's the first point that we need to fix, because you need to have people who have a vision of health so that they can be able to manage health. I thank you.
Thank you very much, Honorable Mthethwa Nyambos. We now move on to the next contributor to this debate, and that is from SALGA, who is also on the virtual platform, and that is Councillor Mahlangu. You have 10 minutes.
Thank you very much, Chairperson. Honorable Chairperson of the NCOP, Umama Urifilwe Tsipane Mthweni, Honorable Minister of Health and other cabinet ministers present, Honorable Deputy Chairperson of the NCOP, Honorable Deputy Ministers, Honorable MECs, Honorable Chief Whip, Honorable members, Honorable House Chairpersons, ladies and gentlemen, Sanibonani. Our Constitution guarantees everyone the right to have access to health care services. Moreover, provides that state must take responsible legislative, including other measures, within its available resources to achieve the progressive realization of this right. Acknowledging health as a human right recognize a legal obligation on the state to ensure access to timely, acceptable, and affordable health care. A right-based approach to health requires the health policies and programs prioritize the needs of those furthest behind first towards greater equity. The right to health must be enjoyed without discrimination on the grounds of their health needs, irrespective of their economic status or any other factor. Honorable Chairperson, the completion of 5 new hospitals, facilities, revitalization of 47 existing clinics and community health care center, then 45 hospitals, as well as the refurbishment, moreover, maintenance of 403 public health facilities during the 2024-2025 financial year as reported is a massive step towards the realization of universal health coverage, as many of our people rely on public health facilities for care. Furthermore, the facilities under construction and those to be constructed will go a long way in preventing the demeaning sense of frustration health services seekers and confrontation by different sections of communities that we often see on different media platforms. We further welcome the news of the hiring of 1,650 professionals, which includes doctors, nurses, and the permanent employment of 27,000 community health workers. We believe that the distribution of these professionals will be done in a manner that takes into account where the most backlog is, including in rural communities where the majority vulnerable people are found. Honorable Chairperson, disadvantage and marginalization serves to exclude certain population in societies from enjoying good health. According to the World Health Organization, 3 of the world's most fatal communicable diseases, malaria, HIV, tuberculosis, disproportionately affect the world's poorest populations, and in many cases are compounded and exacerbated by other inequalities, including gender, age, sexual orientation or gender identity, and migration status. While we note the progressive made by government towards elimination HIV/AIDS and a public health threat by 2030, number of those enrolled on antiretroviral therapy is a cause for concern, as the consequences require serious and urgent intervention. We, however, applaud the proactive stance by the department in ensuring that there is a caution for the withdrawal of the U.S. President's emergency plan for AIDS relief funding, and that the pledges made by National Treasury, the bill and the Melinda Gates Foundation and the Wellcome Trust will go a long way in not only circumventing the impact of the withdrawal, but also fast-tracking the attainment of the 95-95-95 targets. And these 95-95-95 targets represents people living with HIV that should be achieved. The plans to screen 500 million people for TB as part of ending this scourge together with HIV and AIDS is also commendable. We agree with the Minister that elimination of certain diseases, especially communicable diseases, non-communicable diseases, and malaria is utmost important. Our understanding is that the burden of non-communicable diseases is largely associated with lifestyle and behavior factors, while environmental determinants such as poor housing conditions, unsafe water, and poor sanitation can be linked to communicable diseases. Honorable Chairperson, to prevent disease outbreaks such as those experienced in the country is recent time, efforts must be made to strengthen the funding of health promotion programs and preventative health services, such as those which seeks to regulate the provision of services such as water, sale of food, waste management, health surveillance of premises, surveillance and prevention of communicable diseases, amongst others, all which impact on the health outcomes. We further call the Department of Health to work with the National Health Laboratory Services to expand access of forensic laboratories, e.g. for toxicology, open brackets, testing of poisons and drugs, close brackets, will help reduce backlog and improve turnaround times for getting sampling results, as it has been important as a challenge, as is being reported as a challenge by municipalities. Honorable House Chair, with that said, SALGA supports the budget vote and believes that it demonstrates serious commitment by the Minister and the Department of Health towards addressing the health challenges in the country. I thank you.
Thank you very much, Councillor Maslangu, for your inputs. We now move on to the Eastern Cape, the MEC for Health, the Honourable Kapa. You have 10 minutes.
Thank you, Chair. Thank you, Chair, Deputy Chairperson of the National Council of Provinces, the honourable members of the House, Honourable Minister and Deputy Minister for Health, MECs of Health in different provinces, SALGA Representative Councillor Maslangu, good afternoon. I stand before you today to support the 2025-2026 National Health Budget tabled by the Minister, not merely as a financial statement, but as a profound commitment to the health and the well-being of our people and the strategic investment in our future. Health is a critical component of every citizen in our country. It is the most significant constitutional right of every citizen living in our country, irrespective of their status. It is our duty, therefore, to always ensure that the aspirations of our people are met. What becomes important, honourable members, are our ability to meet these demands and respond positively with a clear strategy to address the problem. The budget presented by our Honourable Health Minister, Dr. Aaron Motsoaledi, before the National Assembly clearly demonstrates our government resolve to meet these expectations. Prioritizing improved public health services, expanding access to quality healthcare, and addressing the complex social determinants of health. It is a tangible expression of our resolve to invest in a physical infrastructure, vital human resources, robust systems, and responsive services, while acknowledging the unique challenges of our rural province, such as poverty, infrastructure limitations, and historical workforce shortages. Chairperson, our primary objective are clear, is to lay a strong foundation for national health insurance and to accelerate the journey towards the elimination of certain communicable and non-communicable diseases. This budget, anchored in the National Health Act of 2003, is designed to ensure the progressive realization of the constitutional right to health for every citizen. The mega infrastructure projects announced, with some currently underway and in some instances nearing completion, will go a long way in ensuring access to quality healthcare services for all. The Eastern Cape has made significant strides in building resilient health systems. In infrastructure, we've seen the completion of State Hospital, as mentioned by the Minister, and the construction of facilities like Tebe Clinic and Buffalo Clinic. The Tulele Hospital project is being constructed at a cost of over 1.2 billion. This hospital and many other facilities mentioned by the Honorable Minister are world-class, boasting of a state-of-the-art modern medical equipment that has the capability to manage. And as mentioned by the Minister, is a paperless facility that uses HPRS and an e-ticketing register. This is the clinic that is NHI compliant. As at the same time, it is in the deep rural areas of Nkanduli and the OR Tambos district. Construction of Bambisani, Madwaleni, and Griffin Hospital are an upgrade already underway to strengthen the public health system and improve service delivery in the province. All these facilities that I've mentioned are found in the deep rural areas of our province. In human resource, we are grateful for the national intervention as we will receive our own allocation.
Honorable MEC, we seem to have lost you there. Could you check your system again? Honorable MEC Kappa, we can't hear you.
Chair, I just got cut off. My apologies for that.
Okay, all right, continue. We can hear you now.
Yes, in human resource, we are grateful for the national intervention as we will receive our own allocation from the 1.7 billion set aside for the hiring of 1,200 doctors, 200 nurses, and 250 other health professionals. This will contribute immensely on the challenges of unemployed health professionals who frequently engage in protest actions, knocking in our doors, demanding employment. However, in the same vein, this also highlights the success of interventions implemented a decade ago to invest on skills when the country was facing severe shortages of medical doctors and other categories. A particular impact initiative is the permanent employment of community health workers, strengthening the primary health care, especially for our rural province as Eastern Cape. At Doranginza Hospital, is a direct response to the Public Protector's report. We deployed 10 additional doctors, 20 nurses in May 2025, which has already improved the situation, especially in the maternity ward, where a backlog of 42 cesarean extractions was cleared. The Public Protector's report is a critical tool for improvement to which we have responded constructively. As Eastern Cape Province, we are addressing staffing issues with the targeted deployments and a 141 million allocation for regional and tertiary hospitals. The Eastern Cape has historically shown a high immunization coverage rate. In the fight against HIV, Joe Gabi district recorded an impressive 100% viral suppression among children aged 1 to 4 years in the first quarter of 2024, demonstrating our progress towards the UNAIDS 95-95 target. The Central Chronic Medication Dispensation and Distribution Program has also significantly improved patient adherence and reduced facility congestion. This budget is also a strategy designed to address South Africa's burden of diseases. We are making significant progress against HIV and AIDS and TB with a national viral load suppression rates nearing 95%. We are committed to the World Health Organization cervical cancer elimination targets, including vaccinating 90% of our girls against HPV, and screening 70% of eligible women. This budget directly contributes to the National Development Plan of 2030 goals and a Sustainable Development Goal 3, aiming for healthy lives and well-being for our people. We transparently acknowledge persistent challenges. However, we are actively implementing strategies to respond to such challenges. Our service delivery has also seen a notable progress with increased capacity for renal dialysis, mental health, and rehabilitation services. The additional allocation of 1.3 billion for patient beds and linen will assist in improving patient experience of care. We deeply appreciate this support from the Minister. The national allocation of 3.7 billion to pay accruals will directly address unpaid debts and the lingering effects of the past austerity measures. The plans to build more district hospitals in certain areas will go a long way in addressing long queues in our tertiary hospitals and align the referral system. The establishment of these district hospitals where there is a need is yet another illustration of the visionary leadership that responds to the needs of our people. As Eastern Cape, we are in the process of applying for Empilon Hospital in Nelson Mandela District to be gazetted into a district hospital to decentralize strain on Doranginza. We have already established a postnatal ward in that particular hospital. In conclusion, Chair, our honorable members, this budget is a fundamental step towards realizing the promise of a healthier, more prosperous Eastern Cape and a stronger South Africa. It is a commitment to ensure a long and a healthy life for all citizens, grounded in a sound policy and the legislative processes. I urge the esteemed National Council of Provinces to support this budget, a moral imperative as a decisive investment in the future of our people. As Eastern Cape, we support the National Health Budget of 2025-2026 as tabled by the Minister. I thank you.
Thank you very much, Honorable MEC. We now move on to the next contributor to this debate, and that is the Honorable Briet from the Freedom Front Plus. You have 5 minutes.
Agbora Bjink, Voorsitter, Nelson Mandela once said, "A nation should be judged by how it treats its highest, not by how it treats its highest citizens, but its lowest. How it treats its sick, its poor, and its vulnerable." Section 27(1) of the Constitution clearly lists access to health care services as a basic human right, yet it is not treated as such in South Africa. As you know, Minister, I'm from the Free State. And frankly, the Free State's Department of Health does not live in reality. During the 2021-22 financial year, the department designated the Boitumelo Regional Hospital in Kroonstad as having ideal status. This was at a stage when the hospital didn't even have its own telephones, and I had to borrow the telephones from the clinic next door. But let's fast forward to 2025. Agbare Minister, ek wil vir u 'n storie vertel, wat ek gister van een van my raadslede moes verneem het, en dis ver van 'n mooi storie, dis nie eers 'n mooi sprokie nie. Verlede week en Woensdag het 'n oomie van in sy laat 60's 'n ribbetjie gebreek. Hy is toe na hierdie einste Boitumelo Hospitaal toe, die een wat ideal status het. Daar het hy vir min of meer 'n halwe dag lank in 'n rolstoel gesit, sonder 'n bed, sonder 'n dokter. Uiteindelik, na daai dag, was daar toe vir hom 'n bed gegee, 'n bedjie in 'n hoek van 'n saal daar in Ongevalle. Hy het vir 'n volle 24 uur daar gelê in pyn, sonder 'n pynpil, sonder 'n dokter, amper vergete. Gelukkig het hy 'n dogter en sy het darm vir hom 'n bed, 'n kussing, 'n kombers en bietjie kos gebring. Uiteindelik het daar 'n personeellid na die oomie en sy dogter toe gekom en gesê, Hy gaan nie hier gesien word nie. Hier is nie 'n dokter wat nou aan hom kan aandag gee nie. En sy stel voor, hulle vat hom Universiteitshospitaal in Bloemfontein toe. Nou, agbare minister, ek weet nie wanneer laas jy op die Vrystaatse paaie gery het nie, maar dit was 'n baie lang 2 ure vir die oom met 'n gebreekte ribbetjie. Uiteindelik kom hy toe daaraan in Universitas. En hulle sê vir hom, nee, baie jammer, hy moet met 'n verwysing van 'n dokter hier na hierdie hospitaal toe kom, anders kan hulle hom nie help nie. Maar hulle stel voor, hy gaan na een van die ander hospitale in Bloemfontein toe. Right, terug in die kar, weer in die paaie, na die volgende hospitaal toe. Daar kom hy weer aan. Die personele daar sê vir die oomie en sy dogter, mevrou, kyk hoe lê die pasiënte op die gras. Ons het nie vir jou pa bed nie. Ek stel voor, jy vat hom terug Boitumelo toe. 2 ure in die kar verder, weer terug daarna toe, terug in 'n bed, en daar kry hy uiteindelik 'n dokter. Maar teen die tyd, blykbaar is die oomie al geel. Dit lyk of hy geelsig het. Dit gaan nie goed nie, hy kan nie asemhaal nie. Hy het nog nie 'n dokter gesien nie. Nou trek ons al by gister. Eventually kom hy daar, hulle is dokter sien hom. Die dokter sê vir hom, meneer, jy moet maar huis toe gaan, rustig wees, en dan sal ons kyk. As jou ribbetjie herstel het en hierdie ander probleem is nog nie opgelos nie, dan sal ons 'n plan maak. En dis die realiteit. Hy het darm 'n dogter gehad met 'n voertuig wat hom kon heen en weer slep. Maar hoeveel ander mense, minister, how many others do not have that, do not have the luxury of a daughter who has a car who can drive him around? Chairperson, and then, Minister, you yourself admitted that we have a shortage of staff, 22% vacancy rate of doctors and a 28% vacancy rate in nurses. A few weeks ago, I was contacted by a nurse who works at one of the psychiatric hospitals in Bloemfontein. And she wanted advice as to what can she do. She mostly works in a ward alone with 16 patients at least. One nurse who has to feed these psychiatric patients, who has to change their nappies, who has to make sure they take their medication, all one nurse. That is not human dignity, Chairperson. And then I haven't even touched on the cases of corruption, bribery, unlawful contracts, medical stock shortages, and the rest. The reality of this is simple. Our Department of Health is on life support and in need of intensive care. I thank you, Chair.
Thank you very much, Honourable Briet. We now move on to the next contributor to this debate, and that's the Honourable MEC for Health from Limpopo, Honourable Mashego. You have 10 minutes.
Thanks very much, Honourable Chair, Honourable Members, Honourable Minister and Deputy Minister of Health, colleagues from provinces, fellow South Africans. I rise today as the MEC for Health in Limpopo Province and a deployee of the African National Congress to contribute to this crucial policy debate on Budget Vote 18 Health. It is not just a budget vote, it is a reflection of our constitutional duty to progressively realize the right to health for all who live in South Africa. Health is a constitutional imperative. Section 27 of the Constitution declares that everyone has the right to have access to healthcare services, including reproductive health care. As provinces, we are on the front line of delivering that promise. Therefore, how we budget, plan, and act is not a matter of administrative function, it is a human rights obligation. In Limpopo, we continue to align our health delivery programs with national priorities under the strategic guidance of the Department of Health and in line with the National Development Plan. Honourable members, Limpopo's Health Department has been allocated a budget of 23.6 billion for the 2024-2025 financial year. This budget is guided by 5 key priorities. Number 1 is strengthening primary health care. We continue to strengthen our district health system, which is the backbone of our healthcare delivery in rural provinces. We have operationalized 4 new clinics and refurbished 12 existing facilities in 2024. Over 85% of our clinics now operate with extended hours and have achieved ideal clinic status. Number 2 is human resources for health. We have recruited over 420 community service health professionals, including nurses, pharmacists, and doctors. And in partnership with the Department of Higher Education and International Training Programs, we are expanding nursing training capacity, particularly through the Limpopo College of Nursing and the reopening of nurse training campuses in the district. On infrastructure investment, through the Health Facility Revitalization Program, we are investing over 1.2 billion in infrastructure for upgrades across the province. Major projects include the upgrading of Letaba, Mokopane, and Chilidzini hospitals, which serve as regional hubs for specialized care. For health technology and ICT systems, we have rolled out an electronic health record system pilot in the Capricorn and Mopani districts, which will support the future national health insurance systems. We are also investing in improving diagnostic equipment, including digital X-rays and laboratory connectivity in rural hospitals. And NHI readiness and implementation. Limpopo is actively preparing for the implementation of the National Health Insurance through improvements in the referral systems, patient administration, and facility compliance with NHI standards. We support the minister's call to fast-track NHI implementation. This is not only an ANC policy, but a moral obligation. As the Honorable Minister said, and I quote, "The NHI is not about politics, it's about building a just and equitable health system that leaves no one behind." We acknowledge that challenges remain, staffing pressures and uneven distribution of specialists in rural districts, aging infrastructure that requires agent maintenance, medico-legal claims that continue to put pressure on provincial budgets, supply chain weaknesses, some which have been exposed during the SIU investigation. In Limpopo, we are strengthening our governance and compliance mechanism. Disciplinary processes have been initiated against officials implicated in irregular procurement. We have adopted a zero-tolerance approach to corruption and mismanagement in the health sector. We have placed maternal child health care at the center of our priorities. Limpopo has recorded a decline in facility-based maternal mortality from 128 over 100,000 live births in 2021 to 109 over 100,000 in 2024. The Mom Connect digital program has reached over 500,000 women in the province. We are scaling up immunization coverage, which currently stands at 86%, and improving adolescent health services in schools. We also salute our over 4,000 community health care workers who go door to door in villages, farms, and informal settlements. They are the first point of contact for many and the foundation of disease prevention. In conclusion, health is a cornerstone of development, Honorable Chair and Honorable Members. Let me close with the words of the late Minister Joslovo, who reminded us that a democratic state must reflect the will and the needs of the majority, close quote. In health, that means equitable access and quality services and a public system that services everyone, not only those who can afford it. The health budget vote we are debating today is a vote for life, a vote for dignity, and a vote for equity. On behalf of Limpopo Province, I support budget vote 8 health. Let us move forward together, building a healthier South Africa for all. Thank you, Chairperson.
Thank you very much, MEC. Thank you, MEC. Good afternoon, honourable members, ladies and gentlemen. Honourable members, the next participant in the debate is the Honourable du Plessis.
Good day, Honourable House Chair, Honourable Minister, Honourable Deputy Minister, Minister from the Western Cape, members and fellow South Africans. The healthcare sector is a major contributor to building a nation that is healthy, resilient, and economically active. Therefore, it is no surprise that the National Development Plan includes the importance of a healthcare system that works and is based on the Batho-Pele principles to give dignity to people living in South Africa. The principles of Batho-Pele is indeed a wonderful South African document, and it will address the healthcare crisis in South Africa. However, it is very unfortunately often only used as a poster to cover the peeling or the paint that is peeling on the walls of our clinics and hospitals, often next to, or inevitably, next to COVID-19 posters left there 3 years after the national state of disaster ended. As a reminder, the principles are consultation. This is the cornerstone of a government for the people, by the people, and it means that we listen without prejudice. However, this is not happening to the most vulnerable in society in South Africa. I recently engaged with an elderly lady, Mam Tembo, from Protea South. Her leg was removed recently as a result of diabetes, and she purely depends on a SASSA grant to survive. She recently went to Chawala Clinic in Protea South because her left breast had been swollen to twice its normal size. After a long wait for her file at the clinic, the doctor saw her and told her to go to Bara. She got into a taxi and went to Bara. After another long wait for her file, she was told by Bara to go to Steve Biko, almost 2 hours away. She got into another taxi and another long wait for her file and was told to, wait for it, go back to Chawala Clinic, where she was told, please stay the night and we will not be able to do any tests on you. They did not listen to her, there was no consultation, and there was absolutely no empathy. The next principle that can change healthcare is service standards. I do not need to list all the service standard issues that we know about. Firstly, it won't be covered in 8 minutes. And secondly, every single one of the people in this room and the people listening can list at least 5 issues in their area in public health care. Also, the high rate of medical legal cost supports the fact that our service standards are not up to date. The next issue is access. It is always tricky, but it is important to note that it is more than medical aid coverage or access to medical health care. It is also the physical access, especially in a country as big as South Africa. But we have not even touched on addressing the crisis in the EMS services. Many of our ambulances in Gauteng that I am aware of often go on cigarette runs. I have seen this. They also use taxis as part of a taxi ring, or ambulances as part of a taxi ring. This is not what they were intended for. The next word is sadly not a word that we associate with healthcare in South Africa. It's courtesy. Do all our public servants treat all citizens with respect, courtesy, and consideration? Or do patients allegedly get cuffed to benches in Tembisa Hospital with the excuse of they were high? This is not courtesy. It is not international best practice. Communication of information is yet another principle, but information as basic as the referral system is not communicated to our residents. If it was, Mam Tembo would have known to stay at Chawala Clinic. She would have been able to fight for her rights because she would have had the information at hand. We would not have patients knocking on the door of hospitals instead of going to the local clinics to get medicine that is waiting for them at the local clinic. Redress has not taken place. The injustices of the past have not been addressed. We are still fighting diseases associated with the poverty cycle and with most South Africans unable to access healthcare. Openness and transparency, another Batho-Pele principle. My colleague spoke about the lack of this within the system. With 2.7 billion rand of irregular expenditure just in Gauteng, and accruals are blamed for this, Is this open? Is this transparent? Does it serve the people lying in hospitals? I'd also like to ask why so many of our MPs are denied access to hospitals. I have personally been denied access twice from Lenasia South Hospital. This is not openness or transparency. In 2023-24, taxpayers spent 60.1 billion on healthcare, 62.2 billion for 2024-25. But does this show on the ground? Is there a difference in real terms? Or is this a waste of money as it shows no value for money, another Batopelo principle? Healthcare is expensive, but the money needs to be spent on the healthcare system, not on lining the pockets of cadres. Innovation and reward, neither found in the system. Customer impact, another Batopelo principle. Unless we are talking about a negative impact, there is no positive impact. Leadership and strategic direction is last but not least Batopelo principle that can change and revolutionize the South African healthcare system. But are our nurses allowed to lead? Or when last did you see a CEO in a hospital or a clinic manager? From personal experience, I could say I have met 3 clinic managers, once in oversight in a little town of Vredenburg in Saldanha Bay. At 2 o'clock on a Friday afternoon, every single clinical manager was there, busy doing their duty. This I have not found in my home province. Imagine a Department of Health that lives by these principles. It would then be easier to believe that the 2.5 billion budgeted for non-communicable diseases would be used to lessen the burden of disease. We would then, with ease, believe that from birth to death, you can have access to healthcare, no matter the circumstances of your birth. That it is worth your spend in taxes. The most vulnerable in society would not be sent from pillar to post, but transported to where it is necessary based on accurate information. The priorities have been there for many years, but they have not been actioned. The NHI is not a panacea. The system is broken. We have the wisdom, we have the knowledge, we have the talent, and we have the principles. Why is healthcare still failing? I thank you.
Thank you, Honourable Du Plessis. Next at the podium today, Honourable Members, will be the Honourable Farmer. Honourable Farmer, you have 5 minutes.
Honourable Chairperson, Honourable Minister and Deputy Minister, Honourable Members and fellow South Africans, I greet you in the name of Jesus Christ, our Lord and Saviour, the God who rules in heaven and on earth. The Patriotic Alliance rises today in support of Budget Vote 18, Health, but with a firm call for equity, urgency and accountability. The appropriation bill allocates 66.9 billion to the National Department of Health for the 25-26 financial year, increasing to 70.2 billion by 27-28. Over 90% of this budget is transferred to provinces through conditional grants. These funds must not only be spent, they must be felt. We welcome the 89 billion allocated to the District Health Programs grant, supporting over 6 million clients on antiretroviral treatment. But we must ask, are community health workers in under-resourced areas like the Cape Flats, Eldorado Park, and the northern areas of Nelson Mandela Bay receiving the same support as those in urban centers? We note the 50.2 billion allocated to the National Tertiary Services Grant, yet only 35 hospitals nationwide offer tertiary care. This centralization forces patients from colored communities to travel long distances for oncology, dialysis, and psychiatric services. We call for decentralized investment, especially in provinces like the Northern Cape and Eastern Cape, where tertiary access remains a dream. Honourable Members, we must also confront the failures of the Western Cape government under the DA. Tygerberg Hospital, one of the province's largest public facilities, has been earmarked for redevelopment since 2009. Yet construction is only expected to begin in 2028. In the meantime, lifts frequently malfunction, leaving patients stranded. Toilets on multiple floors are locked or broken, compromising dignity. Staff shortages force nurses and junior doctors to operate beyond their scope, risking patient safety. Our people in the Western Cape only see millions being promised for new hospitals, yet they still have to wait in cracked buildings. This DA government did not just fail to build, they failed to maintain as well. Sleg bly sleg. Honorable Chairperson, our colored communities in South Africa has been excluded from proper healthcare services for decades. In places like Bonteheuwel, Galvandale and Steenberg, our clinics are understaffed, scarce medicines and ambulance services don't arrive on time. Our people wait in queues for hours just to be turned away without receiving any help. It's not a budgetary shortage, it's an inhumane state of affairs. We support the phased rollout of national health insurance, funded through an 8.5 billion indirect grant, but it must not replicate existing inequalities. We call for one, the absorption of unemployed medical graduates, especially from historically disadvantaged backgrounds. Two, expanded funding for chronic disease research, including mpox and diabetes, which disproportionately affect colored communities. Three, infrastructure upgrades in neglected clinics, not just flagship hospitals. Chairperson, the Patriotic Alliance speaks for communities where health is not a right, but a daily struggle. We speak for the grandmother in Hanover Park who walks kilometers for a blood pressure medication. We speak for the young man in Bishop Levers who dies waiting for an ambulance. We speak for the forgotten nation. Let this budget not be a ledger of numbers, but a promise of dignity. We support Vote 18 for the changes it intends to bring. We demand proper healthcare for the state of service delivery is determined by the treatment of your most vulnerable. Honorable Minister, Muni Baizani, salute.
Thank you, Honourable Farmer. The next participant at the podium today is the Honourable Mokwele, who has 12 minutes. Honourable Mokwele.
Thanks very much, House Chair. Honorable members, the Chief Whip, the Deputy Chair, Madumao Ikheta, to our Minister, Minister Rawupelo, and the Deputy Minister, fellow South African, Dumela. House Chair, our greatest challenge facing our healthcare system is the corridorable burden of diseases, which include communicable diseases and non-communicable diseases, injuries and violence, as well as maternal and neonatal and child mortality. The corridorable burden of disease places significant strain on our health system and undermine effort to realize the vision of long and healthy life for all South Africans. House Chair, the 30 years review from 1994 to 2024 demonstrate that the African National Congress-led government has made commendable inroads in improving our health system and health outcome. In 1994, at the dawn of our democracy, communicable diseases such as HIV were major health threats with drastically rising infection rates that were claiming many lives alongside increased alienation due to misinformation and stigma. Since then, our collective effort from government, civil society, and communities have come a long way in promoting health education that has positively impacted attitudes towards HIV-positive persons, improved testing and treatment, which has seen 96% of people with HIV tested, 97% of those who tested positive on treatment, and 94% of those on treatment virally suppressed, as the Minister alluded.
House Chair, this budget, which the African National Congress supported upfront, House Chair, is an expression of the continued commitment by the ANC-led government to investing in its people, with nearly 40% of the health budget being dedicated to communicable and non-communicable disease. This allocation is intended to strengthen health responses that will ensure that we build on our country antiviral therapy, which is one of the largest in the world, which over 5 million people on treatment, and this targeted to increase for the 2025-2026 financial year to 6 million people. Fellow South African, additionally, the launch of the Close the Gap initiative has a very critical role to play in the HIV response through the enrollment of 1.1 million HIV people on treatment. So far, more than 520,000 people have been initiated on antiviral treatment. This is a critical milestone towards achieving the UNAIDS 95 target and ending AIDS as a public health threat by 2030. Honorable Chair, before the intervention of the ANC-led government, maternal and child health outcomes were extremely dire, especially for Black people as a result of exclusion and unfunding of healthcare under apartheid government. There was no national free primary health care nor outreach program to offer maternal and child services, which resulted in Black women being 4 times more likely to die during the childbirth than the white counterpart. Honorable Minister, that is why when we want to introduce the NHI, those who benefited from apartheid government, they will come up with big English, Honorable Minister. You know, they will always say, this is not feasible. This is not possible. We can't even afford it. Even if you try to explain to them, Honorable Minister, they can even opt to lobby others to take you to court. TB also remains as a major challenge and integration, which HIV service has seen incredible result in improved screening and treatment outcome. To this end, we have observed a decrease in TB incidence from 615 per 100,000 in 2019 to 416 per 100,000 people in 2022. As such, the emphasis on integrated services in the National Strategic Plan on HIV, TB, STI is an integral part of efficiently utilizing resources to improve detection, treatment, initiation, and health outcome. House Chairperson, this budget is also committed to addressing the non-communicable disease through a massive scale-up of screening with target of 32 million hypertension screening on 31 million diabetes screening planned for 2025-2026 financial year. This investment is made against the tide of research finding, which indicate that non-communicable diseases are a growing health concern that's significantly contributing to mortality and disability. The finding from Stats SA reveal a notable increase in non-communicable disease such as cardiovascular disease, diabetes, respiratory disease, and cancers. Factors such as urbanization, sedentary lifestyle, unhealthy dietary habits, tobacco use, and rising obesity rates have contributed to this upsurge. Fellow South African, it is true that indeed in health, we are not living with obsession, Honorable Modise. If you are not taking care of your health, or you don't care, Honorable Mukai, on what you are eating, indeed you will contribute toward the problem that we are facing in the health system. So therefore,
as fellow South African, we must always make sure that we live a healthy type of life. We make sure that, especially at our age, President Kaunda, as and when you grow up, you must mind on what you are eating. You must always at all time make sure that you exercise in order to ensure that you, we deal with the burden that our health system is facing. Equally important is how technological advancement can be leveraged towards improving health. Research from National Library of Medicine revealed that since COVID-19 pandemic, there has been an increase in the use of digital health education. This shift is likely attributed to the widespread availability of digital technology and devices, such as computer, multimedia technology, smartphone, mobile application. In terms of benefit, the use of multimedia technology such as animals and videos can transform how health information is shared with patients. This has also had a positive impact on the uptake of programs such as 95 Hard Challenge, the 75 Soft Challenge, and Park Runs and High Dogs Challenge. As such, target programs for vulnerable groups are imperative to increase access and promote stigma and judgment-free zones. Youth zones have been impactful in creating dedicated, youth-friendly spaces for young people to engage in health matter in the manner that appeals and resonates with them. Having such spaces is important for breaking barriers that hinder young people from approaching our health facility out of fear of being judged and not understood. That is why, Honorable Minister, the implementation of the NHI, it must be something that must happen now, not tomorrow, because NHI will make sure that even those that they were coming here and complaining that they don't have access to certain places, they will have access to certain, whether you are from a poor background or not. So that is why, as the ANC, we want to lobby all of you, especially honorable members, those that you are with us in the government of national unity, because I heard one honorable member when he was saying that the reason why the fund was withdrawn, Minister, is because of trust. I don't know. It is because of now we are leading with them in the government of national unity. They don't trust us or not. I don't understand, because currently they are the one minister that they will go outside and lie about what is happening in the country. That is why you can see the withdrawal of a lot of money from those donors outside the country. Honorable Chair, as I conclude, health is a fundamental human right. It is an integral part of transformation and development agenda for our commitment and nation more broadly. As the ANC, we support budget vote 18 on health in the interest of building just an equitable health care system, and we remain committed to the vision of the Freedom Charter and advancement of universal health coverage where no one is left behind. That is why we will always emphasize, Minister, to say that the ANC, we are not starting now. Since 1994, we're fighting this battle to make sure that all our people, irrespective of background, irrespective of color, they get the health care, because health, honorable members, is not something that you can clown with, because it will affect all the people. That is why, as the ANC, will always continuously supporting your efforts, Honorable Minister, and your department to make sure that all people in South Africa get access and equal health care. I thank you.
Thank you for sharing your views, Honorable Mokwele. The next delegate to take the stand will be the Honorable Venga, who is the Western Cape Provincial Minister on Health. Honorable Venga, you have 10 minutes.
Thank you, House Chair. Honourable Minister, Deputy Minister, fellow MECs, honourable members of the National Council of Provinces and South Africans. It was Thomas Carlyle who said, He who has health has hope, and he who has hope has everything. This truth underpins our work in healthcare, because when we strengthen our healthcare system, we are doing more than just delivering medicine or building clinics. We are offering hope. Hope to the sick, to families, and hope to entire communities. If we want to build a thriving and inclusive South Africa, we must start with a healthy population. And while health and well-being stretch far beyond the walls of any facility, equitable, accessible, and dignified care must form part of the foundation of our healthcare system. To make this a reality, we must have the infrastructure to deliver care. These are spaces where hope becomes tangible. I agree with the Minister. One of our key priorities must be to strengthen health infrastructure, both brick and mortar as well as health technology. In the Western Cape, we're doing our level best to prioritize fit for purpose, patient-centered, and climate-resilient infrastructure. In this financial year alone, 18 infrastructure projects are in planning, 68 will move into design or tender, and 43 will be handed over to contractors. 29 construction projects will be underway, including community day centres and clinics in Ravensmead at 105 million rand, Hornley in Knysna at 48 million rand, Beltervrede at 180 million rand, as well as acute psychiatric units at Easter River, Khayelitsha and New Somerset hospitals, and major refurbishments underway at Alexandra, Tygerberg and Grooteskied, including surgical theatres, emergency centres and critical building systems. In Tygerberg this year, Honourable Member, we will be maintaining the bulk sewers. We'll be making repairs to theatre blocks. We'll be medical gas rehabilitation projects underway. We'll be replacing the chillers. We'll be upgrading the electrical network, including earthing and lightning protection, and we will be rehabilitating the hot water systems. Chair, I'm proud to share with this House that the Western Cape recently built a world-class emergency centre at the Robertson Hospital in just 10 months. And it's beautiful. It compares with the most excellent private sector facility of its kind in both design, construction, and equipment. I invite honourable members to visit it. But, Honourable Chair, as everyone in this House knows, the provincial equitable share is simply not enough to meet the growing demand for complex and large-scale health infrastructure. I encourage this House to debate how we as a nation fund our social infrastructure into the future. Chair, as the Minister noted, we find ourselves in challenging times, especially with the sudden withdrawal of international donor funding for HIV. We welcome the introduction and the announcement of lenacapavir into our HIV fighting arsenal. And once approved by SAPRA, we trust that there will be an equitable distribution amongst provinces according to need. We welcome the 590 million rand committed to provinces in this budget for our collective and continued fight against HIV. In the Western Cape, we are ready. Our department has completed proactive scenario planning to ensure that when the funding becomes available, we can respond swiftly and effectively. We've asked, how do we get maximum return for every rand spent? And how do we not just stabilize services, but how do we strengthen them? Our approach is pragmatic, evidence-based, and rooted in our local context. Amongst our proposals, digitizing HIV and TB registers to improve care tracking, expanding e-scripting and e-prescribing for better medicine access, increasing community-based treatment pickup points, strengthening the clinical management of HIV and TB, and focusing on high-burden geographic areas. I want to assure this House that every rand allocated to the Western Cape will be used responsibly, strategically, and with the clear goal of delivering hope through healthcare. The Western Cape Department of Health and Wellness has received 6 consecutive clean audits, and we hope to make this 7 when the Auditor General releases the audit outcomes at the end of this month. This is a testament to fiscal discipline, responsible governance, and a commitment to service delivery. but no amount of fiscal responsibility can overcome some national policies that are not fit for purpose. The DPSA's recent regulations intended to slow down recruitment are doing real harm to large service delivery departments like health. Staff retire or move on, and yet the system lacks the agility to replace them fast enough. This leaves remaining healthcare workers overburdened and services strained. But these aren't the only barriers we face. Across the Western Cape, several NHI infrastructure projects have stalled. The Puckelsdorp Clinic, first earmarked in 2017 and due in 2019, remains unfinished. So do projects in Parkdean, Rosemore, Blanco, Riversdale, Abertenia, and Oudtshoorn. These national processes are slow and disconnected, and I have written to Minister Motsoaledi to express my concerns about these national infrastructure projects taking place in our province. Now, Chair, turning to the NHI. In its current form, it is ill-defined, impractical, and is unaffordable, and it will not address the immediate or long-term healthcare needs of South Africa. The Western Cape supports the expansion of quality healthcare to all, so that residents can access healthcare where and when they need it, without incurring catastrophic out-of-pocket expenses. But we do not support NHI as it stands. As representatives of provinces, let me ask honourable members of this House, how can you support NHI and removing equitable share from your provinces, thereby weakening the provincial provision of healthcare? Do you agree that your district and central hospitals will no longer be provincially managed? They will become national components. How will you justify this to the many healthcare workers whose futures are uncertain? We are getting dangerously close to a single centralized fund that carries massive governance risks, and the consequences will fall on those who rely on the public health system. In Ghana, a model for our NHI, more than 15 years after implementation, the NHIS still faces serious challenges: poor coverage, declining quality of healthcare, corruption, ineffective governance, vague policy, and political interference. Let this be a cautionary tale. Instead of centralizing power, we believe that better healthcare can instead be achieved through harnessing the strengths of both the public and private healthcare sectors. A more flexible model that expands choice and addresses deficiencies, which will in fact deliver better healthcare. In the Western Cape, we have established a health sector think tank, which includes the private and public healthcare sectors, as well as academia. We want to explore collaborative, innovative models that deliver universal healthcare, because no one should be left behind. Ultimately, what we're fighting for through every budget line, every clinic upgrade, and every patient interaction is hope. And Chairperson, herein lies the difference. The NHI will deliver a fragmented system. The Western Cape delivers an integrated, unified system. The NHI duplicates and complicates. The Western Cape streamlines and strengthens. The NHI ignores local realities. The Western Cape responds to them. The NHI delivers uncertainty. The Western Cape delivers hope. Thank you.
Thank you. Thank you, Honourable Wenger. Honourable members from the Western Cape, we now go to Gauteng, and the MEC for Health in my province is the Honourable Nkomo Ralichoko, who is online and has 10 minutes. Over to you, MEC.
Thank you, House Chair. Honorable House Chair, Minister, Honorable Minister and Deputy Minister, honorable members of the committee, distinguished guests, ladies and gentlemen, thank you for the opportunity to participate in this important budget debate for the Department of Health. This debate takes place at a critical juncture in our country's journey towards equitable access to healthcare. It is very important that because it demands bold leadership, collective action, and accelerated implementation of shared priorities. We come together not just to debate, but to reaffirm our collective commitment to improving the healthcare outcomes of every South African. Let me begin by appreciating the Minister of Health, Dr. Aaron Motsoaledi, for presenting a clear, people-centered and bold budget that places the health of the South Africans at the heart of our nation's development goal. This budget reflects then the urgent need to invest in the foundations of primary health care and strengthen preventative services. Honorable members, as the Gauteng Department of Health, we affirm our full support for the Minister's vision and budget priorities, which align with the lived experiences and aspirations of our people. Our province, being the economic hub and home to over 15 million residents, reflects the pressing needs and pressures facing the healthcare system. We are therefore encouraged by the alignment between the national priorities and our provincial interventions, especially in urban and underserved areas. Our role is to ensure that the budget translates into tangible improvements in clinics, in hospitals, and in patient experience. The health sector remains one of the most strategic pillars of our democracy because a nation can only rise if its people are healthy. This is not merely a matter of service delivery, but of social justice and constitutional rights. Health equity remains a fundamental driver of development, especially for women, children, and the poor. Our efforts then must continue to prioritize frontline workers, invest in public health infrastructure, and close the gap in access to quality care. The Minister outlined the three main objectives of the Department of Health. The first one is to strengthen and align the public health system in preparation for the implementation of the National Health Insurance. The second one is to intensify our efforts in reducing the burden of diseases and strengthening disease prevention strategies. The third one is to focus on achieving affordability and sustainability in the private healthcare sector. These three objectives are not isolated tasks. They represent a holistic reset of our national health trajectory. The first speaks to building a resilient, people-centered public health system that is capable of delivering equitable care under NHI. The second one is addresses our moral and scientific responsibility to eliminate preventable illness and reduce the burden of diseases. The third one confronts the imbalances and inefficiencies in private sector, which must be reformed for universal health justice to be so that justice can be achieved. These objectives form a triangle of transformation, strengthening the public system, defeating diseases, and creating fairness across all sectors. They reflect a vision of health as a public good, not as a commodity. They affirm that healthcare in South Africa must be proactive, inclusive, and accountable for everyone, everywhere. They are about building a system that protects the vulnerable, treats the ill, and gives all South Africans the freedom to live healthy and dignified lives. In Gauteng, then, we are already in motion. Our province continues to expand access to quality healthcare services through investment in infrastructure, personnel, and technology. We've opened new clinics and community health centers, strengthened referral systems, and launched mobile outreach initiatives. Our emergency medical services are being modernized to respond faster and save more lives. We are also integrating mental health and oncology services to ensure holistic care, especially for historically neglected groups. Our digitization journey is progressing steadily. The pilot phase at Chris Hani Baragwanath Academic Hospital has laid a very strong foundation, and we are now expanding this effort across all public hospitals in the province. This initiative not only improves healthcare records management, but also enables vital skills transfer to young people from local communities, linking economic opportunities to system reform. We reaffirm that again, dignity in healthcare extends beyond living. In our forensic pathology services, we're introducing biometric tagging and fingerprint integration to enhance traceability of human remains. Digital systems will also streamline mortuary processes, ensure greater accuracy and accountability. To modernize forensic diagnostic, we are acquiring non-invasive imaging equipment. These tools will assist again in providing closure for families by helping to determine causes of the death. In maternal and neonatal care, we are working to restore dignity and safety. At Heidelberg District Hospital, we have refurbished maternity spaces into individualized birthing rooms that allow for privacy and in the presence of a birth companion. The redesign supports a respect of patient-centered birth experience. Our commitment to child wellness is demonstrated through the deployment of mobile school health units. These continue to expand the access to basic health services and vaccinations for learners. Preventative programs targeting cervical cancer and other conditions have also been strengthened. The department again continues to offer a full spectrum of oncology care in order to speed up access, particularly to prostate and breast cancer patients. And we have partnered with private sector providers to offer radiation oncology services. Infrastructure upgrades in the public sector are also underway to expand capacity. In mental health, we are improving access and quality of care. Additional long-term care beds have been secured, relieving pressure on general hospital beds. Facilities like Tara Hospital are being upgraded to support holistic rehabilitation. Our wellness programs continue to make an impact, particularly in the underserved areas. Mobile health units are reaching residents with services including screening, vaccination, and chronic diseases management. Campaigns focused on healthy lifestyles are empowering communities to prioritize prevention. We are also seeing progress in improving the financial sustainability of the Department of Health. Through legal strategies such as mediation and improved defense mechanisms, we have significantly reduced the medical legal liabilities. At the heart of our efforts is a shift in culture. Our I Serve with a Smile campaign is promoting empathy, accountability, and pride in public service. Behind every program is a renewed commitment to treat people with dignity and deliver healthcare that uplifts and heals. House Chair, we welcome the Minister's clear vision and commitment regarding the transformation of South Africa's public hospital network, particularly high-demand areas such as Gauteng and underserved regions across the country. As outlined in 17 major hospital projects that are underway at various stages of design and development. Of particular significance are the large-scale replacement projects for the 3 central or academic hospitals. The first one is Dr. George Mukaria's Hospital in Gauteng, affiliated with Sfako Health Sciences University, Nelson Mandela Academic Hospital in Amtata, Eastern Cape, and Victor Mxenge Hospital. Furthermore, to plan to establish 3 new central hospitals in other provinces with such facilities, which is with Mpumalanga, Northwest, and Northern Cape, is a bold step towards equitable healthcare access nationwide, and it's going to help us again and ease up some of the pressure in Gauteng because we do service Mpumalanga and Northwest. Across South Africa, a quiet revolutionary healthcare is underway. From rural clinics to academic hospitals, hope is returning where despair once lingered. Babies are delivered in modern maternity wards, equipped with the latest neonatal technology. Community healthcare workers walk door to door in informal settlements, offering screenings and support. That's what we've been doing in the province. Children living with disabilities are receiving care earlier, and thanks to integrated centers of excellence that we have built in the province. Long queues are beginning to shorten as digital systems streamline appointments and record keeping. Young professionals are returning again to public sector, inspired by a vision of service. Our hospitals are no longer just places of treatment, but centers of innovation and teaching. In Gauteng, emergency departments are saving lives with faster diagnostic and trained trauma teams. Mobile clinics are bridging the rural access gap. Surgical outreach programs are bringing smiles back to cliff lip children. The spirit of Batupile again is being revived, not as a slogan, but as a living ethic. We are seeing fewer affordable deaths, fewer complications now, and more timely interventions. Mental health is no longer a taboo topic. It is a growing focus with new beds and specialist care. Our fight against TB and HIV is far from over, but our tools are sharper, our resolve firmer. Patients now leave facilities with more than prescriptions. They live with renewed dignity. Feedback loops are closing. Patients' voices are shaping service designs from young mothers to elderly pensioners. our people are beginning to feel and see and to be feel and be seen and be served. Healthcare
Thank you,
workers are once
MEC.
again wearing uniforms with pride. Thank you, House Chair.
Thank you very much for your inputs, MEC. Honourable members, we return to the House and now we continue with the political debate. And Honourable Peter is representing the UDM.
Sihlalo walendlu namalungu onke alendlu ahloniphekile kubaphathiswa abakhoyo namhlanje ndithi ukuba uThixo ebeya abe ngumntu ndiyaqinisekisa ukuba kwayihlabathi ngelatshabalala kwantlandlolo ukuba nam bendinguye unyana wakhe bendakuye ndivale amehlo zintluni ndime apha namhlanje ngokugunyaziswa ngumbutho we-UDM ndinentloni intlekele kwanehlazo lokuthotyelwa kwezidima zabantu phantsi iikliniki zephondo lempuma Kapa zilixhoba lokukhuthuzwa mhla nezolo phantse mihla yonke abantu bafika indonga zithembisa kodwa ngaphakathi kungekho mayeza umzekelo ophilayo phaya eJoe Slovo eBhayi zizililo zodwa mhla nezolo bayalila nangona abemi belilizwe bethenjiswa ngegunya lokuphila oko kujike yabaligunya lokufa amaziko empilo ekhona abahlali bephondo bambi baphethe bezivala iclinics ngenxa yokungabikho kwamayeza kungekuba bubundlobongela koko kukuthumela umyalezo kurhulumente ukuba konke oku usithembisa kona akukho umzekelo ophilileyo iambulance ezaye zanda ukusuka ku306 ngo2018 ukuya ku439 ngo2023 malunga ne190 zeambulance zikwimpembelelo yonqunguphalo zilengalenga koomakhenikhi inokuba kunjani ngoku ngo2023 kwanenkokheli kungeli lixa zisafinqelela amazwi okugqibela ezithembiso iinqwelo zaphuka mhla nezolo ngenxa yesimo sendlela ezikwizinga elisezantsi isebe lezempilo lona liqhwalela bade abemi basemaphandleni benze macebo wambi ukuziyela kwezo ziseko bambi baqhutywa ngegriva ngenxa yesimo selisebe maxa onke kushokoxeka oogqirha oonesi kodwa iilokishi zethu zizikhalo ngenxa yokungafumani koogqirha noonesi imisebenzi umbuzo we-UDM umile mphathiswa omhle njengoko siyi-UDM siwuxhasa umbono we-National Health Insurance siza kwenza njani sixakwe lunqongophalo lwamayeza iinqwelo zothutho zingekho nje kodwa nje okusesandleni sethu kuyawa yini na ukuba singathathi intonga mphathiswa omhle siyeni kumadoda esakuba ngabaphathi belilizwe mandulo phaya ootata ugeneral bantu bonke holomisa ooroof meya iziswenye zelilizwe zisekho siye kubuza ukuba nanisenza njani na nina ngamaxa nisakuba nilawula elilizwe ngoba kwakungenjena namhlanje zizikhalo mhla nezolo mphathiswa omhle ukuba kwasikuthethi sakube sithenga ubuso bakho phambi kwalendlu sibuze kodata uholomisa ukuba mandulo phaya abantwana bethu ababepasa imatrix wabaqesha njani kwisijoni abantwana ababepasa imatrix wabaqesha njani kwisipolisa abantwana bethu ababepasa imatrix wabaqesha njani kumapolisa endlela kubantwana kwethu abapasa imatrix wabaqesha njani koonesi i-UDM ngoko ke ihlaba ikhwelo isithi amade ngawetyala mphathiswa omhle itsho ke ixhasa le budget ngenxa yabemi beli. Enkosi.
Thank you very much indeed, Honourable Peter. Honourable members, we will now hear more from the Department of Health from their perspective, and it's the turn of the Deputy Minister of Health, the Honourable Patla.
Thank you very much, Honourable Chairperson. My greetings to my colleague, the Minister of Health, Dr. Mtsoaledi, MECs present and those on the virtual platform, our Chair of the Select Committee, Mayor Desiree Finis, and all the honourable members of the committee, members of this House, ladies and gentlemen. Thank you very much for this opportunity to participate in the budget vote of the Department of Health 25-26. Honourable Chair, we hold this debate on a very important year when, as other honourable members from the ANC have indicated, when we celebrate 70 years of the adoption of a very important document, the lodestar during our struggle for freedom, but also the base document for our democratic constitution, which has remained relevant up to today, namely the Freedom Charter, which is celebrated 70 years just a few weeks ago. In the area of health, the Charter declares, I quote, "A preventable health scheme shall be run by the state. Free medical care and hospitalization shall be provided for all, with special care for mothers and children," close quote. Honourable Chair, while we acknowledge that a lot still needs to be done, we also assert without any doubt that we have moved a long way in the attainment of the aspirations of the Freedom Charter. When we passed the National Health Act in this House in December 2023, we said that it would be the next serious milestone towards the realization of the Freedom Charter. And we are well on our way in implementing this act, despite the naysayers, including the MEC somewhere on my left. When this act is fully implemented, the aspirations of a preventative health scheme run by the state and free medical care at the point of service, as espoused in the Freedom Charter, will be a reality. Honourable Chair, as other members have touched on, one of the burdens we face amongst the quadruple burden of disease is that of non-communicable diseases. So while we remain focused on eradication of infectious diseases such as HIV and AIDS, TB, malaria, and other, especially children's infections, diseases, and also diseases also of waterborne diseases such as cholera and typhoid. We're also very conscious of the fact that as a country and also as a universe, we face rising menace of the non-communicable diseases, which is challenged not only to developing countries, but also developed countries, which is the reason why we have the United Nations General Secretary convening on the fourth time the UN General Assembly to look at commitments towards eradication of non-communicable diseases in September this year. As we talk about this, as other members have touched on, we focus on the fight against high blood pressure and its related complications, including kidney diseases, strokes, heart diseases, diabetes, sugar diabetes, with complications such as amputations and blindness, various forms of cancer, especially cancers which affect women, but also men and children, chronic respiratory diseases, and also key amongst them mental illnesses, including those caused by substance abuse. Our overall strategy in terms of dealing with non-communicable diseases is anchored on prevention, early detection, and treatment. Where cure is possible, we treat to cure, but where some of those ailments are lifelong, we treat to make sure that people are retained on treatment. As some of the members have already mentioned, in terms of prevention, the cornerstone of prevention is, of course, our lifestyles, how we live our lives. Key amongst those being making sure that we don't indulge in smoking and also other uses of tobacco, making sure that we either avoid completely the taking of alcohol, or if we do so in serious moderation, healthy food, which is very high in fiber, vitamins, and other minerals, but also regular physical activity. And we add members of this House also to make sure that we can do our best to live by these standards, including regular physical activity. And as a Department of Health, we're not only dealing with this alone, we also partner with various community organizations, including organizations such as parkruns, which are involved in mobilizing society to make use of open spaces where we live. And this can be accessed quite easily by joining these clubs. In 2023, we published draft regulations to improve food labeling requirements, which clarifies much more explicitly the content of food, compelling food producing companies to make sure that the labeling on the food products must be easy to understand. After public comments, we are about to conclude the amended regulations, which will improve the visibility of the content on especially packaged food items. Our next level of, as we have mentioned, is prevention, early detection, and treatment. In as far as detection, we are focusing on screening and treatment. We continue to strengthen screening services for early detection and treatment of high blood pressure and also elevated sugar glucose. As a means of preventing and controlling these NCDs, we are implementing a national NCD campaign to improve this early detection. The campaign aims to strengthen each district's community-based response in line with the integrated people-centered health service approach. I'm happy to report to this House that in the last 5 years, we have been able to surpass the targets which we have set, which were to screen 25 million people for both high blood pressure and also elevated sugar levels. During the 24-25 financial year, we managed to conduct over 44 million screenings for high blood pressure and also just over 44 million for blood glucose. We want to take this opportunity to thank our health workers on the front line, but also community health workers for major contribution in this achievement. For the next 5 years, we plan to conduct over 45 million screenings, both in the area of high blood pressure and also blood glucose. Honorable Chair, in terms of preventing chronic respiratory diseases, I hope that the National Assembly will pass the new tobacco control bill, which is all sitting with the committee, processing it. And we hope also that when that bill comes to this House will also support its adoption, because in so doing, we'll be saving the lives of millions of South Africans. Honorable Chair, in the area of cancer, according to the South African National Cancer Registry, the top 5 leading cancers ranked by a number of cases during 2023 includes breast cancer, prostate, cervical, colorectal, and also lung cancer. Cervical cancer ranks as the second most frequent cancer amongst women in South Africa and the first most frequent cancer amongst women between the ages of 15 and 44 years. The number of new cases of this cervical cancer increased from just over 7,400 to more than 7,600 in the year 2023. Cervical cancer is unique amongst the various cancers in that its causative virus has been clearly identified and a vaccine has been developed, and therefore it's one cancer which can be prevented and is one of those which we aim to eliminate. It is for this reason that the World Health Organization is leading member countries in a campaign to eliminate cervical cancer. So while we're focusing on elimination of communicable infectious disease, amongst the non-communicable, we are quite confident that cervical cancer can be eliminated. As a country, we have made significant progress already since the start of our HPV human papillomavirus vaccination campaign in 2014. To date, between 85 and 89% of targeted girls in grade 5, that is in the age of 9 years, have been reached with this vaccination. During just February and March last year, during the round of HPV vaccination, we were able to reach over 400,000 young girls, which constitute just under 89% of the targeted population. The program has since been extended from public schools to also private schools. The WHO has also assisted us by while we were previously doing 2 doses, the scientists of the WHO have now established that 1 dose is enough, so our coverage is increasing quite exponentially. The WHO global strategy to accelerate elimination of this cervical cancer by 2030 aims to put countries on a path to it can eliminate this cancer. As a country, we are committed to achieving this, which is focusing on 90% of girls vaccinated against this disease, 70% of eligible women being screened for the cancer using high-quality tests, and that 90% of women who have precancerous lesions can receive treatment, and we are ready to do that. We have introduced the screening using the HPV screening, which is much more efficient to make sure that we can detect these precancerous lesions. We're also prioritizing HIV-positive women, especially because they are at a higher risk in terms of this cancer. But understanding that it is not enough just to be able to screen and detect, we are also putting a lot of efforts to support provinces. I think a number of MECs, including the MEC of Gauteng, which I spoke now, have indicated that we are supporting them in provinces to make sure that they can establish capacity to treat the cancer. And many of the provinces are still needing a lot of capacity, especially in the area of radiation oncology. Members will be aware that in the treatment we have chemotherapy, which can be administered even at lower levels, but when you come to radiation treatment, it needs a lot of infrastructure. So we are supporting provinces, just as an example, in Mpumalanga province, which not only, as the minister has indicated, has not been having a mental health hospital, also have not had a radiation treatment. We're putting significant amounts of our conditional grant, putting just over 100 million over and above the other grants which we're providing to provinces. We have committed to the province to provide 100 million per year in the National Tertiaries Grant to make sure that over the next 3 years they can build that capacity. Also, the MEC of Eastern Cape, as mentioned, in the Eastern Cape at Nelson Mandela Academic Hospital, and also Gauteng at the George Mukari Memorial Hospital. Honorable members, another growing challenge for us is the mental health problems. In South Africa, mental disorders are exponentially driven by substance abuse, contributing to aggressive forms of mental disorders, leading also to societal problems such as gender-based violence and femicide. During the 2024 period, the National Planning Commission initiated an assessment and concluded that indeed we are not investing enough in mental health. So it's an area which we are increasing our focus. We have taken critical steps to strengthen mental health services, making sure that we can, through the mental health policy framework and a strategy for 2023 to 2030, the vision of this policy is to achieve comprehensive, high-quality, integrated mental services, which a key strategic outcome of this is for mental health care to be integrated within the primary health care. This integration is key in preventing severity of mental illness. Currently, the department is using a conditional grant to make sure that we can also support provinces in sourcing out various health professions, including psychiatrists, psychologists, psychiatric nurses, because of the fact that even though we train a lot of these specialists in the public health, but because of lucrative private benefits, many of them, as far as psychiatrists, for instance, only 1/3 of the psychiatrists which we have trained are actually in the area of the public service. Other elimination area, honorable members, which we have committed to is the elimination of malaria. malaria is not a major issue in South Africa, but it remains a major issue in some areas of the country, in 3 provinces, namely Limpopo, Mpumalanga, and in KwaZulu-Natal, in some of the districts there. Also, I'm also happy to announce that 2 of 9 districts which have also had high levels of malaria have not reported any new malaria cases, and one of those is in the KZN area. So we are making progress in as far as the elimination of malaria is concerned. Honorable members, we look forward as the health sector to hosting the G20 health ministers in November this year, just ahead of the heads of state. So we urge members here to support our budget vote, as we have a long way to go to achieve universal health coverage. Thank you very much.
Thank you. Thank you, Honorable Deputy Minister. It shows that the Select Committee on Health and Social got its work cut out. With so many targets which were exposed in this house, they've got a lot of work to do. So the next speaker on the podium is going to be Honorable Keza from Mpumalanga.
Honorable members, Honorable Chair of the House, this answers the question, Minister, about the number of patients that we see on N4 that are often commuting on N4, risking their lives, that there is no mental hospital in my province of Mpumalanga. And I take that personally. And it should then ask a question pertaining to when and where and what time frames are there to complete this project, because there's a number of people that are affected. Honorable members, the EFF believes the current system of health remains structurally shaped by colonial and apartheid inequalities, one that is plagued with urban bias, infrastructure, and services. Continuous underdevelopment of Black rural communities, neglect of traditional medicine, and community-based healthcare. Perhaps the minister today should respond on how the budget will prioritize these challenges, so that this department does not become a department of hospitals, one in which all patients must be referred to hospital or given a Panado for everything painful. The economic freedom fighters rises here with revolutionary conviction to reject this disgraceful health budget and annual performance plan, because it is anti-poor, anti-worker, and is fundamentally anti-life. We rise not on theory alone, but on the basis of real pain felt by our people in the province. From the forgotten corners of Middleburg to the overcrowded clinics of Siabuswa, Bushbuckridge, and healthcare facilities across all provinces. Chairperson, Section 27 of the South African Constitution establishes universal right to access to healthcare services, including reproductive health services and emergency medical services. It states categorically that state is required to take reasonable legislative and other measures within available resources to achieve the progressive realization of access to healthcare. The regulation of the quality of health services, therefore, requires that all health facilities comply with policy priorities and minimum standards of care. However, one finds that in South Africa, on the ground, the reality is quite different to what is promised on paper. The South African public health system is crippled, and the allocation of the budget is simply not enough to cater for the vast challenges that are inherent in this department. The EFF also notes the additional 6.7 billion which has been allegedly added to reverse years of austerity measures which have crippled the healthcare system. Allow me to begin first by pointing out the case of Middelburg Hospital, which is in itself a case study of how our health institutions have but collapsed. In Middelburg Hospital, patients are unable to bath due to dirty brown water coming out from the hospital taps. There is also no hot water in this hospital because the hospital boilers are broken. We ask ourselves, when will patients be moved to the newly opened hospital to rid the old hospital of such problems? And the worst part, there is no boiler makers employed to fix them. And this has been going for a very, very long time. We have gone there timeously, Minister, and found the same problems. The budget cuts will adversely affect maternal and child health and epidemic responses and will drive a shift towards privatized healthcare, an undesirable path, Minister, of profiteering-based and brutal healthcare for rural communities. This means that elderly patients, women and in labor, post-surgical patients and children are expected to recover in unsanitary and inhumane conditions. Minister, what kind of government allows sick, injured people to lie unwashed, vulnerable to infections and stripped of their dignity? This is not just a maintenance issue. It is a failure of governance, planning and political will. The situation at Middelburg Hospital is not isolated. It is the lived reality in many public health facilities across the provinces because of deliberate treasury-imposed austerity budgets. Clinics in Tembisiliani and Dr. J.S. Moroka local municipality are still operating without full-time doctors. Outreach mobile clinics are being discontinued due to petrol budget cuts. Ambulances delays up to 6 hours have been reported in Nkangala districts, resulting in women delivering in buggies and on the floor. Critical material health facilities like maternity wards in rural clinics are closed because of water shortages, staff attrition, and broken infrastructure. The tragedy in that Middelburg Hospital should be a regional. The tragedy is that Middelburg Hospital should be a regional center of excellence. Instead, it has become a symbol of decay caused by underfunding, outsourcing, and deliberate erosion of internal capacity of the hospital. There are no engineers, tenders are very slow. There are complaints that are often coming to the public that medicine is quite slow to reach patients. Patients wash in plastic basins with cold, dirty water. New mothers are discharged without having bathed. Right here in Cape Town, in Khayelitsha Township, where the DA so-called governs, the Khayelitsha Day Hospital has just one working toilet, which is shared by both men and women, raising serious concerns about hygiene and patients' dignity. And last month, the Public Protector's report laid bare these structural problems experienced in the Eastern Cape, Minister. In East London, Frere Hospital experienced serious challenges regarding staff shortages and compromised patient care. Frere Hospital has a severe shortage in pharmacy and physiotherapy departments. The oncology pharmacy at Frere is functioning with only one pharmacist who handles life-saving chemotherapy drugs, a situation which poses a serious risk of fatal errors. The outpatient psychotherapy services have been suspended due to the inadequate staffing, leaving post-surgical and injured patients without access to rehabilitation. Chairperson, these are not just logistical issues. They are life and death matters. In public hospitals across the country, critical infrastructure like toilets, boilers, lifts, sterilization machine, diagnostic equipment are left unfixed. This is not incompetence. It is policy failure driven by the neoliberal logic, putting cost saving above human dignity. This, Chairperson, is structural violence against the black and poor majority of this country, whose only option is the collapsing public system, healthcare system. Honorable members, the EFF offers a clear and achievable alternatives. Every regional hospital must have urgent maintenance, response teams with dedicated internal artisans, boilers, plumbers, electricians on the state payroll, not outsourced. Fill critical posts, nurses, doctors, EMS staff, engineers, healthcare, not just in Sandton, but in Middleburg, Mkondo, Emalahleni, Bushbuck Ridge, Nelson Mandela Bay, Buffalo City, and in the rural areas, in the far-flung rural areas of Butterworth. Build clean water resilience. Backup water purification system must be funded where municipal supply is unreliable. Return dignity to hospitals. No hospitals must go without running water, clean linen, functional equipment, or human hands to maintain them. In conclusion, Chairperson, patients should not have to beg for a clean body, and mothers should not have to fear childbirth because the nearest ambulance is broken or 90 kilometers away. This is not an act of God. It is the result of political choices. As the EFF, we say no to austerity measures, no to outsourcing, no to abandoning our people in sickness and pain. We demand dignity, clean water, functioning hospitals, and a fully funded, people-driven public health. The EFF will not rest until this is achieved. In rural areas, we must establish a 24-hour clinic centers in every ward, fully staffed with nurses and doctors. Why are there no ambulances anyway, Minister, in rural clinics, taking into account the distance between rural clinics and your hospitals? Prioritize the rehabilitation and maintenance and existing health facilities with proper water, sanitation, and electricity infrastructure. Introduce mobile clinics and emergency services in remote villages and informal settlements. There is a mismatch between training outputs and health systems needs, especially in critical specializations like emergency care, mental health, oncology, and maternal services. Absorb all trained nurses, ban austerity-linked moratorium on health posts, and fund full staff complement in line with national health norms and standards. Expand medical training institution and increase intake, particularly of rural areas and working class students through bursaries and public services obligation. Institute compulsory post-training community services in rural and underserved areas with proper incentives, accommodation, and support.
In terms of the department data, on its own admission, there are 634 doctors who finished community service in the first year by January 2021, 2025, Chair, who remain unemployed, and the Minister should speak to these issues. Thank you very much, Chair.
Thank you, Honorable Keza. The next speaker is on the visual platform, is the MEC for Health in the Free State, Honorable Mahlatsi. Over to you, sir. Honorable Mahlatsi. Is Honorable Mahlatsi on the platform? Yeah? Why is he not? Honorable Mahlatsi, this is your chance to provide the program of the department.
Honorable Chair,
Honorable
Chair, my apologies.
All right.
The system kicked me out, but at least I'm back now.
All right, you can fire on, Honorable.
Honorable Chair of the House, much appreciated, and you are acknowledged. Minister Aaron Mtswaledi, Deputy Minister Dr. Joe Patla, honorable members of the National Assembly, honorable members of the NCOP, MECs from respective provinces, and let me stand on the protocol that has been established by the previous speakers. Honorable Chair, I address the House today on behalf of the Free State Provincial Government and our resilient people to express our full and unwavering support for the budget that has been tabled by the Minister. The budget that has been tabled with passion, the budget that has been tabled with vision, clarity, and we would like to take this opportunity to congratulate the Minister for that achievement. This is not merely a financial instrument. It is a declaration that in this democracy, the dignity of every citizen shall be upheld in our clinics, in our hospitals, and in our communities. It is a bold blueprint that advances universal health coverage through the implementation of the NHI, which seeks to eliminate the diseases that continue to steal our futures and to invest in infrastructure that honors humanity of our people. The Minister's call to action resonates deeply with us in the Free State, in line with the Minister's vision to lay strong foundation for the implementation of the NHI. We have prioritized digital transformation, accountability, and systems readiness. I am proud to report, Honorable Chair, that the Free State has registered almost all our regular patients on health patient registration system, and we have been able to achieve 431,000 of them being verified through the Department of Home Affairs interface. I firmly believe, Honorable Chair, that the NHI is within reach, especially against the backdrop of the recent report about how discriminatory some healthcare funders have been towards African healthcare service providers. This is what I call institutionalized unfair discrimination. The current landscape is fatally flawed, Honorable Chair. We need a new and better dispensation, which is only possible through the implementation of the NHI. We have successfully, as the Free State deployed the Hospital Management System 2 in 16 hospitals in our province. A full digitization has been achieved at Pekulong Hospital, funding secured for expansion to Dihlabeng and Mufumahadi Manapo Mopedi Regional Hospital. We are proud to pioneer the Impilo pilot in Dihlabeng, which is South Africa's first fully digital primary healthcare electronic medical record system. Through this platform, Honorable Chair, patient records are accessible in real time, ensuring continuity of care at the point of need. In a country where digitization has often remained a promise, we are demonstrating what is possible when innovation is matched by will. We know that systems alone do not heal the sick, Honorable Chair. It is infrastructure that builds confidence, and it is buildings that give shelter to our health rise. The Minister reminded us that infrastructure is destiny. In the Free State, we are heeding that call. Honorable Chair, the revitalization of Dihlaben Regional Hospital, which is currently a 30% completion rate, will signify and enhance our regional referral capability. We welcome the completion of Tweespreid Clinic and the progress in Clocolan Clinic, and these projects are funded directly by the funds from the National Department of Health. That is why we stand also to support the budget. Major refurbishment at Bitumelo, Bongani, and Elizabeth Ross hospitals have improved service quality and patient flow in our facilities. We have completed new clinics in Mama Fubedu, Zastron, and Kwakwa. These are not just buildings, they are lifelines for communities that have waited too long for this. In response to persistent water and sanitation challenges, we have installed boreholes and elevated tanks on several of our facilities. That is why we welcome the Minister's announcement of a budget vote allocated to hiring doctors, nurses, and other healthcare professionals. On the front lines of our fight against disease, we have embarked on a minister's charge to eliminate HIV/AIDS and TB. Our Close the Gap campaign has focused on reaching the 22,631 people in the province who are missing, who are living with HIV but not yet on treatment. Of this, more than 16,000 are in Mangaung alone. Our campaign is on full speed, on full swing to recover all these patients that we have lost. Our children, Honorable Chair, are at risk. Teenage pregnancy remains a persistent challenge, with 87 reported facilities, delivery with 87 reported facility deliveries amongst the girls, under 19 in the past year alone. We are responding through a multi-sectoral campaign that brings schools, clinic, and community leaders together to offer girls the tools to plan their futures. We started our campaign. We launched our frontal attack, apologies, Honorable Chair, on teenage pregnancy and child pregnancy a few months ago. The campaign is gaining traction and the offshoots are coming out. The schools and towns we have reached are reporting a decline in learner pregnancy, and at least 6 schools we have touched. This has given us enough energy to take forward our campaign and our struggle. When women and children, Honorable Chair, experience the trauma of violence, they must find in the health system not bureaucracy but healing. That is why we opened the Butchachaba Tutusela Center in collaboration with the NPA that offers support and medical support for survivors of gender-based violence, which also advances the restorative function of our state. Good governance must underpin all these gains in this regard, Honorable Chair. Free State is honoring what is showing what is possible. We have achieved 164% of our annual revenue target, largely through improved fee collections and strengthened partnership, including with the Kingdom of Lesotho. To protect public investment and restore public trust, we are implementing a 6-point litigation reduction strategy aligned with the Noyila judgment, which emphasizes structured settlement in medico-legal claims. And we are addressing environmental risks. Whatever treatment, wastewater treatment compliance. Currently, 58% is being improved through infrastructure upgrades and the appointment of waste management control officers. Honorable members, the Free State is not just echoing national priorities. We are acting on them. We are living the transformation that budget vote 18 seeks to accelerate. The people in our communities do not speak policy language, but they know when they are treated with dignity. They feel the difference when the clinic opens on time, when their baby is born safely, when the medication is in stock, and when a nurse meets them with kindness. We recently, Honorable Chair, had a measles attack in a measles outbreak in our province, and our team showed very much high agility. There were 84 positive cases in towns in the Northern Free State. In the Lejwe-Leputswa district, we have vaccinated more than 5,000 children up to now to try and eradicate that the outbreak. Process of blacklisting of companies have been initiated and already progress towards blacklisting the companies who either did not complete or abandon their projects. We want to protect our clients and the healthcare service. Honorable Chair, towards closing my speech, Honorable Chair, we have ushered in the robotic assisted surgery in the province some months ago, which was the first in the country and in the continent. We have installed a PPOD device which is able to analyze the body composition of each child at birth and be able to forecast the later possible illnesses of each child and recommend how to correct that through nutrition. This budget, Honorable Chair, as I close, is not merely numbers. It is a moral compass that promise our people better health care. Honorable Chair, the reference that was made about the experience of one patient in Bitumelo Hospital would like to be provided with the details of that so that we can be able to deal with that. Because for us, health is a matter of life and death. I hereby implore upon the House, Honorable Chair, to support the budget.
Honorable MEC, on that note, I think Honorable Brett will definitely give you that name. Yeah. She'll definitely give you that name. Thank you for providing the program and the successes of your department. The next speaker on the podium is Honorable Brett from the Home of the Legends.
Agbare huisvoorsitter, agbare lede, agbare minister, mede-Suid-Afrikaners, goeiemiddag. Vanmiddag is daar heel wat gesê oor syfers en statistieke. Goeies sowel as onsuksesvoles het onder die loep gekom. At first, I wanted to join the choir in debating figures and programs of this health budget. But this budget today is not only about statistics or programs. It is about people and the department's legal duty of care for ordinary South Africans. Behind the 78 billion rand in civil claims against the department, that is nearly 80% of the combined health budgets, lie real life stories. Evidence of real life stories was tested in court, and judges of the High Court ruled on factual findings. In all successful claims against the department, the courts ruled that unreasonable care constitutes a breach of the duty of care, and that is unlawful. Negligence cases in the state hospitals and clinics tell a horror story, even more ghastly and graphic than an episode of Carte Blanche on TV. Take for example, little Siyabonga, who was born in the Polosong Hospital in Brakpan. Due to the department's negligence, he suffered spastic cerebral palsy, caused at his birth due to the staff's failure and unwillingness to perform a cesarean section on his mother. His mother was in pain for hours, crying out for help. The nurse's excuse was that she had many other patients to look after. This case costed the taxpayers 9.4 million rand, and there are many other cases such as this. Honorable MEC Kapa from the Eastern Cape. The Livingston Hospital in the Eastern Cape, 74 doctors left this hospital over the past 2 years, including 41 medical officers and 18 specialists. Theatre activities was reduced with 30%, oncology bookings decreased from 50 to 30 per day, Pediatric appointments have reduced by 50%. Eye clinics have closed down. Appointments take an average of 4 months, and vital outreach programs have been scrapped. I have not heard your explanation of this failure under your watch. This leaves the question, does the health department require more money and more new programs, such as the National Health Insurance, or only better management of resources and political will to provide the duty of care for patients that they deserve? Honourable Minister, this budget grants you another opportunity today to make the department work smarter and more efficiently with what you have. Honourable Mtetwa, the uncontrolled influx of illegal immigrants that you are complaining about today is a legacy of your leader, Jacob Zuma's term as president. Today you complain about the situation your leader created. Agbare farmer, jou herkousel raak nou smaakloos. Die ouditeur-generaal weerspreek jou misleidings. Die konstante galbraak en sleg sê, wat uit jou mond kom, mag dalk 'n 26 of 28 ding wees, maar dit is betwyfelbaar of dit Christelik is. Honourable Mokwele, your finger pointing is very hollow today. Your former leader propagated onions and garlic as cure for HIV/AIDS. And the only reason why you are referring to USA misinformation is because you have nothing better to offer than misinformation. Honourable Keza, the EFF rejects a budget that is meant to help the poor, that you pretend to present. It is nonsensical. Do you rather prefer a health department with no budget, no money, no programs? This is breaking and not balding. But, Honourable Minister, all hope is not lost. There are many good, reliable and dedicated people left in the health sector. Therefore, this budget gives the builders in government the opportunity to right what is wrong in the system, a goal the DA wants to work together to achieve. As DA, we want to work together to restore hope and dignity to all South Africans, to work together to provide the care all patients who rely on state health services deserve. I thank you.
Leave the magistrate alone, please. She's debating in the health budget. Let's deal with health issues only. Thank you, Honourable Press, for your input. And then the next speaker on the podium is His Honourable, the Minister of Health. Who's that? Oh, you're not sleeping. The next speaker is from a delegate from Mpumalanga, Honourable Sibande.
Thank you, Chairperson, Honourable Chairperson, Honourable Ministers and the Deputy Minister. I think what is the key fundamental thing is to remind people where all these things started. Unlike to start at the head, or at the toes, we must start at the head where it started. I'll give the background. Of which the background will be very, very painful. Honourable members, Honourable Chairperson, debates surrounding the enactment of the NHI have not only revealed differences in the policy's orientation, but have also exposed fundamental contradictions in those who claim to also strive for justice, redress, and transformation. Some among us remain reluctant to reflect honestly on the roots of our health inequities, looking at how, like all other sectors of society, healthy care in South Africa was designed to reflect the broader political, social, and economic racist and exclusionary policies of the colonial and apartheid governments. Chairperson, I'll start with the history now. Jan van Riebeeck was sent to Cape of Good Hope to establish a refreshment station that could provide fresh water, food, vegetables, fruits and meat, and medical assistance. Some people, they don't know that they also come for medical assistance. They were very hungry and starved. With generosity, the Khoi clan gave them 3 ships, including indigenous medication. After that, they wanted more. They started to demand sheep and cattle from the communities. They dug dungeons behind the construction site. When the Khoi clan chiefs were unable to honor their demand, they were put inside the dungeons up until their neck. After that, they will start kicking and beating them with shamboks. That's when they started cattle theft. They also started pressurizing traditional healers to suck information about indigenous knowledge about medication, which include umhlonyane, African potatoes, etc. While all indigenous knowledge was stolen from indigenous people, black majority. NHI is here to stay. Also, Minister will be making a mistake if we divorce NHI with the land. The land issue must continue because that's where we're going to build hospitals and clinics. They go together. We mustn't separate them. Chairperson, mina ngiphuma eMpumalanga eBhetali eMazambaneni emzinoni lapho obabamkhulu nobaba bethu bebeboshelwa ezinqoleni okuyizinkalishi maceda bagcina ngokubulawa kwenziwe umanyolo ngezidumbu zabo ezivandeni lapho kutshalwa khona amazambane. House Chair, let me borrow some words from some philosophers. History is not there for you to like or dislike. It is there for you to learn from it. And if it offends you, even better, because then you are less likely to repeat it. It's not yours to erase. It belongs to all of us. Chairperson, ngenkathi yobandlululo isigayigayi esingungqondongqondo esasungula i-chemical biological warfare uDr. Walter Basson wabanjwa futhi wagwetshwa wabeka amaqala ngezenzo zakhe. Kodwa-ke izinhlaka zakhe nalabo abesebenzisana nabo kwathula kwathi cwaka azange kwenziwe lutho. Yona imfihlo lamabhoxongwane angabondlebe zikhanya ilanga aqala kudala ukusebenzisa impi yezikhali zempuphiso eyayishabalalisa nokunciphisa futhi nokubulala isizwe esimpisholo. Kubonakalisa phela nangendlela abaziphatha ngayo. Izenzo zabo zenza siqagule futhi sibe nongabazane. Kububeka kube sobala futhi kuyakhanya ngamhlophe ba okwezinqe zaselesele ukuthi kungani idlondlobele kangaka ukuphikisa imithetho eletha izinguquko ezimpilweni njenge-NHI. Chairperson, one of the members of EDA said here, kune-denial ku-government ehola we-ANC. Na impendulo. Chairperson, let me remind members and the public there at home that there was a time la kwenziwa khona i-sexual commission in terms of iraf. Why ngiraise ngoba ukulimala kwabantu bese involve izimpilo zabantu. I-sexual commission, their findings bathola ukuthi kunabantu abaningi kakhulu kulabo ibale limhlophe. Ama-companies wabo akwaziwa ukuthi abuyaphi, akwaziwa ukuthi ikontract ayisayina nini, kodwa bayahlomula ku-RAF. Now, I'm happy if one member said corruption people must be arrested. It must start there with those people to be arrested. And then also, Minister, your role is very much important. Some people figures all about next. Not long ago, between 2015 and 2017, there was an investigation task team, which you said that investigation task team began to dealer ngokuchecka healthy affairs. Ila what discover we must solve our problem ngoku implement NHI. Some people they don't know what is exactly. We wanted to deal about the issues which you are concerned about. And then Honorable MEC from Western Cape. NHI, again, it's here to stay. Healthy and wealthy. Healthy is wealthy, and wealthy is dignity. Honorable members, some people, they wanted to discord and some of the things as if Western Cape is let us win. Go to check a car later. I can name a lot of areas which we can take you to. And Honorable Minister, I would like to propose that one of the day, each department, including Nelentuzan and a portfolio, Nelentuzan and a Slack committee, let's go and visit some of the areas not very far from the taxi rank here in town. You'll see Mutabantu Batalenda when it's in Jan. Mesenga abuya futhi. Ungangihlebile khuluma kakhulu. Inhlangano ye-MK.
Honorable Masipa, you are allowed to heckle, but you cannot disturb the speaker on the platform. Please.
I didn't request you to protect me. I can protect myself. Yes. Go MK party. Inhlangano ye-MK party. Ubaba wathi. Uzo. I-ANC izophatha kuze kubuye indodana. Kodwa fani, ubaba lekha kumele azi ukuthi abantu be-MK party la eParliament abenzi lokho. Benzi opposite. Manje sebekhohliwe ukuthi again sebekhohlile ukuthi izwe laseMorocco. I mean, manje sebashaya ingwijukhwebu sebefulathele iWestern Sahara. Sebebalekele imoro sebagijima neMorocco. And ngibuya khona physical mhlambe when ifunda ephepheni. What you're doing is, or while sikhuluma nge-genocide of the people la abantu babulawa khona, iMorocco ne-Israel bathatha abantu kwenziwa ngama-experiment. Today, fortunately enough, eWestern Sahara ngibuye eTifarat, one of the towns. Even a Palestinian can tell where I'm coming from. Angikhulumi ngetesephepheni. Chairperson, manje ngaloko ngithi kubo ake bame kancane ngoba abenzi lento yayishiwo ubaba zangathi kubulawe ANC. Banenzondo engakanani adoni babhodla umlilo inzima kabi. Nge-ANC. Ngesimanga the way bayizonda ngakhona. Mara ubaba kayizondi ANC. I-opposite. Chairperson. Formerly, healthy care during the colonial era was developed to serve settlers. Indigenous people were mainly excluded with minimal access to formal healthy through missionaries, or when it is served the interest of the colonial settlers in terms of being fit to work. Besingabuya baba, sibalisama uceza. Please, ngicela correct something ne. Ngibuye eMpumalanga. From home, where I'm staying home to Middelburg, it's about 64 kilometers. Some of the things which you're saying here is not proven. Correct. There is a minister, there is a new hospital. The only thing is to fast track that things must be done. That's all. Maybe he's concerned because of ufuna tender. Because you complaining about tender. Maybe ufuna tender. UDM. Baba, where UDM? Let me also request you for do something. Uyawacela ukuthi kumele kubizwe angazi ubani nabo baba Olomisa. Ubaba Olomisa the time kwenzeka lezi zinto ukhuluma ngayo ubeketha iminister la. All the thing ocomplaina ngayo busa yena. Following in the same trajectory, the apartheid government institutionalized racial segregation and created a hierarchical system where different races were served under the different health system. Healthy, before ngifika lapho, Minister uzongikhumbuza nyazi. You see, some people, they thought kuti NHI is started South Africa. Kwabanye abantu, it is wise. It is all right because it's used by the white people. This thing, they might be held to something abroad. I've forgotten the name, you'll remind me. Yes, when it was used by them, you see, Minister, is that some of the people, when they debate here, they forget one thing. Once we start to implement some of the laws which we agreed upon, they'll run to Trump. They'll run to Trump. But Trump at wozan abasezi sibahleli. Angazi bahleli. And by saying that, it doesn't mean we must stop. Deputy Minister, you are on the right track. You are on the right track. Minister, you are on the right track. And I feel very sometimes pity.
The noise levels are high now. Can you please give the speaker a chance to...
Chairperson, because I don't want to personalize it, because to some of them I will respond, because some of them, they are sons and daughters of the bucket system ministers. Their fathers and mothers, they were ministers of the bucket system in the past. So, Minister, you say, don't feel as if you are alone when you are pounding time and again about the issue of NHI. What there's corner, it's our healthy, but don't divorce it. Labanga funi corn. Nagu ishi land. We must have our land back so that we build hospitals, so that we build clinics. Noma singalithatha kanjani akufuni wena lokho. Chairperson, before I sit down, honorable member, we are called ukuthi ngelinye ilanga omunye wabaholi babo bekade associated nabo. Wathi di sonera vet firvapen next ni. Thina sicela in transformation bona bakhuluma ngama firvapen next ni. Aburme sonera firvapen next ni. Thina sicela transformation asifuni izibhamu. Asifuni ukuli kodwa ungibuza mina ukuthi siyolithatha kanjani. Chairperson, angibanikeze 32 seconds. Thank you, Chairperson.
Honorable delegates, on that note of Honorable Sibande, we now have to allow the Minister of Health to respond to the team health about issues raised. Over to the Minister.
Thank you very much, House Chair. Honorable Adrian, did I hear you well? How can one wish such bad things to one's country? Even trying to threaten us and our people, how many are going to die and all that. Simply because Trump took away his money. You even try to justify why he had to take it away. But let me tell you this, we're not living because Trump wishes so. We are living because we want to live. I want to make that very clear, but I want to correct something. Governments never take a Hippocratic oath. It is taken by individual doctors as a covenant between the doctor and the patient. It does not have anything to do with government. I took an oath as an individual doctor, not because I belong to any government. I also want to correct the stats we have given about HIV. When you put this malevolence, this very bad picture, on the 20th, rather the 10th, on the 10th of July, the UN AIDS came here to give a global report about HIV/AIDS globally. They chose South Africa because we are being very successful. And the executive director of UN AIDS spoke well about what we are achieving. So where do you take your facts from? You're not an authority on HIV/AIDS. This is the World Authority saying we are doing very well. So, ma'am, please, man, don't do such bad things to your own country. Honorable Duplessis, value for money. Let me tell you what is not value for money. It's the present system we are running. That's why we want to change it to NHI. It's not me who is saying so. The World Health Organization declared that in 2009, that we and the US are outliers because of the system we are running here. Professor Robert Yates of London School of Economics 2 months ago issued an article that South Africa must dump the US healthcare system because it's not good for us. What is meant by US healthcare system is where you spend a lot of money in health, but you don't get results. Because that money, the manner in which it's spent, won't give you results, which is what situation in South Africa. We are running two healthcare systems, one private, the other public. The private one heavily subsidized by this government, which is what we want to stop. All of you here, you are getting heavy subsidies from this government. Money that should be going to poor people is coming to take care of you and your families. But you don't see anything wrong with that. 51% of healthcare expenditure in this country goes to private health to support 14% of the population. And the remaining 86% must be supported by the remaining 49%. And you are asking me, let me tell you what we have done with this money, which is so little. Which is so little, by the way. It has delivered 1,060,000 babies every year versus 140,000 babies that are delivered with this huge money in the private sector. That's a fact. It is treating 94% of HIV positive people versus 6% treated by the private sector. It's treating 100% of TB versus 0% of private sector. It is paying for 98% of all childhood vaccines versus 2% only. And you say that's not value for money. It has reduced maternal mortality from 240 per 100,000 births to 109 in a short space of time. It has reduced children born HIV positive from 70,000 in 2004 to only 634 in March this year. And you tell me this is not value for money because of PMTCT. I don't expect DA to support NHI, but I don't expect them to misinform. I don't expect them to support it. The facts are simple. The present system with medical aids covers 72% of the white population, but only 10% of the black population. Where is the money to cover you? Why do you think this money must cover you? When it goes to cover the others, you say, where is the money? The present system covers 72% of the white population, but 10% of the black population only. And you expect us to keep quiet? Man, we can't. We can't.
On that note,
DA,
Honorable Minister, on that note of Agnier, your time has expired.
Okay, thank you.
Honorable delegates, Honorable Badenhorst, and Honorable Wenger, the House is still on, please. So, Honorable delegates, we have come to the end of the budget vote 18, health. I would like to thank the Minister, the Deputy Minister, the MECs, and the SALGA representatives who participated in this debate. Thanks for the job well done, the entire team as a whole. So now we'll be moving to the next budget vote, which is the policy budget vote number 38, which is tourism. And then I'll allow the exchange, the change of guard. Honorable Minister Mtswaledi and DM, allow for a change of guard. Honorable Tilele and Honorable Sochu can come in and occupy the front seat. Honorable delegates, we will now proceed to the second order of the day, which is the policy debate on budget vote number 38, tourism appropriation bill. I would now like to call the Honorable Minister P. Tilele to come and open the debate. Over to me.
Good afternoon, good evening, Molweni, Dumelang, Assalamu alaikum. Thank you.
Hello, Minister.
House Chairperson, our Honorable Deputy Minister, the House Chairperson, Honorable Chairperson of the Select Committee on Economic Development and Trade, Ms. Sonia Boshoff, all the Honorable members of the Select Committee, the DG for Tourism, DG Vele. We also have our CFO of the department, Ms. Mponia, and the CEO of South African Tourism, Ms. Nombolelo Goliwa, entity representatives, colleagues, and guests. I really look forward to presenting Budget Vote 38 today for the 25-26 financial year this evening. But I'm also interested in listening and learning and debating and working together to find solutions on how best to deliver to all 9 provinces. Tourism can be truly a force for good in the remote communities such as Kamiesberg in the Northern Cape, Tsatsane and Sekakune, Limpopo, and others. And today I will demonstrate how our 2.434 billion budget will help us build on the achievements of the last year of the 6th administration, how we are planning the future, how we are tackling head-on the Select Committee's members' concerns and recommendations. I would like to first appreciate also the concise and to the point Select Committee report published in the ATC on Monday, 21st of July, 2025. Under the leadership of the Chairperson Boshoff and the Select Committee have identified key aspects where I too think the Department of Tourism and South African Tourism can sharpen our focus to deliver on our mandate to promote growth and development of the tourism sector so that people on the ground in each of the 9 provinces can feel the impact. And as we all know, the budget is based on the Government of National Unity's program of action for the next 5 years. And our mission is clear, is to elevate the profile of tourism as a key driver of economic growth and job creation, as it's identified in the National Development Plan and also the Tourism Sector Master Plan. Together with the private sector and our communities, and like the Select Committee's report says in its report, and I quote, tourism can be the leverage to accelerate economic growth, boost employment creation, and change incomes in rural communities, close quote. As chairperson, I'm here today to discuss the future and what the tourism budget will deliver to South Africans, as well as the impact on people's lives. And as we know, the main allocations are as follows: 1.3 billion to the department's entity, SA Tourism, 331 million for destination development, and the majority will go to Working for Tourism program, 331 million for tourism sector support services, which will include tourism incentive programs like the Green Tourism Incentive Program, the Market Access Program, the Tourism Grading Program, and the Tourism Transformation Fund. As chairperson, the Select Committee members were spot on when they wrote in their report what the Department of Tourism and SAT must focus on the 25-26 financial year. All these matters the department is trying to address in its work and the current budget policy before the NCOP today for debate. Future-proof tourism. For the legislative and policy reviews, the department will finalize and table the Tourism Amendment Bill, aligning it with the white paper with a focus on short-term rentals, grading enforcement, and governance. We will also review outdated strategies, including those on heritage and cultural tourism, domestic growth, rural tourism, service excellence, and climate change. We will enhance all new fund contracts for the Green Tourism Fund, the Tourism Equity Fund, the Tourism Transformation Fund, to include clear deliverables. And this will include a 60-day approval targets and consequence management when we fail to meet these targets. We will ensure the implementation of our community tourism aftercare program, providing post-handover support to community lodges, including business mentorship, marketing linkages, governance training, and asset protection. We will also be focusing on the future through our digital transformation and risk management initiatives, which include developing a digital maturity roadmap, a real-time tourism dashboard, data analytics, and mobile tools. We will implement the sector risk and mitigation plan for a focus on climate change, health and safety, and the tourism growth partnership plan. And other interventions also include that we want to improve the governance of EPWP, to include quarterly public dashboards for EPWP placements, fund disbursements, policy reviews, and a risk matrix. We will also strengthen internal controls, audit committees, and contract and consequence management frameworks. Briefly on the Department of Tourism Sector Growth Plan, we undertook a full review of all our policy documents during the 6th administration. That include the ERRP, the Tourism Master Plan, the Tourism White Paper, and the National Development Plan targets. House Chairperson, out of this, we set ourselves an ambitious and practical guide on how to jumpstart and sustain tourism growth. So the Tourism Growth Partnership Plan identifies 5 key core pillars for sector-wide action. 1, ease of access, visa reform, air connectivity, and road transport. 2, coordinated destination marketing for international, continental, domestic, and the MICE sectors. Thirdly, tourist safety and security, awareness campaigns, responsive support, and crisis management. Fourthly, tourism product development, quality infrastructure, and immersive route experience design. And then number 5, job creation, youth employment acceleration, and skills development pathways. So this 5-pillar growth partnership plan sets targets for government, also for the sector and the whole of society to achieve these targets by 2030. So the Department of Tourism, in collaboration with the tourism sector leaders, we will host an execution lab next week to discuss the how part, to discuss the practical approaches to achieving the targets outlined in the Tourism Growth Plan, including key stakeholders, timelines, and implementation strategies. We have to deal with the how part. So we are utilizing data-driven decision-making and fostering better partnerships to plan and execute effective marketing campaigns in existing and growing markets. We are also sharpening our game to remain Africa's premier hub for meetings, incentives, conferences, and exhibitions. We are hosting 2, of course, the Travel Indaba for 2026 up to 2028. We will refine with a more active business model to enhance sustainability and promote a 15% increase in exhibitor diversity. We will support 105 MICE bid submissions, aiming to convert at least 25 into close wins of worth about 120 million in economic impact. We will also host 10 events in villages, townships, small dorpies for inclusive regional uplift. And this I will share with Deputy Minister. I told her earlier on 5 each. And I reminded her the Freedom Charter said the people shall share. We are also sharpening our focus on key source markets such as India and China, as well as other BRIC partners to increase our arrivals. I just accompanied Deputy President Paul Masatile to China last week, and it was very encouraging to hear from 150 tour operators about the positive impact of the Tourism Trusted Tour Operator Scheme and the impact that it's having on tourism. For the first 4 months, we received 18,000 applications through the TOS visas applications. We also discuss air access, because we have to improve air access between India and China. And already Air China is flying daily, 7 days a week between South Africa and China. And South African Airways will, before the end of the year, reintroduce the South African Airways flight between OR Tambo and China. So it's now up to South African tourism to sharpen its focus, to show a good return on investment, and market the country so that we can grow arrivals exponentially. Just a few projects under tourism destination development. We have 17 community projects that are scheduled for completion in this financial year. 2 of these projects are located in the Eastern Cape, specifically the Matonzi and the Kwatwaya lodges. The department is working with DBSA to complete construction in the next 3 months. And we've also improved our oversight over DBSA as an implementing agent by establishing a project steering committee that can monitor them. The department is also constructing, in collaboration with DBSA, the Kwakwa Guest House in the Free State and the Musipen project in KwaZulu-Natal. Now, 10 of these projects are situated in Limpopo, and they include the Mapati Recreational Social Tourism, the Ndoni Dam, and the Fafidi Waterfall. So these facilities are a combination of day accommodation facilities, and it can also assist us to diversify our tourism products in the rural areas. And all these projects are expected to be completed within this financial year. And the emphasis is on expected to be completed. At the Tesani project in Limpopo, we refurbish accommodation facilities and a restaurant, and the local community has already had several functions there. In Mpumalanga, we are working closely with the community to build a new cultural center at the Mduli Lodge near the Gumbi Gate in the Kruger National Park. In the Northwest, the Maniani Lodge project is making progress and is also expected to be completed this year. There are also 5 additional community projects that are in advanced planning. And these are the Watsongo project in Limpopo, the Nkombeni project in Mpumalanga, the Platfontein and Kamisberg projects in the Northern Cape, and the Lotla Moreng project in the Northwest. We are also working to finalize condition assessment for 5 heritage sites in our country. So these investments in infrastructure, including new construction and maintenance, have a lasting impact on tourism and consistently enhance and diversify our tourism offering. Our best example of investing in infrastructure and the destination development is the Dinosaur Interpretation Center that we launched recently in the Free State. Since the launch on the 22nd of June, they've received nearly 18,000 tourists because we have agreed that the first 6 months will be free. And this demonstrates the power of partnerships. This project was funded by the the European Union, and in collaboration with DEF, we completed it. So investing in tourism infrastructure and building on what we have started, the Department of Tourism will host our first tourism investment conference in September 2025 in Cape Town to showcase prioritized projects and attract anchor investors, launching our first tourism investment booklet in collaboration with the United Nations Tourism Organization. We're also running a hackathon to include our young people in the G20 activities, a competition amongst 18 higher learning institutions to develop future digital solutions. In conclusion, Chairperson, this vote represents our commitment to action, legislative, operational, and strategic. We take note of the recommendations listed in the Select Committee's report that include reporting on key tourism funding, including the Tourism Transformation Fund, the Tourism Equity Fund. Another recommendation, the creation of a consolidated tourism development fund, accelerated review of legacy tourism policies, action plan for rural, cultural, and wildlife tourism, and together with the Select Committee, we will create a resilient and inclusive tourism sector that powers South Africa's future. I thank you, Honourable Chair and Honourable Members.
Thank you very much, Honourable Minister, for your opening comments in this debate. We now move on to the Chairperson of the Select Committee on Economic Development and Trade, the Honourable Boshoff. You have 15 minutes.
Thank you very much. Honourable Chairperson, Honourable Minister, Honourable Deputy Minister, Honourable Members, colleagues and fellow South Africans. As Chairperson of the Select Committee on Economic Development and Trade, I rise today to deliver a balanced but a firm reflection on Budget Vote 38, tourism, covering the Department's strategic and annual performance plans for the 25-26 financial year. Chairperson, the majority of committee members support this budget report. However, I wish to emphasize, Minister, that support should not be perceived as a blank check. It comes with expectations of delivery, accountability, and meaningful change. Chairperson, the department is allocated 2.48 billion for the 25-26 financial year, 365 million for administration, 475 million for destination development, 368 million for tourism research, policy and international relations, and 1.3 billion, more than half, to South African tourism. That's shocking, members. This, honourable members, is public money. It must deliver jobs, local development and opportunity, especially, as you said, Minister, in our rural and underdeveloped areas. Chairperson, afford me the opportunity to acknowledge what deserves recognition. The Gedoma Duma Dinosaur Interpretation Centre in the Free State, delivered within its 120 million budget, stands as an example of successful intergovernmental coordination, bringing together the Department of Sandparks, the Department of Forestry, Fishery and Environment, National Treasury, and the European Union. This kind of delivery South Africans want to see. Infrastructure completed, on budget, and with local impact. We also acknowledge the department's commitment to gender and disability inclusion, the rollout of digital platforms to support small tourism businesses, and the positive signs of recovery across the sector, international arrivals rising, domestic tourism gradually picking up, and a growing recognition of tourism's contribution to the GDP. However, Chairperson, challenges remain, and they are significant. South African tourism, established under the Tourism Act as the official destination marketing body, receives over half of the department's annual budget. Yet, the Select Committee is increasingly concerned that SAT's functions overlap and duplicate the mandates of other national marketing entities such as Brand South Africa and Proudly South African. It is time, we believe, for an evidence-based critical assessment of SAT's role, structure, and necessity. Minister, this is not a call for a reckless closure, but a responsible call for Parliament and the Executive to explore whether consolidation, restructuring, or alternative arrangements would better serve the public and deliver for money. Chairperson, the financial picture with reference to SAT raises important concerns. The committee has noted concerns regarding the overall cost of governance at SAT, including board member remuneration, board meeting expenses, and related governance overheads. We believe it's essential that SAT provide this committee with a clear assessment of how these costs translate into measurable outcomes for the sector. The question we must all ask is, are these governance expenses delivering proportional value and return on investment for South Africans? The Auditor General has repeatedly flagged irregular and wasteful expenditure at SAT, weak consequence management and procurement lapses, and this must be met with a time-bound action plan. Chairperson, while much attention has been paid to SAT, let us not overlook the department itself. The AG has flagged weaknesses in procurement practices, performance reporting, consequence management, and project delivery within the Department of Tourism. These are not minor compliance matters. They are structural weaknesses that risk undermining the department's own ability to deliver inclusive growth and transformation. The Tourism Equity Fund, intended to transform the sector, remains stalled. SETFA's use of the PIA to withhold key information has delayed the handover to the Public Investment Corporation, locking out historically disadvantaged operators. Importantly, the committee has expressed its willingness to assist in overcoming the impasse. As chairperson, I engaged the members to secure their support in helping to move this matter forward. Although an engagement was scheduled to address the challenges, the minister, having provided context and explaining the factors behind the delay, indicated her unavailability due to prior commitments. Efforts to secure the deputy minister's attendance were also unsuccessful for the same reason. The meeting will now be scheduled for either the third or the fourth parliamentary term, and we look forward to the cooperation from all parties to help resolve the matter and unlock TEF's potential. Chairperson, the committee has set out clear expectation and as acknowledged by the minister, and we therefore call for an independent performance review of SAT, urgent resolution of the TEF and the SETFA bottleneck, accelerated digital transformation, infrastructure investments linked to local development, quarterly reporting to the committee, a time-bound plan to address the AG's findings, and strengthened oversight structures for transformation efforts, and time-bound action plans to address the department's specific issues and report progress to the committee. Beyond these, we also recommend establishing a consolidated tourism development fund, incorporating existing funds, mobilizing private financing, and tackling inequities, especially in lagging provinces. Developing an action plan incorporating arts, culture, sport, wildlife, and gaming into the tourism strategy in collaboration with the ministers responsible. Accelerating policy reviews, as mentioned by you, Honourable Minister, including the national tourism sector, the master plan, the white paper, and older frameworks on heritage, rural, and service excellence. Using public spending to drive capital formation in partnership with departments like trade, industry, and competition, international relations, and finance. Chairperson, members further raised critical concerns. Have we truly explored BRICS, African and Asian tourism opportunities, including desert tourism from our esteemed colleague, Mr. Honourable Mabilu, in places like Kalahari or targeting the Gulf states? Why is domestic tourism not more mainstreamed, and what research underpins interprovincial tourism growth? What progress has been made on the 5 heritage sites identified in the APP, and are they UNESCO affiliated? Why do procurement targets focus on MSMEs and women-owned businesses, yet neglect youth-owned enterprises? Why are one-stop tourism services shops lacking in provinces? And Chairperson, on SAT specifically, we need complete transparency. We seek clarity on SAT's involvement in major events like raised by Honourable Modise, Makufe, the Cape Town Film Festival, and the Durban July. And then furthermore, how much of the 95 billion from international tourists and 1.3 billion from domestic tourism can be directly attributed to the department and SAT rather than broader market movements? The Trusted Tour Operator Scheme with China and India is a promising start, but we urge the department to look into expanding this innovation to other potential markets, BRICS partners, Gulf states, Southeast Asia, and African neighbors. This requires close coordination with Home Affairs, clear vetting standards, and digital integration. Let's turn the TTOS into a game changer for growth, not a pilot confined to 2 countries. Chairperson, the sector then faces external headwinds, load shedding, crime, infrastructure, backlogs, and regulatory red tape, particularly for small and emerging operators, which continue to remain barriers. We urge the department to fast-track solutions to these factors. Chairperson, in conclusion, we support this budget vote because we want the department, South African tourism, and every other entity in the value chain to succeed, but we will hold them to the highest standard. We want to see jobs created in rural communities, bookings increased for smaller guest houses, new markets opened for local entrepreneurs, and real hope restored for young people, seeing tourism as a pathway to opportunity. And then further on, I would like to reaffirm the Select Committee's commitment to robust, fair, and solutions-driven oversight. We stand ready to assist, but we will not hesitate to demand accountability. Chairperson, through you, Minister, let this year be the year we move from potential to realization, ensuring that tourism delivers, not just on paper, but in the lives of all South Africans. Thank you.
Thank you very much, Honorable Boshoff. We now move on to the next contributor to this debate, and that's the Honorable Modise. You have 15 minutes.
Yes, Honorable Deputy Chairperson of the National Council of Provinces, Honorable Minister and the Deputy Minister of Tourism, Honorable Chief Whip of Council, Honorable Members, Special Delegates, fellow South Africans. Deputy Chairperson, on a very somber note, today's debate is dedicated to Mr. Mangaliso Malindi, who lost his entire family in a car accident when a family car collided with a truck on the R42 Meyerton Heidelberg Road in Midvaal Local Municipality, resulting in the death of all occupants. The people who passed away were his parents, 2 sisters, cousin, and a nephew. The deceased were identified as follows: Mr. David Kehla Malindi, 68 years old, who is the father, Mrs. Anna Malindi, 61, who was the mother, Ms. Hlanganani Malindi, 35, who was a sister, Ms. Pindile Malindi, 33, who was a sister, Mr. Xolani Bcebo, 27, cousin, and Mr. Lwandle Malindi Shabalala, 3 years old, and nephew. We say to Mr. Mangaliso Malindi, may the soul of your family members rest in peace. You are in our prayers and our thoughts. Chairperson, July being the month in which we continue to honor the legacy of President Nelson Rolihlahla Mandela, perhaps it is fitting to begin my contribution to this critical budget vote by quoting an abstract from what he said regarding tourism sector in 1995 when he delivered his opening address to the Indaba International Tourism Workshop in Durban. He said, and I quote, open quote, tourism can contribute substantially to developing the people of our country, as it is a highly labor-intensive industry, accommodating a wide spectrum of skilled and semi-skilled labor. It also promotes development and infrastructure in remote areas. He further said that our country's natural beauty offers fitting setting for our most valuable assets, its people. Ours is a nation of warm and generous people. It's a great variety of culture and heritage, once exploited to divide our people, has been turned by them into a source of strength and richness in every sphere of life. Indeed, our cultural diversity is increasingly becoming one of our major tourist attractions, close quote. Honorable members, Tourism is a cornerstone of the realization of our national development goals. It is a powerful tool which we can use to build a stronger economy, eliminate poverty, and reduce inequality, as set out in our National Development Plan. Its ability to absorb varying skills and linkage with multiple sectors makes it a formidable force in the fight against poverty and unemployment. It is against this background that we not only stand here to advocate for a budget that will be able to complement the growth potential of our tourism sector, but we stand here to call for a whole of society approach towards tourism. In as much as we must be able to form strong interdepartmental connections to support the sector, it is also imperative that we create strong public-private partnership based on the common understanding that we all have the responsibility towards growing the tourism sector and uplifting our people in both urban and rural areas. This we do by supporting tourism products in the villages, township, and small dorpies. We do it by creating welcoming spaces for our visitors and ensuring that they get to experience our warmth, friendliness, and diverse cultures as expressed by Madibo. The ANC supports that over the medium term, the department receive a total budget allocation of 7.6 billion. This is a slight increase from the 7.5 billion allocation in the previous financial term. While we believe that the task at hand to radically transform the tourism sector requires more resources and support, we're also conscious of our fiscal constraints. We urge the department to use this budget in the most efficient and effective manner. We also ask the department to ensure that all infrastructure projects in the various provinces are sufficiently supported, completed, and handed over to the relevant communities. As a select committee, we must also reinforce the portfolio committee's recommendation to develop an aftercare support for projects that are handed over to the communities by DBSA. We will be paying close attention to the 70+ projects carried out by the DBSA on behalf of the department, with a laser focus on the 30 community projects that are being implemented across the country. These include, but not limited to, the following: in Limpopo, Batsonga Village, Matsila Lodge, and Pipidi Waterfall. In Free State is Kwakwa Guest House and Afrikaans, Vredefort Dome. Yeah, Vredefort Dome. And in Mpumalanga, it's Nobi Gate. The agency working with the department must implement clear strategies to address the multiple challenges that have confronted some of the department's projects, such as the Ngove Village project, amongst others, who have been affected by the agency's delay in implementation, changes in implementing contractors halfway through the project, budget overruns, and the so-called construction mafias. We urge the agency working with the department to decisively deal with any form of mismanagement and irregularity relating to this project and ensure that communities benefit from the state infrastructure project as intended. Equally, South African Tourism, as the country's marketing agency for auspices of the Department of Tourism, has a critical role to play towards marketing South Africa domestically, regionally, and internationally. To this end, it receives an estimated 4.1 billion of the total budget, and budget allocation are expected to increase at an average rate of 3.8 from 2.4 billion in 2024-2025. It will go to 2.7 billion in 2026-2027. We must also welcome that our tourism sector is showing significant progress following the harsh and devastating condition it found itself following the scourge of the deadly coronavirus. It is promising to see that in the previous year, international tourist arrival grew by 5.1%, reaching 8.9 million, with foreign spend contribution reaching 91.6 billion. We're also excited to see that progress made in relation to domestic tourism, with overnight trips increasing by 6.2% to 40.2 million, and spending rising by 12.8% to 137 billion. Travelers are also staying longer, with bed night increasing by 16.6, which results to 155 million, and average length staying increasing by 9.8%. The ANC urges the NTT priorities. The ANC urges that the NTT prioritize the growth and development of villages, townships, and small dorpies, and grow the local economy for sustainable economic development. Having said that, we must also raise our disappointment and concern for the corruption allegation surrounding the NTT and certain contractors. We call for the enforcement of appropriate consequence management measures for the speedy resolution of all pending cases. Honorable members, in conclusion, as we gear up to host the G20 summit under the theme Solidarity, Equality and Sustainability towards the end of this year, we remain excited at the possibility of a booming tourism sector as a result of influx of hundreds of delegates who will be grazing our shores, spending money in our hotels and restaurants, amongst other things. Through this summit, we also believe that South Africa will be able to draw the attention of the international community to our beautiful natural resources and offerings, diverse culture and beautiful people, thereby promoting our larger leisure tourism and the meetings, incentives, conferences, and exhibition, also known as MICE industry. Chairperson, I would have failed if I do not address the misinformation and misguided views, both articulated by Honorable Pinar and Honorable Gauteng. I don't know if Honorable Pinar and Honorable Gauteng understand that so much is expected from Black and colored people of this country, while so little is given to them. And on the other hand, so little is expected of the white people of this country, and so much is given to them. As I speak here today, you will all agree with me that there is somewhere in one of the factories where a white foreman or supervisor is supervising Black and colored employees who are more qualified than him, simply because he's white. Member Pinar comes here and speaks about us blowing hot air when Black and colored communities are still paying for his privilege 400 years of segregation. He is clearly not in touch with reality that continue to confront the majority of our people every day. As for Member Gauteng, I am happy that he came here and confirmed that the DA does not respect its Black and colored educated members. How can he come here, take this podium, and tell us that you don't need a degree to do your work? How many of both Black and colored graduates are without jobs? How are they supposed to feel when they hear a member of parliament who's supposed to be honorable saying that about education? But he also has shown the privilege of what the privilege does. And some white people in the DA...
Honorable Modise, could you please take your seat? There's a point of order.
Honorable Chair,
on what point are you standing?
Rule 51, relevance.
Yes, go ahead.
I failed to see the relevance of the current line of this honourable member's debate. He's talking about Honourable Gauteng, who wasn't part of this debate. He's referring to him. He never spoke in this debate. So can you just rule on relevance of this debate, please?
Thank you very much. I think, yes, I will rule in this regard that Honourable Modise, you are irrelevant in terms of what this debate is about. So I would ask you to please confine yourself to the tourism debate.
Chair, the debate is about tourism. And these are the people that we are trying to attract to the country. The people that I'm talking about are the people that we are trying to attract to the country in terms of tourism.
Yeah, but I've ruled that you should stick to the tourism aspect of,
yes,
of it.
This is tourism, Chair.
Okay, please continue. Continue.
Chair, my debate is about tourism.
Okay.
So if you are saying I must not speak about what I've written here, then there's no point for me to be here.
No, I'm saying you should stick to the tourism budget.
This is what I'm doing, Chair.
But you're going into the issues of education, and now you are arguing with the chair.
That's fine, Chair. Let someone else come in.
Thank you. We shall now move on to the next contributor, and that is Honorable Pinar. You have 8 minutes. Honorable Pinar, continue, please.
Honorable Chairperson, Agbare Minister, Honorable Deputy Minister, my fellow members of Parliament and the NCOP, and most importantly, as always, my fellow South Africans sitting at home. Honorable Chairperson, it's quite sad, of Honorable Modise to come up here and debate with myself and Honorable Gauteng, who hasn't even spoken yet. I would suggest he must wait until he heard our speeches before he raises comments. Chairperson, the Department of Tourism has been in the media of late, and not always for a good reason. The Minister herself is struggling with a tug of war with setva as outlined by our Chairperson. And as we say in Afrikaans, Minister, Wanneer daar rookie is daar gewoonlik 'n vuurtjie. And with a budget of more than 2.4 billion funded mostly by taxpayers, there are numerous areas for concern. Fortunately, the Democratic Alliance stand ready to hold this department and its APP to account and to measure it against where South Africa needs to go in order to foster success. Chairperson, the department proudly declares in its strategic plan that South Africa currently welcomes around 9 million international tourists per year. The goal is to increase this figure to 15 million tourists by 2030. It's an ambitious and commendable target, and no one in this House would oppose such an aspiration. Tourism contributes nearly 9% to our GDP, and although we have not yet fully recovered from the 2019 levels, there are encouraging signs of recovery. Every tourist who visits South Africa represents opportunity, colleagues, an opportunity for someone to become an entrepreneur, to escape poverty, to showcase the best of our country, and to drive foreign investment through cultural and economic engagement. However, Chairperson, ambition must be matched with accountability. And here lies the problem. The department has no way of measuring whether the tourists arriving are in any way influenced by the work of the department. I'm not looking for best guesses, Chairperson, or vague assumptions or conclusions. What direct proof does the department have linking their work to increase in international tourists? What we need is a third-party study by Parliament to find that direct link and the value the department adds. There's no measurable return on investment, as also stated by my chairperson. No data showing how the department's spending translates into arrivals, bookings, or revenue. The truth is, Chairperson, they are walking blindfolded, hoping what they do somehow deliver results. If anyone from the department claims today that the current 9 million tourists are thanks to their work, they would be misleading the House and the people of South Africa. Honourable Chair, I look to the work of Home Affairs Minister Leon Schreiber for inspiration. Under his leadership, a new scheme to make inbound tourists travel easy and digital. 176,000 new tourists from India and China would not only boost the tourism sector, but also support 1.46 million jobs. Meanwhile, taxpayers are sinking billions into the tourism department, more focused on scheduling internal meetings and stakeholder engagement. Not because it delivers results, but because it helps tick off APP targets that justify performance bonuses come year end. Just last year, and listen closely, Chairperson, just last year, from March until September, the South African Tourism Board held an astonishing 54 meetings at a cost of 900,000 Rand for taxpayers. Chairperson, we cannot allow this reckless feeding at the trough to continue. Over 90 million per year is spent on staff salaries. Yet they still lack the internal capacity to execute core functions, because why else would the department add an additional 10 million carved out for business consultants? Because apparently the employees can't do what they pay to do, and what do South Africans get in return? No measurable growth, no clarity on impact, and no value for money. Honourable Chairperson, through you, Agbare Minister, I know you have the best interests of South Africans at heart, and like the Democratic Alliance, you want us to succeed as a nation. But if we want to succeed, we are going to have to be brave. The points raised here in the NCOP and our colleagues in the National Assembly are valid and reasonable. Together as a GNU government, we can bring equal opportunities for all. Do not just lambaste our concerns today, Minister, but internalize them. Help us to help you bring the Department of Tourism to its full potential. In conclusion, Chairperson, if this department wants to survive, it must prove its worth, not just through goals, but through measurable, impactful outcomes that benefit our people. I thank you. Siyabonga. Baie dankie, Minister.
Thank you, Honorable Pinar. The next contributor to this debate is the Honorable Mokoena. Honorable Mokoena, you have 9 minutes.
Chairperson, honorable delegates, Chairperson of our Select Committee, let me not waste any time. The MK firmly rejects vote 38 outright, because what we are being asked to support today is not a tourism budget, it's a bailout for the privileged. And we will not legitimize it. For 3 decades, it's just marketed South Africa to the world while economically excluding its majority, which is our Black people. Let us speak plainly. This is a budget for Stellenbosch, not Soweto. It's for safari resorts. It's not for village homestays. It finds wine tours, not tourism, not township tours. It's dressed in a language of inclusive growth, but it is soaked in the practice of selective upliftment. Chairperson, this department was given 7.6 billion to make tourism work for all South Africans. So why is over 4.1 billion, more than half, being handed straight to South African tourism, whose obsession is foreign markets? Meanwhile, domestic tourism, which could revitalize rural and township economies, gets ignored like a poor cousin. If you're a small guest house owner in Kwakwa, in Engobo, in Vryheid, this budget is not meant for you. It is meant for those beachfront addresses and friends in higher places. It's not transformation, it's entrenchment. The department has the nerve to call one of its flagship programs working for tourism. But who exactly is it working for? In one breath, they claim tourism is the engine for inclusive growth. In the next, they cut job creation targets by a devastating 92%, from nearly 18,000 to just 1,400. And yes, the budget for this program was slashed by 13.81%. So let's call it what it is, economic sabotage for the poor. We're not seeing inefficiency, we're seeing intentional de-investment in the very people this sector claims to empower. Let's turn to the Tourism Transformation Fund, another fine slogan that does nothing for the real people. They promise 1.2 billion to support Black-owned enterprises. But go ask an entrepreneur in Mlazi, Mahikeng, in Mamelodi, how much of that they've seen. Nothing. This fund is locked behind red tape, elite networks, and unspoken exclusions. In short, transformation is not slow, it's being deliberately stalled. And while Black businesses jump through flaming hoops, the old boys club gets fast-track deals and guaranteed exposure. Chairperson, community-based tourism is thriving across the world. The global market is currently worth over $575 billion and projected to hit 2.1 trillion by 2032. But here, this government can't even coordinate its own domestic tourism campaigns. Your own strategic plan, Minister, admits that domestic tourism is disjointed and not coordinated at a strategic level. And it shows. Our people have rich culture, they have unique stories, breathtaking landscape, but they've been excluded from the national narrative. Instead, we continue to promote five-star escapes while our own people live 5 to a room. And let's not beat around the bush. Tourism today reflects the exact same race and class structure as it did during apartheid. So where is transformation? Black South Africans clean the rooms, they serve the food, they guide the hikes, but they don't own properties, set the prices, or even sign any deals. 30 years into democracy. That's not failure, it's complete betrayal. And what has government done? Create grading systems that are optional for the powerful and impossible for the emerging. Provide finding pipelines that are clocked on arrival, deliver strategy documents full of buzzword and zero urgency. And to those that belong to the so-called government of no urgency, let me say this gently but truthfully. What exactly are you uniting around? Because when I look at this budget, I don't see unity. I see surrender. I see governing elites that have chosen comfort over courage, compromise over conscience. You know this budget will not uplift rural people. You know that it won't unlock economic empowerment. You know that it protects economic apartheid under a democratic flag. So ask yourself, honorable members, why are you defending that? We are not here to make peace with poverty. We were not sent to parliament to decorate failure. The MK party was sent here by those who have been locked out, passed over, and forgotten. We are here not to speak politely, but to speak the truth. And the truth is that Vote 38 is a political insult, a moral embarrassment, and an economic injustice 30 years into democracy. We will not support a cent of it. Chairperson, tourism should be a force for dignity, inclusion, and shared wealth. But this budget is built for exclusion. It entrenches a two-tier economy, one for those who own the experience and one for those who serve it. We reject this vote because not because we are anti-tourism, but because we believe tourism should belong to its people, not just the brochures. And let us be clear, the MK party will never vote to keep Black people as spectators in a game that they built. We reject Vote 38. We reject the illusion of transformation. We reject your fantasy of economy. Kwaza mkhonto kwaza.
Thank you, Honorable Mokoena. We now move on to the SALGA representatives, that is Councillor Huma. Councillor Huma, you have 10 minutes.
Honorable Chairperson of the NCOP, Honorable Minister and Deputy Minister of Tourism, Honorable Deputy Chairperson of the NCOP, Honorable MECs, Honorable Chief Whip of the NCOP, Honorable House Chairpersons, Honorable Members, ladies and gentlemen, I greet you all. In his 2025 State of the Nation address, His Excellency President Cyril Ramaphosa once again underscored the importance of the service sector in general and tourism in particular as a contributor in South African economy. He stated, open quotes, "The services sector is now the largest part of our economy, ranging from financial services sector to retail, hospitality, tourism, and the burgeoning creative industry. The tourism sector is growing rapidly with close to 9 million tourists having visited our country last year," at close quote. This reaffirmation builds on the consistent message he has delivered in previous years. The address also mentioned targeted tourism promotion in key markets and support for local companies to encourage the growth of the sector. SALGA wishes to commend the Honorable Minister, the Department of Tourism team, and other stakeholders who have worked tirelessly to help revive the industry after the effect of COVID-19. We are all keenly aware of the devastation that the pandemic brought to our tourism sector. SALGA recognizes this hardship and wholeheartedly supports the national and provincial recovery plans, such as the Tourism Sector Recovery Plan and the Economic Reconstruction and Recovery Plan. Municipalities are at the heart of this revival, championing the resurgence of the domestic tourism as a crucial first step toward restoring our industry. Honorable Chairperson, SALGA champions a vision where tourism flourishes not only in major cities, but in every corner of our country. As the sector continues to grow, we must always be mindful of the need to decentralize tourism. We must unlock the hidden potential of our small towns and rural landscapes. Through initiatives such like the Small Town Regeneration Program, tourism becomes a catalyst for entrepreneurial opportunities and improved quality of life. Our towns must therefore be seen as interconnected economic hubs, each contributing to a vibrant regional tapestry instead of viewing them as isolated nodes. We do need to continue empowering local authorities since they understand their communities best. So they must lead in tailoring tourism strategies that reflect unique local strengths. We commend the department's initiative to establish a national database encompassing all tourism facilities, including those owned by SMMEs and municipalities. This database will hopefully enable the department to include these facilities in its promotional material and marketing activities. We fully endorse the commitment by the Honorable Minister that they will ensure the implementation of the Community Tourism Aftercare Program, providing post-handover support to community lodges, including business mentorship, marketing linkages, governance training, and asset protection. Infrastructure is the backbone of any thriving tourist destination. SALGA consistently encourages municipalities to provide and maintain essential services such as roads, water, sanitation, electricity, signage, and public transport that make our destinations accessible and enjoyable. The quality and reliability of these services can make or break the tourist experience. We call for increased funding, dedicated budget, and capacity building to empower municipalities to meet these infrastructural demands. Tourism must take its rightful place in the IDPs and local economic strategies, ensuring our efforts are not only ambitious but sustainable. Environmental protection is vital for tourism, as this industry depends on natural beauty, pristine landscapes, and diverse ecosystems. Without a healthy and protected environment, tourism destinations lose their long-term appeal and viability. Effective collaboration between the Department of Tourism, Department of Forestry, Fishery and Environment, and local municipalities is essential for sustainable industry growth. We must prioritize responsible tourism through economic, social, and environment stewardship. By supporting local businesses and reducing economic leakage, we ensure tourism benefits communities, especially those previously disadvantaged. Balanced growth meets the needs of visitors, residents, businesses, and the environment. Local governments play a vital role through effective regulations, empowering local enterprises, and encouraging sustainable practices. The development of tourism in South Africa depends on actions such as supporting municipalities, investing in infrastructure, expanding opportunities, and promoting responsible tourism. These steps can contribute to sustainable growth and broader economic benefits. The Honorable Minister stated in her speech that the department plan align resources to remove barriers, strengthen partnerships, and embedded innovation and technology so that tourism can realize the full potential of our people and places. As SALGA, we are fully committed to meaningful partnership in tourism, viewing local government as a key enabler and driver of tourism development. Let us walk this path together for our communities, for our country, and for the world that comes to discover our beautiful land. We commend the Honorable Minister and the Department for their leadership and steadfast commitment to leading the sector. I thank you.
Thank you for your contributions, Councillor. Good evening, honourable members. The next person participating in today's debate will be the Eastern Cape MEC for Economic Development and Labour, and that is the Honourable N. Peters. Honourable Peters, you have 10 minutes.
Honourable members of the NCOP, the Honourable Minister, the Deputy Minister for the Department of Tourism, DG and senior officials of the department, representatives of the entity, and also ladies and gentlemen and those who are listening and watching at home, good evening, goeienaand, molweni kumntu wonke. The words of former President Thabo Mbeki that said, I quote, I am an African, remind us that our story is vast and beautiful, our roots deep and sacred. South Africa is not just a destination, it is the spirit of Africa made visible. It is here that you will feel the warmth of Ubuntu, trace the footsteps of giants, and hear the heartbeat of a resilient and joyful people. This is our promise to every visitor, to come not as a stranger, but to return home to Africa. Chairperson, thank you to Minister Delil for a clear and ambitious Vote 38 that reaffirms tourism's pivotal role in driving jobs and inclusive growth. Her commitment to strengthening governance, expanding community-owned enterprises, and harnessing digital innovation provides a solid foundation for provincial entities such as our implementing agent, which is ECPTA, to translate national priorities into local impact. Over the last 5 years, the Eastern Cape's tourism performance has been nothing short of transformational. Domestic visitor numbers climbed from 2 million in 2019 to 6 million in 2023, with over 4 million recorded in just the first quarter of 2024. We appreciate the Minister's presence in the Velde Fierce Kerkut Festival with a tagline, Bidengas, in June 2025, and we look forward to the commitment of growing these signature events in our province to help grow the domestic niche market. On international arrivals, while still Eastern Cape is still recovering from pre-COVID-19 highs of 662,000, reached over 200,000 in 2023, securing the province's position as the third most visited in South Africa, with a 14.9% market share. These gains reflect sharper, smarter marketing, deeper stakeholder collaboration, and sustained investment in our parks, heritage routes, and events. Building on that momentum, ECPTA, that is our entity, has already channeled 18.4 million into modernizing visitor facilities at our 5 flagship coastal reserves, forged co-management agreements in 3 marine protected areas, and rehabilitated 15,000 hectares under the N2 biodiversity offset program. Each project both safeguarding our natural heritage and extending length of stay potential. With the minister's budget and our own 2.7 million marketing allocation, ECPTA will roll out 8 smart pillars of integrated digital campaigns, trade show promotion, joint operator packages, and safety partnership with SAPS. Launch 2 new pillars to position the Eastern Cape as a filming destination and to foreground our rich cultural heritage alongside revived Lilizela and Homestay Awards to diversify the product mix. None of this succeeds without teamwork. Municipalities, local operators, community forums, and law enforcement partners are all locked into real-time feedback loops to ensure that, step by step, we continue to bounce back post-COVID, drive our average stay toward 20 days, and keep tourism-linked employment growing across every corner of our province. We'll review outdated strategies, include heritage and cultural tourism, domestic growth, rural tourism, service excellence, and climate change. The review of all the legislation, policies, including the outdated strategies, is necessary to keep up with emerging priority interventions. As a catalytic development, a 2.9 billion Lake Kharib interprovincial project is anchored on the fossils route, eco-estates, aquatic sports, and wetland restoration to broaden our appeal and unlock further investment. This iconic project is amongst the 3 projects that the Eastern Cape has submitted to the minister. These efforts will assist to enhance the tourism sector as one of the game changers. We note with keen interest the inclusion of the climate change strategy, since the Eastern Cape is one of the coastal provinces generously endowed with various key natural attractions along the coastal zones. In the spirit of inclusivity, we need to work together to ensure that stakeholder consultation is done thoroughly and appropriately, and we are keen to assist with the limited resources at our disposal. We'll ensure the implementation of our community tourism aftercare program, providing post-handover support to community lodges, including business mentorship, marketing linkages, governance training, and asset protection. as many of the completed projects that have been funded by the Department of Tourism are in dire need of this support. There are complex challenges with respect to operationalization, and that threatens their sustainability. House Chairperson, we are focusing on the future through our digital transformation and risk management initiatives, which include developing a digital maturity roadmap, a real-time tourism dashboard, data analytics, and mobile tools. This will be useful for the Eastern Cape, especially with road signage. For example, there are various geographical name changes that have been effected that are a deliberate effort by the government of the post-democratic dispensation to transform the heritage landscape, and the road signs are inconsistent with which confuses some of the self-driven tourists. We'll implement the sector risk and mitigation plan with a focus on climate change, health, safety, and governance. The example of inconsistent road signage speaks to the risk related to safety. Thus, the proposed implementation of sector risk and mitigation plan is an important consideration that requires the support of all stakeholders. Eastern Cape appreciates the deployment of tourism monitors in the Eastern Cape attractions during the peak tourism season. This is an important initiative that enhances the safety campaigns. In April this year, Deputy Minister of Tourism, Umameki Sotyu, supported by the Deputy Ministers of Transport and that of Public Service and Administration, led an integrated tourism safety campaign in Motherwell to promote safety ahead of the Easter holiday. This was an important intervention in addressing the crime in the area that affects mainly our tour operators that use the road R335 to Ado via Motherwell. Ado Elephant National Park and its surrounds is a major tourist destination that attracts many international tourists. Regarding tourism product development, visitors to the Eastern Cape attest to it being a construction site where we are actively ensuring quality infrastructure and immersive route design. Where job creation is concerned, we're ensuring youth employment acceleration and skills development pathways. The 5-pillar tourism growth partnership plan sets targets for government, the sector, and the whole of society to achieve by 2030. The flagship South Africa Awaits, Come Find Your Joy brand campaign resonate in 7 key markets: Asia, Europe, and
MEC, your signal is failing you, and I think we've just lost you. Can I suggest that you turn off your video and try and continue?
America and Africa, 1.2 million digital engagement. This is yours to explore campaign. Now, can you hear me now, Honorable Chairperson?
We can hear you. Please continue.
Yes. We use data-driven decision-making and foster better partnerships to plan and execute effective marketing campaigns. Together, we'll create a resilient and inclusive tourism sector that powers South Africa's future. In conclusion, I wish to once more invoke the words of President Mbeki in saying that ours is to position Eastern Cape as more than a destination. It is a story, a feeling, a soul. When you visit Eastern Cape, you walk the very soil where humanity began, where a nation healed itself, and where the voice of I am an African still echoes across mountains, coast, and cultures. Thank you, Honorable Chairperson. As Eastern Cape, we support Vote 38. Thank you.
Thank you, MEC Peters. Honourable members, we now move slightly northwards up the coast and we go to KwaZulu-Natal, where the MEC for Economic Development, Tourism and Environmental Affairs is the next to participate in the debate. That is Honourable Zondi, and Honourable Zondi has 10 minutes.
Chairperson.
Honourable Zondi, hold on for me 1 minute. Yes, Honourable Farmer.
Chairperson, I rise on Rule 69. I raised the point of earlier last week with you. You said you're going to check it, and I'm still waiting on your return.
Yes, Honourable Member, I am waiting for the ruling to be finalised. I will come back to you on that as soon as I have a finalised ruling on that. The table staff is just busy going through the finer details. We will get back to you on that in due course. Thank you. Honourable Zondi.
Honourable House Chairperson, honourable members, I wish to begin by commending Honourable Minister Dilil for the delivery of a clear, purposeful and ambitious budget vote for the Department of Tourism. The 2025-26 budget reflects an unwavering commitment to positioning tourism not only as a catalyst for economic recovery, but as a platform for inclusive growth, transformation, and job creation across our country. The national allocation of 2.4 billion rand to tourism for the year ahead is both timely and strategic. It supports high-impact programs such as the Green Tourism Incentive, the Expanded Tourism Monitors Program, and catalytic infrastructure investments, all aimed at repositioning tourism as a job-creating, transformation-enabling sector. I particularly note the investment of over 1.3 billion in marketing through SA Tourism and 331 million towards destination development, which aligns with our priorities in KZN of tourism-led development as a pillar of economic revitalization. As KwaZulu-Natal, we fully endorse this national approach. In 2024, our province welcomed over 2.6 million domestic overnight trips and contributed an estimated 19.5 billion to South Africa's domestic tourism economy. From an international perspective, Durban's King Shaka International Airport recorded a 27% year-on-year increase in arrivals, thus demonstrating the continued recovery of global travel and our positioning as a gateway destination. Furthermore, KwaZulu-Natal accounts for nearly 13% of South Africa's overall tourism spend, underpinned by our diverse tourism assets, from the Ismangaliso Wetland Park and the majestic Drakensberg to our rich cultural heritage, Betlefeeds, coastal resorts, and growing events and conferencing economy. I therefore welcome the national drive to unlock infrastructure upgrades in community-based tourism, and we are working to ensure that KZN project pipeline aligns with this opportunity. Across the province, our teams are engaging municipalities, tourism associations, and development finance institutions to accelerate catalytic tourism infrastructure investments, especially in underutilized rural and heritage nodes. This includes scaling up investments in township and rural tourism infrastructure, unlocking access to markets for emerging tourism enterprises, including tour operators, and positioning tourism as a core driver of inclusive economic growth in KZN. It is for this reason that my department is also engaging proactively with the Department of Tourism to align our project pipeline to the Working for Tourism initiative and to secure technical and financial support for infrastructure upgrades across the province. Chairperson, I've noted with keen interest the National Department's commitment to ensure the implementation of the Community Tourism Aftercare Support Program. And I would like to urge the Honourable Minister and her department to consider extending this great initiative to support projects funded by provinces such as the ones that I've alluded to. One of the primary responsibilities of government is to ensure a conducive policy environment for tourism to flourish. It is within this context that I also welcome the Minister's pronouncement to introduce the Tourism Amendment Bill to align it with the White Paper, as the province of KZN will be embarking on a process of reviewing our legislation in order to achieve the same goals. We have also commenced a process of reviewing KwaZulu-Natal's tourism master plan to ensure that our strategies are updated and relevant to the cause. Correspondingly, my department is preparing to host a flagship KwaZulu-Natal Tourism Conference during the course of the financial year, wherein tourism alongside agro-processing, oceans economy, and the creative economy will feature prominently as a sector ripe for growth and private sector collaboration. I am further particularly impressed by the allocation of 662 million for destination development and tourism incentives programs. The Tourism Incentive Program offers practical and tangible solutions to support tourism business growth and advance tourism transformation imperatives. In this regard, the province of KZN is ready to work with your department, Honorable Minister, to facilitate access to information about the different incentive programs, such as the Green Tourism Incentive Program, Market Access Program, Tourism Creating Program, and the Tourism Transformation Fund, offered by the National Department of Tourism to ensure our stakeholders derive direct benefits. Honorable Minister, you and I have been given the critical task of growing tourism's contribution to the economy, and this responsibility requires greater collaboration between the national and provincial governments in order to harness tourism opportunities that lie at the local community level. To exploit these opportunities and to drive rural development through tourism, the KZN Department of Economic Development, Tourism and Environmental Affairs, which I lead, implements community-based tourism projects. In the current financial year, the department is supporting the development of Kwakolo Caves projects, Balele Game Park, the regeneration of Howick Falls Tourism Precinct, Somkanda Game Reserve, among others. Specific interventions include the upgrade and refurbishment of tourism infrastructure, the development of adventure tourism activities, and the provision of critical amenities geared towards improving the visitor experience. However, we must confront the reality that KwaZulu-Natal continues to face significant hurdles in advancing tourism development to its full potential. The first challenge pertains to infrastructure backlogs, particularly road access, signage, and digital connectivity, which continue to constrain tourism growth in many high potential but historically neglected areas, particularly in rural districts like Zululand, Utugela, and Erikwala, to name but a few. This limits access to community lodges, ecotourism projects, and heritage sites that could otherwise uplift local economies without urgent and coordinated action. To address these bottlenecks, the goal of inclusive tourism will remain elusive and is a major concern for tourism destination appeal. Secondly, concerns around safety and security, especially in some urban and peri-urban spaces, have impacted visitor confidence. Although we support the expansion of the Tourism Monitor Program, the province is working closely with our safety and security partners to strengthen visible policing and community tourism safety structures, but we must do more together to restore trust and confidence among domestic and international travelers. A safe destination is a competitive destination. Thirdly, we are faced with the persistent issue of fragmented institutional planning. Tourism cannot be the responsibility of one department alone. It must be an integrated effort that brings together infrastructure, transport, economic planning, home affairs, and community development under one cohesive agenda. I therefore echo Minister Delil's call for better consequent management, oversight, and integrated planning, as well as within performing municipalities. As a province, we are therefore calling for stronger intergovernmental coordination and accountability to accelerate implementation of the programs announced at the national level. We are ready to do our part and we stand ready to work with national government, private sector partners, and our communities to turn policy into impact. By addressing these challenges that exist head-on while capitalizing on the momentum provided by the national priorities, KwaZulu-Natal aims to position itself as a competitive, inclusive, and resilient tourism destination both within South Africa and on the global stage. Last but not the least, we await the Africa Travel Indaba post results with bated breath, as its retention will strengthen and enhance the growth efforts of our meetings, incentives, conferences, and exhibitions, which is otherwise called the MICE industry. I thank you, House Chairperson, for listening to me.
Thank you, MEC Zondi, and well done on your timekeeping. Honourable members, the House now recognises the Honourable Van den Berg, and we invite him to take his place at the podium and present his arguments on the tourism appropriation. Honourable Van den Berg.
Honourable Chairman, Minister, members of the House and fellow South Africans, I rise today to address the budget vote for the Department of Tourism, a sector critical to South Africa's economic growth and job creation. Tourism has the potential to showcase our nation's beauty, diversity and resilience, but it must be managed with precision and accountability. Allow me to highlight three commendable aspects of the department's plans and three areas where it falls short. Firstly, the department focuses on destination development, and that can be commended. 331 million is allocated to the Working for Tourism program, and this investment in infrastructure is a step towards unlocking economic potential of our diverse landscapes like the Godumudumu Dinosaur Centre in the center of the Free State, by maintaining and enhancing department-owned sites and supporting community-owned accommodation. The department can create jobs and stimulate local economies, and this should even be increased in the budget. Secondly, the emphasis on job creation through initiatives like the Tourism Growth Partnership Plan is plausible, but the department must ensure inclusive growth, and that means all race groups should have an equal opportunity and be welcomed to participate. Thirdly, we welcome the hosting of the tourism investment conferences. These initiatives aimed at attracting anchor investors and showcasing prioritized projects signals a proactive approach. However, there are also three areas of concern about the department's performance and priorities. First, the persistent underperformance of South African tourism, which receives 1.3 billion of the tourism budget. SAT did not achieve all of its 55 targets in the previous term and overspent by 24.1 million, while not reporting on success of these targets. Second, the Department of Tourism's handling of funds and grants, such as the Tourism Equity Fund, remains expensive and very unclear. 23 beneficiaries received 466 million in TEF funds, allocated by the Small Enterprise Finance Agency. However, this 466 million has only been able to create 493 new jobs. This means, in effect, that we now pay 1 million rand for every job created in tourism. Also, an average of 20 million per recipient. It hardly sounds like small enterprise. To me, it sounds like winning the lotto. Chairman, the Freedom Front Pass calls for clear timelines and measurable outcomes to ensure these funds deliver real empowerment and an end to funding of cadre elites. Thirdly, the department's approach to safety and security for tourists is inadequate. South Africa's high crime rates remain a deterrent to international visitors, and the budget lacks sufficient details on comprehensive safety measures, such as expanding tourism police units or enhancing safety management systems. Without addressing this critical issue, our ambition to grow international arrival levels will remain elusive. In conclusion, we acknowledge the Department of Tourism's efforts to drive economic growth and job creation. However, we cannot ignore the glaring issues of underperformance, clouds of mistrust, and insufficient focus on tourist safety.
South Africa's beauty and hospitality is world-class, but must be matched by world-class governance. The Freedom Front Plus commits to holding the department accountable, while supporting initiatives that deliver growth, jobs, and pride for all South Africans. Let us work together to make tourism a true engine of prosperity. I thank you.
Thank you very much, Honourable van der Berg. Honourable members, we now go back to the provinces. This time it's Limpopo, and the MEC for Economic Development, Environment and Tourism is Honourable Matibe. Honourable Matibe, you have 10 minutes.
Thank you very much, House Chairperson, the Chief Whip of the NCOP, Honourable Moimang, the Minister and the Deputy Minister of Tourism, fellow MECs, the Chairperson of the Select Committee, SALGA representatives, guests in the gallery, ladies and gentlemen, Dimadekwan. Tourism as one of the key vehicles in South Africa's quest for economic growth, job creation, and community upliftment holds a potential that is as boundless as the baobab forest of the Soutpansberg Valley in Limpopo, as diverse as the melting pot of cultures in our province, and as iconic as the Kruger National Park. As a province, we welcome the National Department of Tourism's continued support and its clear commitment to sustainable and inclusive economic growth, addressing poverty and inequality through tourism, and strengthening the role of community-based tourism, especially in rural provinces like ours. Limpopo's natural beauty, rich cultural heritage, and committed tourism sector continue to position us as a key player in country's tourism landscape. We commend Minister Patricia de Lille and Deputy Minister Maggie Sotu for presenting a budget which speaks directly to provincial needs. We particularly welcome the 331 million allocated to destination development, with significant portion directed to Working for Tourism program. We appreciate the continued support for the Tourism Grading Support Program, the Tourism Transformation Fund, the support for SMMEs, as well as the focus post-handover support for community tourism lodges. This support aligns directly with our challenges in Limpopo, where infrastructure often lies underutilized due to limited business mentorship and governance capacity. We are encouraged by the focus on ease of access through improved transport and air connectivity, tourism safety and security campaigns, including deployment of tourism monitors and infrastructure investments that promote community-focused tourism products. In Limpopo, our tourism recovery plan remains anchored on protecting market share and infrastructure, refocusing our development and marketing action, and building and sustaining destination development and domestic marketing momentum. The recent effort includes the deployment of 180 tourism safety monitors, which not only create a safer visitor environment, but also contribute to youth development. We are also placing enhanced focus on homestay initiatives and tourism guide training, while promoting geographic spread through culture-nature linkages, especially in rural and heritage-rich communities. We appreciate the Department of Tourism's investment in community tourism lodges and branded routes in small towns and villages. These efforts are directly relevant to our goal of using tourism to stimulate localized economic activity in areas like Vembe, Waterberg, and Mupani. Honorable members, one of the key strategies in implementing tourism sector master plan will be a deliberate focus on hosting events in villages, townships, and small towns. Limpopo is a home to many small towns that have the potential to capitalize on tourism as an economic driver. This is why Limpopo has chosen to support events and activities that are part of its tourism development plans. The marketing and hosting of such events signifies boost rural and township economies in our province. With the expanded scope of Limpopo Tourism Agency to include investment promotion, the marketing of the province as an investment destination will now be a key feature of LTA's future marketing plans. Government and tourism bodies are recognizing the strategic importance of tourism master plan in diversifying tourism offerings and promoting sustainable tourism practice. This critical approach to ensuring full recovery of tourism sector. We note and welcome the department's intent to introduce a digital maturity roadmap, real-time dashboard, and analytics. These tools will enhance decision-making in Limpopo as we continue our work towards digital transformation of tourism database, business registries, as well as visitors profiling systems. Honorable members, events are a critical part of Limpopo's tourism strategy. They bring visitors, drive local spending, promote our destination's unique identity. Through festival sports, we showcase our province culture while boosting businesses for local enterprise. Our flagship projects, the Limpopo Marula Festival, is a powerful example. It celebrates both heritage and economic opportunity. In 2025, 12,000 liters of Marula beverages were brewed by 15 registered cooperatives, and the open-air concert sold out more than 7,000 tickets. Limpopo is also a proud host of National Tourism Career Expo to 3 consecutive years. The first installment in October 2024 attracted 7,200 participants, showing our growing role in skills development and youth empowerment. The NTCE hosted in partnership with the Department of Tourism, Keseta, Polokwane Municipality, and Lidet, reflects our commitment to collaborate future-focused tourism growth. We are inspired by the national leadership's focus on transformation and resilience and innovation. In Limpopo, we stand ready to accelerate tourism's role in our economy, empower our communities, create sustainable jobs, and unlock the long-term economic activity. Together with national and local partners, we will ensure that tourism is not only about places, but about people, progress, and prosperity. We say there is more to enjoy in Limpopo. We support the budget. Thank you very much.
Thank you very much, Honourable Matibe. Honourable members, the next debater is from Gauteng. MEC Maile is the MEC for Finance and Economic Development, and he has 10 minutes.
Thank you very much, Honourable Chair, Honourable Minister, Deputy Minister, MECs, Honourable members of the House. I bring you warm and fraternal greetings on the occasion of this important debate. We support the budget and congratulate the Minister for presenting a solid proposal before the House. Honourable Chairperson, the visitor economy structure, form and character in the Golden Province of Gauteng is complex, dynamic, and very much integrated in other supporting and cross-cutting sub or anchor sectors. This makes it difficult to reflect on it in isolation from the role played by the creators sports, entertainment, and cultural industry sectors, for example. Guided by that realization, let me remind this August House that travel, tourism, and hospitality sector is part of the broader feel-good and embedded happiness sectors of our society, which we need to embrace, support, participate in it, and deliberately build. Let us, all of us, here unequivocally not tired to remind the world and South Africans that Gauteng is home of the Cradle of Human World Heritage Site, home to the busiest airport in Africa, home of the biggest statue of Nelson Mandela in the world, located at our Union Building, home of champions and home to the conquering lock drum sounds of Amapiano worldwide. Similarly, honorable members, it is befitting that on this occasion, as we debate this budget, vote, and conclude the iconic Mandela Month, we pay special recognition of the recent declaration by UNESCO of a series of Mandela Legacy World Heritage Sites, with the bulk of these sites located in our Golden Province. These are the Union Buildings in Tshwane, Lily's Leaf Farm, Constitution Hill, streets of Orlando, West inclusive of Vilakazi, Hector Peterson, Regina Mundi, Walter Sisulu Memorial Square in Kliptown, all in Johannesburg, and the Sharpeville Memorial Burial Site and old police station in Sidibeng region. With this global recognition by UNESCO, our province is now home to a second set of World Heritage Sites, and this means collectively we need to take care of these sites, promote them, maintain them, and share them with the people of the world. These sites must not just become our heritage and cultural sites. They must be spaces and places of innovation, cultural preservation, venue to global and national events, hosting and entertainment contents for our learners and students across our various basic, high and higher education institutions. The budget we tabled last week, honorable members, forms part of our noble efforts to oil our tourism development and destination promotion work. We have still not recovered fully from our pre-pandemic figures, but the dial is shooting up and in the right direction. By end of March 2025, a total of 8.9 million international tourists visited South Africa, and 3.8 million of these visited and immersed themselves in the golden province of Gauteng, spending a cumulative total of 41 billion rands. A significant portion of this total is coming from the African continent, once more reaffirming the importance of intra and inter Africa travel, trade, and solidarity. Honorable members, Gauteng continues to be a net exporter of domestic travel in South Africa. We reaffirm the importance and centrality of domestic tourism in the building of a solid visitor economy in the country that benefits hosting communities, engenders transformation, and mainstream women and young people in all facets. Supporting the tourism recovery plan and whole of government approach towards tourism development and growth. Gauteng province implemented heightened measures and aggressive domestic tourism campaigns, which resulted in over 6.4 million domestic trips undertaken in the province and generating 21 billion in direct domestic spend. Underpinning this work, honorable members and chairperson, is our deliberate drive to have a tourism sector that is transformational, inclusive, and labor absorbing. To that effect, we have also, by end of March 2025, generated a total of 19 million direct revenue benefit for our SMMEs out of the hosted signature events in the province, exceeding the set target of 15 million. On the overall signature events hosting economic impact, covering both leisure and MICE events, we generated into the provincial events economy a total of 1.8 billion, far exceeding our set target of 600 million exponentially. We are grateful, honorable members, for the opportunity to play our part in contributing towards the GGT 2030 Aligned Tourism Recovery Plan, an offshoot of the country's economic reconstruction and recovery plan. Guiding this work is the tourism white paper mantra, which proclaimed that tourism is private sector-led, government-supported, community-based, and labor-intensive. Without a doubt, honorable members, this mantra and approach is amplified by the need to implement the concurrent constitutional functions of tourism, development, and growth in a whole-of-government approach as the province. Local government, national government, private sector, and community-based structures. Guided by that intergovernmental approach, we are utilizing our collective resources within Department of Economic Development Group to conceptualize, resource, and operationalize our high-impact visitor economy catalytic projects. These include the reimagined and redesigned Garankuwa School of Tourism and Hospitality, the Val Marina Holiday Resort as part of the Val SEZ, and the new sports, wellness and music tourism routes, which sets to leverage the growing sports, entertainment, and creative sectors, global prowess, and soft and social currency. We have sporting and cultural legends and icons. We plan to partner with in co-creating, developing, upselling, and promoting these tourism routes while leveraging the existing quality infrastructure like cycling in the cradle of humankind, township Kasi community games, international sports team and tastemakers, incoming and outbound test, African and world competitions, and the influence of electronic sports, gaming, gambling, and technology build. The Constitution Hill product experience and attraction in Gauteng, honorable members, is a living example of a historic site and prison of pain now turned into a space of opportunity and inspiration for many young creatives and tourist guides in the country. Our department is investing over 300 million in the building of a world-class visitor center at the Cornhill, over and above the more than 100 creative startups involved in the departmental creative sector incubation program at the same museum. We congratulate the Gauteng Tourism Authority Board, staff, and all the destination marketing development partners in achieving some of the important milestones towards the sector recovery and ultimately our GGT 2030 targets. With that said, and in response to the tight fiscal situation we are facing, we want to extend our call for support, both human, financial, and collaborative, from other departments and agencies. In conclusion, we are looking forward to welcoming the world into our province and in South Africa in the busy months of September, October, and November as we build up to the G20 World Leaders Summit. Our collective role is to champion hosts to all these visiting leaders, delegates, accompanied persons, media, and advanced teams. The hosting of these global sporting and multilateral events in Gauteng and South Africa reaffirms our position as Africa's leading business, arts, and sports entertainment events mecca. The socio-economic benefits and destination brand profiling and building work associated with these global platforms are massive. Thank you very much, Honorable Chair.
Thank you, MEC Maile. Honorable delegates, I'm reliably informed that there are some refreshments just outside the chamber. For those of you in the house, there's tea and coffee. Unfortunately, the same could not be extended to those participating virtually, but I'm sure they'll find their own refreshments. Honourable members, we continue the debates back in the House. It's now the turn of Honourable Ntlangisa Nodada, and we invite her to the podium for 15 minutes.
Honorable House Chair, honorable members of the House, honorable MEC and DM, MECs on the platform,
SALGA representatives, ladies and gentlemen. Let me greet you this evening with a greeting from the home of legends. House Chair, I rise on behalf of the African National Congress to support Budget Vote 38 on tourism. The budget cycle is an integral process in the lifespan of a government's term of office. Not only does it demonstrate how government generates its revenue, but mostly it serves as an accountability and transparency tool in the hands of masses of our people. Honorable House Chair, it is no secret that tourism sector is still largely untransformed. Those who own tourism products and take up spaces in tourism boards and executive positions remain predominantly white, while the majority of those who occupy positions in the lower levels and unskilled and semi-skilled laborers are black. This is what we have inherited from the brutal apartheid government, a system so entrenched that it still has people defending its underlying principles. Be that as it may, the ANC remains committed to defending our democratic gains. It is against this backdrop that we support the department's posture to enforce BBBE and equity in their procurement processes in various areas. Like in the end of they have their target for SMS women representation, which is 50%, but they've already achieved 50.8%. Persons with disabilities, 3%, they have 4.8 representation, as well as 40% spent on goods and services from SMMEs and women-owned businesses. While the struggle for just and equitable society doesn't start and end there, this provides a basis for inclusion and representation, which can add a source of encouragement for generations to come. We hope to see it applied across the department's program. At the moment, it seems that the department makes progressive move on some fronts. There is regress in some areas. For example, honorable members, it is concerning that Program 3 decreases by 10% in nominal terms from 367.8 million in 2024-25 to 331.1 million in 2025-26. The main cost driver under this program at 256.6 million is the Working for Tourism Expanded Public Works Program. The allocation for this sub-program was significantly reduced by 13.81% in nominal terms for the new financial year. This sub-program entails various skills development programs and tourism infrastructure programs. Through these, the department's plans to create 4,200 work opportunities over the medium term, in line with the MTDP's job creation priority, which is a substantial decrease in the number of work opportunities to be created when compared to the 17,988 that were planned for 2024-25 medium term. At this time, when we are experiencing chronic unemployment challenges, with the official unemployment rate being 32.9% and expanded unemployment rate standing at 43.1%, our government cannot afford to be implementing budget cuts on jobs and skills-related training programs and initiatives. Youth unemployment stands at staggering rate of 46.1% for the age group of 15 to 34. This is a cause for concern, and we urge government, in particular National Department of Tourism, to find alternative ways of boosting employment through PPPs and various other initiatives. According to an article on Business Tech, Honorable Minister, through you, Honorable House Chair, provinces within highest levels of unemployment are Northwest and the Eastern Cape. Both these provinces have a great potential for a thriving local tourism economy, which is necessary for creating jobs and a rapid mass scale. Honorable House Chair, under the same program, we must, in the same vein, welcome the interventions that will be made on the following. 1, implementing the budget resort network and brand concepts. 2, managing a pipeline of nationally prioritized greenfield and brownfield tourism investment opportunities. Facilitating 2 digital platforms to promote investment on tourism. Maintaining exceptional site quality by supporting destination enhancement initiatives over the medium term by implementing infrastructure maintenance and beautification programs in 4 provincial state-owned attractions, that is Gauteng, KwaZulu-Natal, Northwest and Northern Cape. Monitoring the implementations of 5 community-based tourist projects, undertaking tourist enhancement project at the Robben Island Museum. Honorable members, the recent storms in various parts of the country, such as the Eastern Cape and parts of Western Cape and KwaZulu-Natal, left a devastating effect on our families. Some lost their loved ones, while others lost their livelihoods. This caused a devastation on the whole country and impacted many sectors of our economy, tourism being one of them. Climate change not only threatens our social fabric and the trajectory on our development, but it deepens inequality, further poses a threat to our very existence. It is evidently becoming pivotal for our government and its implementing agents to develop infrastructure that is climate resilient and safe for communities. Climate resilient infrastructure is critical for sustainability of tourism products and destinations. As things stand, we are confronted with a number of challenges when it comes to potholes, lack of signage, and roads that are inaccessible during rainy seasons. The department, working with the Department of Transport, must address challenges as they are contributing factors to the escalating tourist-targeted crimes that we are seized with as the country. Working with the South African Police Service, we must support and welcome interventions to address crime in our country, because not only does it affect our image as preferred tourist destination, but it dampens our efforts to grow tourism sector and thereby increasing job loss and hunger. We welcome the role played by the tourism monitors across the country. The intervention does make a difference in experience of every tourist. We urge the department to closely monitor this program, better coordinate it, and provide effective training for the better outcomes. We hope that all allegations of irregularities and mismanagement around this program will be addressed and resolved with the necessary consequences and measures in place. Honorable House Chair, as I conclude, I would like to place emphasis on the committee recommendations to expedite the implementation of the Tourism Equity Fund and Tourism Transformation Fund. Equally, more attention must be paid to the tourism grading system to ensure that more establishments are graded and meet the standard set. These are all efforts that ought to move us step forward in our transformation agenda. I should think, Chair, because I still have some minutes, I need to put emphasis on the fact that though other people may not see what is happening in the tourist sector, but as the ANC, as I've already alluded, we see that there is progress, and more especially what the department is putting on in this financial year. We really, as oversight body, going to oversight and see to it that it is implemented. With that said, I support the ANC, support the budget vote, and I thank you.
Thank you, Honourable Ndlangisa Nodada. Honourable members, to the Free State we go now. The MEC for Finance, Tourism and Small Business Development is the Honourable Makume, who has been given 10 minutes to put forward the Free State's position. MEC Makume.
Greetings, Chair of the House, to the Minister and the Deputy Minister, my fellow MECs, honorable members. From the Free State, we are truly encouraged and we really praise
MEC, sorry, can I ask, MEC, I'm sorry to interrupt you. If I can ask you please to just turn your video on so that we can see you, and then proceed with your speech.
It says that the video has to be disabled by the host.
Okay, thank you, Honourable MEC. If you can continue then, please.
We are very much pleased by the budget that has been tabled by the Minister, particularly in the Free State, because Free State is a province to go to, not a province to go through. This is the province where we offer a diverse range of experience centered around its scenic beauty, the cultural heritage, the natural attractions. The province known for its wide open spaces, rolling grasslands, majestic mountains, provides a tranquil escape with unique activities that highlight its rural charm. Therefore, the budget, it's like a hand that fits in the glove to our intentions and the programs. We want to thank the Minister for having visited the province, I think twice or thrice so far, and encouraging the province to look at some of the possibilities that although we are a province that is that is being visited low by visitors, particularly from other countries and also in the country, but there are issues that she has raised with us that they are also being raised in the budget. So we really want to thank the Minister for that. We have the natural beauty and outdoor adventures at the Golden Gate Highlands. They're located in the Maluti Mountains. This park is renowned for these dramatic sandstone cliffs, hiking trails like the 33-kilometer Reebok Trail, and wildlife such as zebras and eland. It's a prime spot for nature lovers and families, with the Basotho Cultural Village offering insight into the traditional Sotho life. Added to that, the National Department, in conjunction with the Sun Park, they've also launched the Godumodumo Dinosaur Center, the Dinosaur Interpretation Center in the areas of the Golden Gate Highlands National Park in the Free State. It's a world-class facility celebrating the region's rich prehistoric and cultural heritage. Opened on the 22nd of June in 2025, the 120 million center funded by the European Union and South African government through the departments that I've mentioned measures the paleontology, the ecology, the geology, and the Basotho cultural heritage through interactive exhibits. Its name, Godumodumo, meaning great giant, in Sesotho draws from the Basotho methodology about the mythical beast tied to fossil, the discovery in the area. This also is an indication that indeed Free State is a place to go to, not a place to go through. The Maluti-Drankensberg Road, a scenic self-drive route through which the Eastern Free State encompassing charming towns like Clarence, Ficksburg, and Forisberg. It offers activities such as hiking, horse riding, and skiing in winter with stunning views of the Drankensberg. And we are happy that part of the budget presented by the minister today also look into these areas, particularly in the Maluti Mountains. The tourism boost, managed by the South African National Parks, the center aims to increase visitor stays and the bed occupancy in the Free State, while promoting the ecotourism activities in the hiking and horse riding. The Fraudefort Dome is one of the most important UNESCO World Heritage Sites. This is the world's largest and oldest majority impact site, which has been visited by the Deputy Minister many a times, introducing programs and projects that are trying to resuscitate the tall part of the heritage site into its geological significance, making it a unique rural attraction. And also the Caledon Nature Reserve, located 120 kilometers from Bloemfontein. This 3007 HA reserve is ideal for angling with record-sized carp and pebble. So the budget also talks to this, and it makes this home to the wildlife like black wild beasts and the zebras, as well as nearly 200 bird species, including the fish eagle and other species that are found there. The Maluti Cave route trail. This trail in the Eastern Free State features majestic mountains, waterfalls, and caves in the sandrock art, offering 2 to 4 day hiking experiences. You must come to Free State and enjoy these natural beauties. The cultural and heritage experiences that we must also celebrate to ensure that the Basotho Cultural Village, situated also in the Golden Gate Highlands, this village provides an immense experience into Sotho cultural and traditions, including the cuisine, the architecture, and the cultural practices. The Mangaung African Cultural Festival, one of the biggest festivals in the country so far. This is one of the 10-day festival showcase African arts. We are happy and glad that as and when we discuss and approve this budget today, we have also announced in the very same month the return of Makufe in Bloemfontein, where visitors will enjoy performances in the jazz, gospel, tradition, sports, arts, and culture. The Cherry Festival in the Ficksburg, the oldest crop festival in South Africa, held annually in November, celebrates the region's cherry production with the events and activities that highlights local agricultural. We are happy that in conjunction with the Department of Arts and Culture and the Department of Tourism, we will be ensuring that the SMME takes place and also participate in these particular activities that will be taking place. Free State is a place to go to, not a place to go through. So we are really inviting the people of this country, the people of the world to come and enjoy the wildlife and conservation. Lions Rock Sanctuary and Wildlife Estate, located in the Eastern Free State. This sanctuary houses lions, leopards, and a Bengal tiger, focusing on conservation and offering a unique experience for wildlife enthusiasm. The cheetah experience in Bloemfontein, come and watch it, come and have a nice view on it. Part of the Fila Fund's cheetah breeding project. This non-profit educates visitors on cheetah conservation and emphasizing the preservation of their ecosystem. It is for that reason that one rugby team in the Free State is also named after the cheetahs. The Boscopi Lion Farm and the Game Reserve, which also is situated in the Edenville district. This reserve features a carnivore breeding project with 70 lions, tiger, and jaguars, attracting visitors interested in the bigger cats. The Mariam Roka Game Reserve is also getting its right footing because primarily of the support that we have received from the National Department. This includes the offer stunning grasslands, the wildlife, and the hotel comforts, providing a blend of nature and luxury. The historical and geological sites, the diamond and the wine tourism, the adventure and agriculture tourism, The Parades, a riverside town offering adventure sports like white water rafting on the Vaal River, which is also bordering in the borders of Gauteng, as well as the berry picking and art galleries. The annual Dome Adventures Festival in November features the dragon boat racing and the live music. This is also an emphasis that indeed Free State is a place to go to, not a place to go through. So indeed, Minister, we really support also the initiative that the department has taken to begin to work together with the Department of the Department of Agriculture in relation to the Nampos Festival, one of the world's largest agricultural festivals held in May. It draws thousands to explore the regions and agricultural heritage. We share these activities with the province of Northwest, and we are in joint venture with them to ensure that we promote tourism as one of those areas that are building the blocks in relation to the economic development. The social and economic impact. The rural tourism in the Free State is a strategic focus for us, aiming to diversify the economy beyond agricultural and mining. It contributes significantly to the provincial revenue with initiatives like Butawapili, Country Lodge, and Dinukeng Tented Camp in Kwakwa, showcasing investment potential. The community development. Studies indicate that towns with stronger tourism and hospitality sectors are wealthier, with smaller rural towns particularly dependent on tourism for economic upliftment. The Enterprise Dependency Index shows a direct correlation between tourism enterprises and reduced community poverty. We do have challenges as a province. One of them is that despite our potential, and the rural tourism faces challenges such as limited local government capacity, a lack of entrepreneurial expertise. However, we are pleased that the Department of Tourism has actually shown an interest, and we are engaging some of the municipalities to ensure that we have a very community-based tourism, the CBT initiatives aimed at addressing those challenges and promoting sustainable development and local participation. Indeed, Free State is one of those provinces that we must proud ourselves as a country. The unique features include the scenic roads. The Free State offers 5 major tourism routes: the Cheetah Route, Eagle Route, Lion, Flamingo, and Springbok, each highlighting unique cultural, historical, and natural attractions. The Eagle Route, for instance, runs along the Lesotho border, offering the cherry-picking dinosaurs, fossils, and the rock art. You will have asked yourself why we have been emphatic on saying that Free State is a place to go to, not a place to go through. This is because there are 6 provinces that are bordering within our province: Gauteng, Mpumalanga, KZN, Eastern Cape, Northern Cape, and Northwest, including the country called Lesotho and KZN. And we are therefore engaging the KZN and Lesotho in the areas and cultural activities that we want to launch in relation to a new thing in the Free State and KZN, the cable car. So we are also engaging Lesotho in the the Drakensberg Mountain to have a joint venture in those areas. Honorable Chair,
thank you, Honorable Minister Honorable MEC Makume. You know, we are bound by the rules and the Chief Whip's determination of the order paper. He said we just give you 10 minutes according to Rule 59, so I have to oblige by that. But we really know the Free State now. Thank you for your input. All right, honorable members, the next speaker on the podium is going to be in the house here is Honorable Peter from the Eastern Cape, the home of the Ado Elephant Park.
Inkosi mazithambe isicaka sivumile. Mhlali ngaphambili mandicele indlebe kwizwekazi loMzantsi Afrika ndibulise kwabendlu ngokunjalo nakumphathiswa omhle. Ndithi mandenze amabalengwe ndithimlele umphathiswa welisebe lwezokhenketho. Umama onembali etyebe kakhulu kwezombangazwe ngephondo leMpuma Kapa.
Mphathiswa omhle, eli phondo kulapho liqandusele khona iinkokheli kwaneenkokhelikazi. Amagorha kwanamagorhakazi. Kodwa ilishwa leli phondo kukujongelwa phantsi leli sebe lakho. Apho ezoqoqosho luyimbali ngokuthi iziseko zotyelelo zingaseleso ngabasemagunyeni bephondo. Mandikudizele amahlebo hleze ndibe lijaja ligazi kukujanyelwa ngaloo mehlo anobuzaza. Ndikukhumbuze malunga nephondo lwentshona koloni ukuba malingabekwa kwiqondo elidlule onke amanye amaphondo kwicandelo lwezokhenketho libe iphondo leMpuma Kapa lijongelwe phantsi ngokuthi hleli nje kukhankanywa le-Table Mountain njengesiqalo nesiphelo soMzantsi Afrika. Libe iphondo leMpuma Kapa lingabonelwa ndawo kodwa ibe imbali ityebe iteketeke. Kuthiwani ngeentaba zaseQunu apho kulele khona uMadibo Mde isitshotshovu sesidela kufa umongameli wokuqala wesininzi. uNelson Mandela Rholihlahla inkosi ngokwayo eyadela ukufa ngenxa yokulwela isininzi yayihlubula ingubo yobomi yambatha eyokufa ingubo kwahlehla ukufa saphatha isininzi. Kuthiwani ngeentaba zaseCoffee Bay apho indlela ibonakala imaxongo kungajongela ntweni. Kuthiwani ngeNgqamakhwe, kuthiwani ngesibhedlela sothaba lofefe apho kungahambekiyo apho ibhasi yabaqubutha khona balityigidi ligazi kwathula kwathi cwaka akwabikho mpungutye ikhonyayo. Kuthiwani ngengqobo nangembali etyebileyo yaseMthatha neGcuwa apho usomashishini oze ngobuso ezweni ezama obizwa njengoNcuthu Tours waseMonti esiqokelela imbali ezama ukusakhela amathuba emisebenzi kodwa akaveli ndawo. Kubabazwa eli phondo lwentshona koloni. Kuthiwani ngeCraddock 4 yini na iindawo zephondo leMpuma Kapa zijongelwa phantsi nje uCommunista. Mandeke mphathiswa omhle ongathi uhlamba ngobisi bubuhle obunjenagazi ingubo ini na kwaba ibahlaselayo lengugo ungagugi nje wena. Ingabe ihlebo lakho nomntaka Njengele Holomisa liyintoni na? Kwaba kwasana niye niba ngabasana kodwa thina zimveku siyatshabalala. Ncedani sihlebeleni nathi ukuze sizuze amade ngawetyala utshaba lixesha. I-UDM iyavuma ukuba ngenxa yesininzi esalwelwa nguMadibo Mde iyawuma kweliqonga itsho ithi imveku zakuthi iyawuhlala isithi iyayipasisa le budget. Xa ipasisa le budget mphathiswa omhle sithenga ibuso be-ANC sithenga abantu belilizwe. Nkosi mphathiswa.
Thank you, Honorable Peter, for your articulate speech. I think the minister is going to appreciate all the attributes you have put on her. All right, the next speaker is going to be inside the house from Gauteng, Maboning. Honorable Du Plessis, over to you, ma'am.
Honourable House Chair, Honourable Minister, Deputy Minister, members and fellow South Africans. Tourism is everybody's business, yet not everybody in South Africa is currently benefiting. This industry is seen as the largest industry worldwide. However, we are not optimizing and professionalizing what we have to offer to our visitors, either local or internationally. Our world in one country identity is not being optimally showcased, from the mismanagement of the Panorama route in Mpumalanga to the unfinished Sarah Baartman Memorial in the Eastern Cape, our country's potential is carrying the shame of neglect, maladministration, and misappropriation of funds. Looking at the budget, I cannot understand why 53.4% of the budget is going to an entity that is not fulfilling its mandate, South African tourism. Lavish international trips and inconsequential million-rand video shoots meant to market South Africa have not worked, with most provinces showing a decrease in tourism and an inability to recover from COVID as other developing countries are creating an ever-increasing tourist-centric society. The strategic plan for the midterm budget has so many of the correct buzzwords, from cross-sectoral approach to destination development. It even mentions the green economy and training. And based on this plan and the amount spent in 2024-25 and the years preceding, we should have been able to regain our position in the world of tourism, but we have not. It is then logical to think that something is not working. And one of those somethings is the expensive program Tourism Research, Policy and International Relations. Tourism research is important. However, it is clearly not being done, with the tourism industry stagnating in most provinces, while each province has something to offer. Growth policies are either not implemented or in place, and international relations, well, it's not shooting out the lights. Countries like Bhutan, Costa Rica, Mexico, and Ecuador, all developing countries, have shown incredible growth through taking a true whole-of-society approach to make the stories and experiences of their countries count. A strategic intervention called regenerative tourism that goes to the ground and prepares communities to showcase themselves and their environs in a sustainable manner has proven hugely successful. It is more than protecting and conserving. It is about experiences where visitors encounter local knowledge, local wisdom, and lived experiences shared by locals that leave the tourist with a lasting impression and as friends of South Africa. It is when you put on your first pair of leather shoes from Wuppertal, see the sunrise and sunset over the Vredefort Dome met 'n stukkie beskuit, or when you have your first surprising sip of mkomboti, apologies, at the celebration, that you start discovering the stories of South Africa. And in that moment, when a local host sees the excitement in the eyes of our visitors, they find pride of self, pride of identity. However, local development cannot take place with just a national promise or a strategic plan or a speech. Individuals need to be developed not as a tick box exercise, but as an exercise in self-discovery and finding cultural roots so that these stories can be created into experiences for our visitors. It is not a superficial intervention. It takes time. It takes prudent expenditure, and it takes a passion for the people of this country. Unlocking the stories of all communities takes forethought and an understanding that local economies can be turned around just by genuine transformative development and marketing. Harbour towns can find new life when out-of-work fishermen find a place in regenerative tourism, or when a gogo in a small village showcases what it is to live off the land, subsistence farmers benefit. People, tourists, want these experiences more and more. They want to connect. They want to authentically experience the cultural richness of a country. And do we not have a world of cultures in South Africa? Unfortunately, too often, tourism is politicized on a local level. And when we politicize the inner workings of an industry that needs to be entirely about the people, about the cultures, about shared experiences, it takes away what we can offer as a country. In Sao Paulo, the provincial minister of economics sits down with all departments that contribute to economic growth, and this includes the social cluster. It also includes community safety. And in this conversation, they remove all political games from the conversation, removing promises and ensuring action, because it is about the economy. And the impact of this is evident in their tourism. One example is in a city of 14 million people. Each person has been prepared from early childhood in tourism-centric and customer-centric education that has created an environment for the tourists they want, a tourist that grows the economy. If we do this, true cross-sectoral engagement without politics, all our communities will grow. Tourism is not about marketing or wonderful presentations. It is about meaning. It is about people. And until we place our people, our stories, our skills, our culture at the center of the strategy, we will continue to fall short of what South Africa could be. Honourable Chair, as a Democratic Alliance, we look forward to hearing and seeing how the department will implement their plan to grow the economy for the people. I thank you.
Thank you, Honorable Du Plessis, for your input. The next member or delegate who will come to the podium is Honorable Masipa from the Western Cape. Over to you, sir.
Honorable House Chairperson, Honorable Minister and Deputy Minister, Honorable Members, GNU partners and non-GNU partners, South Africans at large. Tourism Department is packed with policies and strategies from the National Tourism Sector Strategy to the Tourism and Climate Change Strategy, amongst others. Promotion of tourism is important for this country, but the lingering question is, how far is the department in implementing these policies and strategies? And Minister, the most important question of all, where are the jobs as asked by my colleague in the National Assembly? Equally troubling is the department's continued relationship with the DBSA. Why must the department, through its South African Tourism Board, continue to spend billions of rands via the DBSA, an entity with a long track record of underperformance and zero accountability? In the 6th Parliament, I was alerted of serious problematic project management relationships between DBSA and South African Tourism Board. Under Programme 2, the department has allocated 1.4 billion rands for the 2025-2026 financial year. Of this amount, 1.3 billion rands is transferred to South African Tourism Board. Of the remaining 107.8 million goes to compensation of employees, leaving just 42.8 million rands for essential research partnership with universities, bilateral cooperation and membership platforms. Over the medium term, South African Tourism Board will receive 2.8 billion rands to market South Africa both internationally and domestically as a leading tourism destination, which we welcome. Yet the DBSA-led projects continue to stagnate and nothing changes. Now, let me turn to the Western Cape, a province where things happen, a province that works, where hope resides under the Democratic Alliance, a party that cares about all residents. Through Wesgro and SOE with clean audit, the province is expanding its leisure and business tourism footprint in support for the Growth for Jobs strategy, which aims to double tourism by 2035. One key sub-program, leisure tourism, is implemented in partnership with the industry and other stakeholders. It relies on data-led decision-making to identify strategic markets for broader impact. As the Minister has said, that data-led driven tourism is important. While other parties in red, green, and yellow in this House wants to divide the province, the Democratic Alliance-led government's program attempts to unite us. It's the DA governance that has ensured that Cape Town remains top of the chart in terms of tourism. A prime example of this partnership is a model of wine tourism in the Western Cape. With the support of Wine South Africa, Wesgro, and SA Wine Routes Forum, the National Wine Tourism Strategy was launched in 2016. Wine South Africa's vision is to position South Africa as a global wine tourism leader with a strong commitment to responsible tourism. House Chair, allow me to name one remarkable person in the beautiful story of wine industry, Tuani Price, an American Capetonian wine educator and entrepreneur. Through her initiative, Sips with Soul, she is reshaping the narrative of South African wine tourism by highlighting Black-owned wine farms and the broader contributions of Black-owned brands across the Western Cape, supporting the work of the Department of Agriculture and wine industry. In an industry often criticized for lacking diversity, we thank her for contributing towards inclusion of the sector. Her tours to these Black-owned wine farms, which brings revenue to these farms, offer more than traditional tasting. They showcase untold stories, cultural richness, and economic potential. With endorsement from South African Wine and WOSA, her upcoming events providing a spotlight on Black-owned brands will feature panel discussions, networking sessions, and investment-driven dialogues that signal a bold new direction for tourism on Black-owned wine businesses. This is the kind of innovation we need to back, not endless strategies with no delivery, not billions funnel through failing SOE, not policies that never reach the people. The Convention Bureau sub-program is another example of best practice. It positions and markets Cape Town and the Western Cape as a premium destinations. Westgrow does not outsource these efforts. Instead, it works hand in hand with regional and local tourism office. A recent collaboration with Swartland Tourism led to the Swartland Tourism Showcase, which connected tour operators with unique offerings across the Swartland's town. Westgrow also worked with the South African Tourism China Hub to host renowned Chinese actor Lei Jiangyin in South Africa alongside SAT China representatives to promote Cape Town and the Western Cape as a world-class destination to Chinese audiences. On the youth front, Westgrow participated in the 3rd annual Youth in Action Expo at the CTICC. This two-day event brought together 170 exhibitors, offering young people valuable exposure to career guidance, entrepreneurship, and educational opportunities. Westgrow's global efforts also include participating in Experience Africa 2025, which was hosted in London by the African Travel and Tourism Association. Westgrow used the opportunity to promote the Western Cape to key international buyers, deepen relations, and raise the global profile of the province's tourism assets. At the SAT UK Roadshow, Westgrow traveled to Belfast, Glasgow, Birmingham, and Bristol, reaching over 50 travel trade stakeholders per event. These engagements allowed Westgrow to promote the Western Cape beyond the major urban centers. At Taste of London, one of the world's premier culinary festival, the South African Tourism, supported by Westgrow, hosted a vibrant installation modeled after a spaza shop. Visitors sampled Cape Malay curry, boerewors, popoti, and Cook Sisters, paired with the Stellenbosch wines, which Honorable Modise enjoys so much. This event attracted over 50,000 visitors and gave South African flavors and tourism a memorable global platform. Westgrow also hosted the first regional tourism office forum of the new financial year at the Trails End Hotel in Grabo under the theme, I quote, Unlocking Growth from New Markets, India, close quote. This event brought together key stakeholders to understand the Indian traveler, identify market challenges, and align strategies to better position the Western Cape. The province continues to lead in attracting business events. In the past year alone, 36 bids were secured with a projected economic impact of 745.1 million rands, surpassing the initial target by 56.1 million rands. These events will bring delegates from sectors including healthcare, satellite technology, STEM education, agriculture, and business leadership, driving both economic growth and knowledge exchange. Finally, the Cruise Cape Town sub-program is helping unlock the cruise economy through targeted support, public-private collaboration, and improved port offerings. The 2025-2024 season contributed 1.32 billion rands to the regional GDP. The sector supported 1,965 jobs in total, including 1,096 full-time equivalents, with the rest generated through multiplier effects. Western Cape rocks because we collaborate and we unite. Honorable Chairperson, the Western Cape is proving that with data, as Minister has said, partnerships, and sound governance, tourism can be a powerful engine for jobs, investment, and opportunities. Let's back what works. Let's support delivery over deception. Let's build a tourism sector that tells a full story South Africans want to hear, one that is inclusive, job-creating, and bursting with potential. Not the greenwash version built on lies, not the lies of the Prisoners' Alliance, not the toxic red beret rhetoric of division and destruction, not a movement that chants kill the Boer, kill the farmer, not a party that builds shacks on wetland and calls it progress. We deserve better, and the Western Cape, under the Democratic Alliance, we are showing that better is possible. Let us build on that. Let us take it nationwide, and we support your budget, Minister. I thank you, Honorable House Chair.
Thank you, Honorable Masipa. I think we know Western Cape better now. Over to you, Honorable Farmer, as the speaker on the podium. Do not disturb Honorable Farmer. Honorable Farmer, this time is yours, Puti. Over to you.
Honorable Chairperson, Honorable Minister and Deputy Minister, honorable members, fellow South Africans, again I greet you in the name of Jesus Christ, our Lord and Savior, the God who was crucified on Calvary. Again, I rise on behalf of the Patriotic Alliance to express our clear and firm support for the budget vote 38 tourism, because we know that when tourism works, jobs are created, communities thrive, and our people get real opportunities to lift themselves out of poverty. Chairperson, transformation of the industry is, however, still dodging and eluding the poor, especially in the Western Cape. In close to 100% of the time, the first face tourists see when visiting the Western Cape is a white face. When it is so often happens, when transformation of the tourism sector is addressed, mentions are made of job creation, as if our colored and black people are only good to work and not to own and operate. It is a well-known fact that the tourism industry is one of the worst paying and non-unionized industries in the country. Honorable members, before COVID-19, this sector sustained 1 in every 10 jobs in our country. We lost many of those jobs. Many small guest houses closed their doors. Many tour guides, craft sellers, and hospitality workers are still struggling to recover. So the question before us today is simple. Will this budget put our people back to work? Or will it be swallowed up by conferences and consultants? The Patriotic Alliance says, as much as we support this budget, we demand real transformation and impact. 1, establish previously disadvantaged-owned tourism as SMMEs. Our people do not want handouts, they want bookings. Let this budget truly reach township guest houses, community B&Bs, tour guides and craft markets. Let the village homestay be part of the National Tourism Plan, not just the big hotels. 2, fix our infrastructure. Broken roads, unsafe areas and unreliable transport kill tourism faster than any economic crisis. Let this budget work with provinces and municipalities to make sure tourists can safely reach our hidden gems, from the garden route to rural Limpopo. 3, market South Africa smartly. We must attract more tourists for new markets, but we must also encourage South Africans to travel our own country. Domestic tourism is the bridge that keeps small operators alive in tough times. 4, protect our natural and cultural heritage. Tourists do not just visit places, they visit people, cultures, and natural wonders. Let us preserve our beaches, game reserves, and cultural sites so that the real indigenous peoples can also benefit. Chairperson, our people are ready to host the world, but the world must find a country that is authentically African. Let's stop confusing the tourists by making them think they landed in Europe. This budget must not just buy brochures, it must deliver a world-class experience, an African experience, a South African experience. Honorable members, the Patriotic Alliance believes tourism must uplift our communities first. We want local chefs, not Zimbabwean, local artists, local guides, and local youth to own the industry and benefit from every tour bus that stops at the rural site. We say train our people, fund their small businesses, help them market their homestays and crafts, and you will see jobs multiply. Chairperson, when tourism works for the indigenous, hope returns. A tour guide can feed a family. A township B&B can pay for a child's studies. A rural craft market can keep a whole village alive. That is why we support this budget, but we will watch carefully that it does not get lost in admin and consultants. We want every cent to bring a visitor and every visitor to bring an opportunity. Let us rebuild tourism so that it is not just for the rich or the big chains, but for our people in townships, rural towns, coastal villages, and city corners. Let us make South Africa the place the world wants to visit, and the place where our people benefit every day. We stand with our people, we stand with this budget, and we stand for jobs, hopes, and dignity through tourism. Honorable Minister, Muni Baizani Masakant, salute.
Yeah, Honorable Farmer, thank you for your input. And then I thank the Masakant Thurstan Alice. All right. Over the next speaker on the podium is the Deputy Minister, Honorable Soju.
Yeah, no, thanks. Thank you very much, Chairperson. I thought there are steps here. As you can see, I'm too tall for this. House Chairperson, Minister of Tourism, Ms. Patricia de Lille, Masakant, MECs in the platform, Chairperson of the Select Committee on Economic Development and Trade, Ms. Boshoff, honorable members and delegates, my DG Vele, CFO, Member Ponya, SAT, CEO, and all officials present. Ladies and gentlemen, our policy debate is happening in the midst of many commemorative activities that continue to celebrate our great icon. Our former president, Rolihlahla Mandela, in this July month, under the theme, "It's still in our hands to combat poverty and equity," which is the 2025 theme for the Nelson Mandela International Day, which was the 18th July 2025. We therefore heed the clarion call of our president during his State of the Nation address this year, President Ramaphosa, that aims to embody a nation that works for all and where no one is left behind. The president mentioned the recovery of the tourism sector and its potential for further growth. This included the tourism impact areas, such as the master plan for job creation and expanding support for small and medium enterprises within the tourism sector. A thriving SMME sector not only strengthened the economy, but it also upholds the values of resilience, self-reliance, shared prosperity, and sustainability that define the spirit of freedom. House Chair, as a department together with our entity, we thrive to champion the conditions for a possible sustainability. In this instance, to lower many barriers that inhibits SMMEs entry into hotel industry. For example, the department's program, the Tourism Grading Support Program, that is TGSP, which is continuing to subsidize grading costs. In the financial year 2024-25, the TGSP supported 2,970 establishments, encouraging active participation in the Tourism Grading Council of South Africa grading systems. These efforts contribute to the standardization of service excellency, helping South Africa to remain competitive in global tourism markets. The pursuit of excellence in tourism service is not mere standard. It is a recognition of hard work, passion, and commitment to going the extra mile. Hence, the department was in the Eastern Cape Chair this last weekend to award the selfless tourism business sector operating in these Dorpies and rural communities. It was in Umtata and Ekoman. These tourism service excellence awards are far more than mere commendations. These awards help raise the bar for equality and quality and professionalism. Excellency in tourism service creates value for all. Thank you to MEC Nonkubela Peters for all the support you provided to ensure the event was a success this past weekend. We recognize the importance of business to the growth of tourism in supporting growth in the MICE, which is meetings, incentives, conferences, and exhibitions subsector. The South African National Convention Bureau has invested 19 million in the bid submissions through its bid support programs. This is to attract business events linked with the national government's development priorities when bidding for international meetings. The secured conferences will also contribute to the regional spread of businesses events. Given that tourism is a highly labor-intensive industry, people would rightfully expect to see significant local employment within these successful bidding international conferences. Let us think about all the possible jobs that are connected to this tourism subsector, whether it is a driver, a messenger, a cleaner, a waitress, a chef, tour guide, tour operator, even planners and owners of establishments like hotels and resorts. There is no doubt that this sector has big potential to create many jobs. For the tourism sector to promote pro-poor growth chairperson, the employment level of local South African citizens in each of the provinces must rise as much as their representation in managerial positions. The bidding program promotes inclusivity by extending the benefits of business events to villages, townships, and small dorpies, in line with the district development model. This regional focus supports equitable development and contributes meaningfully to the transformation agenda by fostering economic growth and job creation in historically marginalized communities. House Chair, the South African National Convention Bureau facilitated the hosting of 9 business events in the villages, townships, and small dorpies, as I have mentioned, during the reporting period, contributing to inclusive tourism growth and local economic development. We also hope that the G20 delegates will experience the rich heritage and cultural through its vibrant cities, dorpies, and townships, as well as its art and crafts, in the process allowing G20 delegates to live with a lasting memory while contributing to the South African economy. Without community involvement, tourism projects may fail to gain the necessary support and could lead to adverse outcome. This notion of the inclusive tourism need was also emphasized upon by the communities of Bokant, which I visited on the 7th of July, it's about a week ago. They said fostering a strong community and stakeholder engagement is essential for the long-term successes of tourism, core purposes, initiatives, and ultimate outcomes. Chairperson, tourism is about the people of South Africa. It is about guest house owner in Bizana sharing the great cultural and heritage of the Eastern Cape. It is about a tour guide in Mbombela sharing a hidden gem in Mpumalanga. Therefore, we must translate and implement our progressive legislation into more inclusive tourism. Honorable members, in today's world, we must also supplement our approach to inclusive tourism with stronger bilateral relations. When we collaborate between government and business, between communities and travelers, we build more than economic growth. Our successes as a Department of Tourism is closely tied to the improvement of infrastructure and safety of this infrastructure, as alluded to by the Minister. Safety is not the responsibility of one department or one city. It is a shared responsibility. For South Africa to remain competitive in the global tourism market, all stakeholders from government and law enforcement to tour operators and local communities must collaborate to prioritize safety of our tourism. It is with this reason that the department initiated a tourism monitors program to supplement the safety and security measures of the South African Police Service, enhancing tourism safety. A safer South Africa means more tourists and stronger local economy. We have also looked in the mirror and seen some challenges in the tourism industry, but there are also real strength, deep resilience, and huge potential in our country's tourism sector. As I conclude, I must expand the benefits from tourism activity to ensure that the growth we are seeking is inclusive. We must continue to ensure that transformation is a thread that runs through all our interventions so we can see an improvement in ownership patterns and spread benefits that result from inclusive economic activity in the tourism sector. Lastly, Chairperson, to Minister Delil, I appreciate the leadership you have provided through this year and looking forward to continue working together to see through our given mandate to transform and thrive the tourism sector for job creation and inclusive economic growth for all South Africans. Baie dankie Masekant. We also appreciate the positive diligence and support of the Select Committee Chairperson, Honorable Boshoff. To my DG Vele, CFO, and all Team Tourism, I extend my gratitude for the good work well done for the past year. Minister, wait, here comes a clean audit. Thank you very much.
A GNU partner speech.
Thank you, Honorable Deputy Minister.
That was a GNU partner speech.
Thank you, Honorable Deputy Minister, for your input. The next member to come and articulate his or her policies on the podium is Honorable Machobeni from the Eastern Cape.
Thank you. Thank you, Honorable Speaker. Evening, Honorable Speaker. Evening, Honorable Members, Minister, Deputy Minister, and the team, and all South Africans. Chairperson, Chairperson, this year the Economic Freedom Fighters celebrates 12 years of existence and 12 years of being the voice of sanity and superior logic. It has been years of resilience, bravery, and selfless, despite the many doomsayers who tried to frame the EFF as destiny for failure. And it has been 12 years of unbroken struggle for economic freedom. As such, we invite all our supporters to join us this Saturday, right here in Khayelitsha Rugby Stadium, as we celebrate our 12th-year anniversary. Minister, in your opening, you said you
you plan your future. How can you plan your future? I thought you will expand to your plan because the fact of the matter, we cannot run away that there are those who left behind, especially in rural areas. And also you've mentioned skill development. What kind of skill you've mentioned? And also who will be benefiting on these skills? And also you've mentioned 2 projects in the Eastern Cape, Minister. There's a lot needs to be done in the Eastern Cape. You will catch it on my debate. Chairperson, the economic freedom fighters reject the budget votes for tourism. Wait. Listening is a skill. Tourism is critical to South Africa's socio-economic development as it provides a number of benefits such as employment and entrepreneurship opportunities. And it is a key growth area which can lead to significant job creation across the country. And whilst the sector is vulnerable to disease outbreaks, economic downturns and other shocks such as climate threats, tourism remains but a missed opportunity within the realm of economic development. This regardless of its potential for the poor and marginalized communities. The failure is largely due to countless challenges which impact its growth and development within municipalities. With lack of funding hindering infrastructure development, marketing efforts, and the overall capacity to manage tourism effectively. Many municipalities seemingly also lack a deep understanding of tourism potential and how to effectively market and manage tourism assets. And there are also short of tourism-related skills within local government in particular, making it difficult to implement tourism initiatives and provide quality services. This includes a lack of expertise in areas like marketing, hospitality, and sustainable tourism management. It also doesn't help that coordination between the different level of government, local, district, and provincial is weak, leading to duplication of efforts or conflicting priorities. Some municipalities struggle with governance issues, including mismanagement, inefficiency, and corruption, which negatively impacts tourism development. Complex regulatory frameworks and bureaucratic processes make it difficult for businesses to operate and for tourists to access destinations. And for too many South Africans, we do not have the opportunity to visit other parts of South Africa with the same ease enjoyed by foreign tourists. This ministry has also ignored rural tourism and leisure activities which could be carried out in rural areas, and has failed to revitalize tourist activities such as community-based tourism, ecotourism, cultural tourism, adventure tourism, guest farms, backpacking, riding, and agri-tourism. Take, for example, the Eastern Cape, where I come from, one of the most beautiful provinces in the country. In the Eastern Cape, Chairperson, there is a place called Mpashe Municipality, which is located in the southeastern part of the Eastern Cape province, bound by the Kocha River in the south and Mwasa River in the north along the Indian Ocean. Mpashe earns its name for the beautiful Mpashe River, which flows from the banks of Ngobo and through Dutwa, Katyane, and Kocha. The area also boasts the head offices of the Amaxhosa Kingdom at Ngatu, Great Place. There are tourist attraction sites there, Chairperson, such as Vulture Breeding Place in Colwebbles in Trizele, Dutwa, under Ward 8, which is situated along Mpashe River, and the river of Mpashe River is most beautiful from the site. We also have nature reserves such as Dwesa and Twepa nature reserves,
and indigenous forest at Dwesa and Klepa, which has been protected since 1891 and 1893, respectively. The forests are predominantly evergreen and are separated by the Mpashe River. We also have beautiful river mouths and beautiful bed and breakfast places for accommodation in Mpashe and beautiful hiking trails, but most of them are not marked, which is a challenge for hiking clubs like Mpashe Hiking Adventures Club, which promotes domestic tourism. The club is busy with the process of making the hiking trail so that even without their guidance, a person can know where they are going and where they should end, and also highlighting the distance. Main focus being the King Yinsa hiking trail, which starts from Willowvale town and ends next to King Yinsa's grave along Ngabaga River. Willowvale also has the sites of the late Xhosa kings, namely King Sachile, King Yinsa, and other sites which they aimed to also mark as hiking trails. Mpashe also experiences other challenges such as lack of network infrastructure along the routes that lead to these sites. And we have found that in as much as people are interested in going to see these sites, the roads infrastructure is so badly worn out that cars cannot drive through these routes because the roads are damaged, some by heavy rains, and some are just worn out and required maintenance. Another challenge is that these tourist attraction sites are not maintained. The buildings are dilapidated and are not in condition of attract tourists. The sites in Mpashe are also not marked well, as people that visit the area simply do not know which avenues to follow with regards to making sites known. There are also no road signs that direct tourists or even billboards that boast of our beautiful heritage sites. There are also other sites that have not yet been discovered, such as beautiful waterfall that is situated in Ngadu, but no one knows about it, and residents don't know which steps to follow to put such on the map. Rural areas like Mpashe are forgotten by this ministry, even though there exists great potential to bring wider benefits to these areas. Chairperson, this sector has a responsibility to contribute in the economic development of rural and township communities such as Mpashe, yet year and year out, they fail to do so. And this minister has done nothing to promote community-based tourism activities in villages, and he has created no opportunities in villages and township. Our tourism sector is on the verge of collapse, and this ministry has provided no believable solution on how to revive it. In this decade of the economic freedom fighters, we reject these budget votes. Before ngihlale phansi sihlalo, in Mpashe, where I come from, we have 10 beaches. I came from rural areas. We have 10 beaches, 3 of which are located in Willowvale, and the 7 are located in Elliotdale next to OR Tambo. The provincial roads leading to those beaches are not in the good condition. Listen. There are heritage sites, Honorable Minister. Don't listen, Honorable, because they will mislead you. I'm telling you what is happening in the Eastern Cape so that you can do a follow-up. There are heritage sites. There are heritage sites in the Eastern Cape. All of them are not in good condition, such as King Yinsa's grave, Sachile, Fort Malan Memorial, Fort Boka, Mila Mission, and also the Chief Makoma
in Alice. We need your attention, Minister, on what I've mentioned here. Unyaka no nyaka, Minister, if we still remember, there's this thing, we call it Makufe in Bloemfontein. Why this thing of Makufe ingakhize kuthe Eastern Cape? Because Eastern Cape, it's so beauty. It's so beauty, Eastern Cape. You identify these areas that I've mentioned here. So, oh, Chairperson, can you please protect me? Hey. It is important, Minister, to go there in these places to witness what I'm talking about. You will see that Eastern Cape is being neglected by the system because it is rural. I thank you, Chairperson.
Honorable delegates, the next speaker on the visual platform was supposed to be the MEC for Economic Development, Environment and Conservation and Tourism in the Northwest, but she had it difficult to log in now. So we're going to go to the next speaker when she comes in, and then when he comes in, we'll be able to accommodate her. The next speaker is Honorable Dr. Skerkochal from the Free State.
Honorable Chairperson, Honorable Minister, Honorable members, and our local Islaka supporters, good day. Now, Chairperson, listening is a skill, so I did listen, and I thought to myself, I'm not going to waste my time on sweeping, because the South Africans placed their trust in me to represent them, because most of these speeches is the only thing that they can deliver. They don't contribute to South Africa. So, Minister Delil, you were once a mayor, and you will be the first to understand that if local government collapse, everything else follows. It only takes one pothole or one power outage, and the wheels comes off completely. Without sustainable, well-maintained local infrastructure, you don't have equitable economic growth. If you look at Cape Town, that was voted in 2025 at the Telegraph Travel Awards as the best city in the world, 7 times, and the second time we've received a reward like that. So we beat cities like Selville, Sydney. So good governance creates jobs. But South Africa should not be viewed as Cape Town and the Kruger National Park alone. This is not a tourism strategy. It's a geographical disposition. It creates a vacuum of opportunity for other provinces, where pockets of economic potential are overlooked because the spotlight is always on the big names. Chairperson, I rise here today to shine a light on the fireflies, those magical hidden roots that deserve attention. Like the big tree in the Tsitsikamma, the Leidenburg Heads, the Vaal Marina, the Nelson Mandela capture site in Howick, just to name a few. For South Africa's precious minerals are not diamonds and gold. It's our magnificent natural wonders, our heritage, our people. So let me take the House on a tourism field trip to my home, the Free State. We have 5 tourism routes: the eagle, the lion, the springbok, the flamingo, and the cheetah route, each with the potential to attract domestic and international tourists. But yet, I bet most of my fellow NCOP members from the Free State have never heard of them or even traveled on some of them, because our tourism sector lacks proper community-based tourism frameworks where the government, tourism institutions and civil society is synced. Now the line route is from Kroonstad to Verliers along the Vaal River. It offers river cruises, campgrounds, and the access to the Freefall Dome, where the cradle of humankind is. And Chairperson, I was childlessly excited to discover, as I shared to the DM last night, on an oversight visit there on the 5th of July, the Dome development is finally underway, a sign of life. And when I say a sign of life, I mean economic growth. Jobs, Chairperson, jobs. A means to provide for your family. Tourism equals economic growth, which means jobs, jobs, jobs. The Springbok route gives you towns like Fourie Smith, finalists in the Kwela Town of the Year, Phyllis, the home of Karoo craft beer. These initiatives feed into my opening statement that without proper municipal infrastructure, we have a plane without wings. The Flamingo route through my hometown of Unansrus holds the 4th largest concentration of flamingos in the world. The Cheetah route links Bloemfontein's arts heritage scenes with Ladybrand via Tabanchu, a corridor to untapped cultural tourism. And the past weekend, I completed the Eagle route, where the Godomodumo is located, which is part of my initiative, #Visit Free State, which has partnered with the Central University of Technology that will host Free State Uncovered, a tourism expo 19 to 20 September to ignite local tourism and job creation. Minister, DM, MEC, you've all been invited. It's already in your inboxes. But let me put it into context. My spending this weekend went straight into the Free State economy, 5,881.90 cents. Like when you say in the transport debate, when you move people, you move money. And what does it tell us? Locals sustain tourism and grow our local economy. That means job. Domestic travelers encourage deeper engagement and reinvest in heritage preservation and promote nation building. Tourism supported a total of 357 million jobs globally, which is approximately 1 in every 10. But we will not meet the department's 5 million arrival target if our infrastructure collapses, if we ignore the digital divide, and if we continue to centralize our market initiatives. Tourism is not about GDP, it's about dignity. It's about telling the world, our own people, that every province matters. Let us use tourism as a driver to restore small towns, to empower communities, and let's ensure that the benefits reach beyond postcards. Let's make South Africa a country where every firefly counts. I thank you.
Thank you, Honorable Dr. Skerkohal. The next speaker on the podium is going to be Honorable Dlamini from the Free State. Over to ma'am.
Yo, Nkosi yami. Honorable House Chair, good evening, my leader. Honorable Chief Whip, good evening, my leader. Honorable Minister, Honorable Deputy Minister, Honorable MECs, Honorable members of the National Council of Provinces, ladies and gentlemen, Dumela. As I take this opportunity to contribute to this important debate on budget votes to the aid to tourism, I would like to reflect on the words of UN Secretary General Antonio Guterres when he said, and I quote,
It is imperative that we rebuild the tourism sector in a safe, equitable, and climate-friendly manner, and to ensure tourism regains its position as a provider of decent jobs, stable incomes, and the protection of our cultural, natural heritage, unquote. As Honorable Modise was speaking about the education and regarded irrelevant, this emphasized the need of education because education, health, security, and many other aspects cut across all sectors, cut across all departments, cut across all sectors. I did not see the irrelevant. This is the reminder that there was a time when the tourism was completely shut down, and many people across the globe were negatively impacted by this in one way or the other.
In order, please.
Tourism is indeed a vulnerable sector and is susceptible to socio-economic and as well as climate shocks, with women, youth, workers, people with disability, and people in the informal economy bearing the brunt. That being said, we must appreciate the hard work and efforts of those operating in this sector as owners of tourism products, as our tour guides, safety monitors, serves in restaurants, hotels, B&Bs, etc. You are the backbone of this sector, and it is able to rise from any shock because of your resilience and hard work. We appreciate you wherever you are. Continue to make South Africa proud. Honorable House Chair, although the sector has yet to fully recover to pre-pandemic levels, it is showing great signs of resilience and strength. We thank the Honorable Minister, Deputy Minister, and the department at large. According to World Travel and Tourism Council, we are well underway to meeting surpassing pre-COVID numbers. Their economic impact research forecasts that by the end of this year, our tourism sector will be able to support 1.9 million jobs, surpassing 2019 levels and marking an all-time high, underlying its role as a key employer and a major source of opportunity, with the sector accounting for 11.3% of all jobs in South Africa. Minister, Deputy Minister, and the department, you are on the right track. Furthermore, the report focuses that the domestic tourism will contribute 445 billion to the economy, which is above 2019 levels by 3.8%. Tourism currently contributes 8.8% to our GDP and supports 1.68 million jobs. This positive momentum underscores the resilience of the sector despite global economic and climate pressures. Siyavuma, Minister and the Deputy Minister, including the department at large. We are concerned about the ongoing strike between Fly-Safair and Trade Union Solidarity. We hope that the labor dispute between the pilots and the company will be speedily resolved, as they are one of our main and reputable airlines trusted by South Africans. This strike takes place amid all brewing air access challenges due to high costs, protectionist policies, and a lack of direct international flights. These issues hinder the growth of tourism and economic opportunities in our country. Addressing them will require a multifaceted approach, including liberalizing air service agreements, attracting new airlines, and improving visa processes. Sukulindele, Minister and the Deputy Minister, we know we are on the track on this one. The ANC remains concerned that some big hotels do not appear in the list of graded establishments on the website of the Tourism Grading Council, but sell themselves as a five-star hotel. It is unfortunate that there currently is no way for the Tourism Grading Council of South Africa to enforce grading. The minister must deeply interrogate this and consider it as we undergo the Tourism Amendment Act processes. The revival of policies has been delayed and pushed back over the years in order to prioritize other burning issues. However, we want to urge the department and committee to fast-track the revival or reviewal of the following policies in the medium term. National Tourism Sector Strategy 2016, Tourism Sector Master Plan 2023, White Paper of the Development and Promotion of Tourism in South Africa 2024, Tourism BBBE Charter, Tourism Act number 3 of 2014, the National Heritage and Cultural Tourism Strategy of 2013, Domestic Tourism Growth Strategy of 2012 to 2020, National Rural Tourism Strategy of 2012, National Tourism Service Excellence Strategy of 2016. In conclusion, Chairperson, as we gear up for the national dialogue, whether others join or not, we want to call on all South Africans to embrace the opportunity, inform the direction and shape that our beautiful country ought to take so that generations to come find South Africa that is better than we found as the current generation. Honorable Mokoena, this budget is localized and is touching on the previously disadvantaged communities. It is just need our collective efforts as South Africans to ensure the implementation of this particular initiatives and interventions. Transformation agenda, Honorable Mokoena, need funding. There is no way that you are going to make these beautiful inputs you are making and you reject the budget. How these inputs are going to be implemented, because any interventions do need the budget. And we believe that if we work together in approving the budget of this country, we'll together be able to implement and different inputs, so as the EFF. You are having good inputs, however you are rejecting budget. You make it difficult for the collective to ensure that your inputs, the intervention that you are putting forth, which are very good and progressive, cannot be implemented. Mama Kennedy, in future, EFF has to approve the budgets. We can't continue like this. Honorable Masipa, my honorable member, I respect so much your good governance in Western Cape. We know it's Cape Town and surrounding suburbs. It doesn't talk to our people who are previously disadvantaged, who are still...
And Honorable Kennedy, please.
Thank you, Honorable Chair. It doesn't talk to our people, Honorable Masipa. Let us make sure that when you fly during the night, approaching Cape Town or Western Cape, what you are seeing or presenting in this house as a good governance, we see it in your suburbs. The dark places where the people like me and Honorable Sylvie, me and Honorable Sylvia are living. they are very dark and depressing. So as and when you land, Honorable Masipa, in Western Cape, you already feel the good governance of Cape Town, not the Western Cape. We appeal to you and the collective of Western Cape, as and when you do your good governance, please consider our people. Otherwise, our people will do you what you said they've done the ANC. Honorable Ego Mukaya, we know and understand all routes of tourism destination in our province. It is just that the people like me and Honorable Mudisi, who are living in villages and Kasi, they cannot afford to travel those routes so that they can experience what you are experiencing. But if they can afford, I can tell you, they know where those destinations are, and they will surely and definitely visit them. Let us, me and you, as collective Free Staters, ensure that the lives of our people do change for better, not pointing fingers to each other because we are now in the government of national unity. And the government of national unity, Honorable Chair, it is not about us being friends. We are not friends in the GNU. We shall never be. We are leading government because of how the people of South Africa voted for us. That is why we are together. And no one is better than the other in the GNU. We're supposed to be collective partners that are governed and led by the statement of intent as agreed upon to all of us, by all of us. So you have to stick to as well and stop behaving as if you are a better political party. And when honorable members come here, like Honorable Mundisa want to debate at this earlier on today, you felt offended and scared. I don't know why. What is wrong about education? I don't know, because all of us, Honorable House Chair, we include in our debates, to be honest, everything. There was nothing wrong that Honorable Mudise did, and we emphasize, and we are saying we respected the ruling of the Deputy Chair, but the ruling was unfair. Thank you very much.
So, honorable delegates, I think we're moving towards the end of this debate, which we had this afternoon. It had been long. So, Honorable Minister, you have heard what Team Tourism has said. Will you please respond to them?
Okay, let me start with the thank yous. Baie dankie and kosika cool to everyone. Sukran for all your contributions that you've made today. I came here to learn and to listen, and I certainly leaving with a lot of ideas. So thank you very much, and also thank you to the MECs. Honorable members, tourism is a concurrent function. And what we need, and the NCOP can help us with, we need more collaboration between national, province, and local. That is where some of the things are falling through the cracks. And we will certainly work hard from national to try and improve that. Honorable member spoke about the duplication of brand SA and SAT, but I briefly want to spend a minute to say what is the difference. There's a clear distinction between nation branding, which shapes South Africa's overall global identity across sectors like investment and government and governance, And this is the focus of Brand SA. While tourism focuses on destination marketing, which specifically markets our country's tourism appeal to attract visitors to come to our country. That is our mandate. So while the two forms of branding are connected, but they serve different audiences and different purposes. And I think at some stage we can debate it in the select committee, and then we can give further clarity on that. But then I agree with the speaker who said that Tata Madiba, we know he was always right, that tourism can absorb many semi-skilled and unskilled workers. The opportunity is there because of the entry level. And again, we need to work together on that. But the government cannot do it alone. There must be a partnership between the public sector and the private sector. Government contributes 1 billion rand towards marketing the country. The private sector contributes 33 billion rand. But the role of government, like Reverend Zondi said so today, the role of government is to create the conditions conducive for the private sector to create jobs. And what are we doing? Government must deal with the visa issues. And we've dealt with the visa issues. There's an interministerial committee of tourism, state security, and home affairs together. And in September, ETA, the electronic travel authorization, is coming, and that's going to be a big changer. Game changer for us. So we have to work together with the private sector. Nobody can claim credit alone, neither the private sector or the public sector, because we are doing it together. So the role and responsibilities is clearly identified. Domestic tourism is way past COVID-19 figures. Domestic tourism is the bedrock of our tourism sector. Like the honorable members acknowledge here today, what is the impact of domestic tourism? And we are working very hard. We have still not achieved our international arrival figures because we don't have that same number of planes coming to our country. And that's why we've got a route marketing development strategy. Briefly on safety and security, again, it's a partnership. The Department of Tourism put in 174 million, trained 2,300 tourism monitors, and the private sector developed an application, an app called the Secure app. Tourists can download that app even before they arrive in South Africa, and that gives them access to SAP, to private security, and to medical. I wish I could respond to all of the comments that were made, but certainly we will continue to debate this around infrastructure. And to Honorable Farmer, I made a very passionate speech. Ja, my broer, ons baisa nie. Massacred. No, I really enjoyed the debate this afternoon, Honorable Chairperson, and thank you for the opportunity. And let me say thank you to my Deputy Minister. We're two sides of the same coin, to DG Vele and the Department of Tourism and the Ministry. Thank you. I know sometimes, I'm a bit tough, but it's all for the good of the people of South Africa. I thank you and God bless you.
Thank you. Honorable delegates, I would like to thank the Minister, the Deputy Minister, permanent delegates, MECs, all special delegates, and SALGA representatives for availing themselves for the city. Honorable delegates, it had been a long day. The business of the House, that concludes the business of the House is adjourned.
You say no. I like it.
My GNU partner.
Let's put the house in the waiting room. Host, please put the house in the waiting room. Hello. Is the house in the waiting room now? Who's hosting?
Sorry, Secretary, please mute the chamber.
Yes, I want them. I want them to put the chamber in the waiting room, but nobody's responding. Hello.
Advocate?
Yes.
I can hear you in the chamber.
Ms. Mboto is a host. Dumisani Mabunda, co-host. Matlats Mabelano, co-host. Mr. Mulekwa, Nolundi, Tandi, Sotile. Where are they?
We're here, Advocate. I just spoke to Vuyo now, Advocate.
Where is Vuyo?
I just spoke to her now.
Okay.
Yes, Advocate.
All right. Thank you very much.
Okay, Advocate.
Is there anything colleagues that anyone would want to raise? Oh, because it has been a long day, we may adjourn. Anything?
Nothing, Advocate, on my side.
Maybe people are sleeping.
Nothing on my side as well.
Okay.
Nothing on my side as well.
Nothing on my side.
Okay. All right. No, thank you very much, colleagues. We can adjourn. Tomorrow we have a sitting tomorrow at I think at 2 o'clock. There are about 14 or so. I think about 12 items on the agenda. It's mainly the reports. I think there are 2 bills and several reports of the select committees. Hopefully tomorrow would not be as long as today. Okay, thank you very much. Adjourned.
Thank you, Advocate. Thank you, colleagues. Bye-bye.
Thank you.